Selamat datang di jurusan Akupunktur Poltekkes Surakarta, satu-satunya program pendidikan akupunktur milik pemerintah di Indonesia. Akupunktur modern bukan hanya warisan tradisi, kini ia berkembang, berpadu dengan ilmu medis, anatomi, fisiologi, hingga neuroscience. Di sini, kami menghadirkan pendidikan vokasi dan terapan yang lengkap, dari program D3 Akupunktur hingga sarjana terapan akupunktur dan pengobatan herbal. Program D3 kami mencetak praktisi akupunktur profesional yang siap berkarya di puskesmas, rumah sakit, hingga praktik mandiri. Sementara, program D4 menghadirkan pendekatan holistik, menggabungkan keilmuan akupunktur dan pengobatan herbal dalam satu kurikulum terintegrasi. Didukung oleh laboratorium pendidikan yang lengkap, mulai dari laboratorium dasar, lanjutan, anatomi, hingga diagnosis. Kami memastikan setiap mahasiswa menguasai teori dan praktik secara mendalam. Lulusan kami tersebar di seluruh Indonesia, mengabdi di layanan kesehatan, menjadi wirausaha, dan ASN. Jurusan akupunktur juga aktif dalam pelayanan masyarakat. Dalam peringatan Hari Kesehatan Nasional, booth akupunktur kami dikunjungi langsung oleh Menteri Kesehatan Republik Indonesia Budi G. Sadikin dan beberapa pejabat termasuk public figure. Sebelumnya, prestasi membanggakan juga diraih oleh ketua jurusan kami, Dr. Hanung Prasetya, SKP MSD, yang meraih juara 2 dosen berprestasi Poltekkes Kemenkes tingkat nasional 2024. Jurusan Akupunktur Poltekkes Surakarta terakreditasi unggul oleh Lampetekes untuk prodi D3 Akupunktur dan baik sekali untuk sarjana terapan akupunktur dan pengobatan herbal. Terus berinovasi dalam pendidikan dan layanan kesehatan. Kini melalui PMK nomor 19 tahun 2024, akupunktur terapis resmi diakui dan dapat diberdayakan di puskesmas, sebuah langkah maju untuk kesehatan masyarakat Indonesia. Bersama Hakti dan Kolegium Akupunktur, kami terus mendorong profesionalisme, pelatihan dan peningkatan kualitas layanan. Bergabunglah bersama kami menjadi bagian dari generasi akupunktur modern yang berbasis ilmu, tradisi, dan teknologi. Hanya di jurusan akupunktur Poltekkes Kemenkes Surakarta. Terima kasih.
Kesehatan seutuhnya bukan hanya tentang menyehatkan raga, tapi juga menyehatkan jiwa. Nusantara Dharma Holistik hadir sebagai yayasan dan lembaga pelatihan yang kredibel dan terdepan bagi para profesional yang ingin mengembangkan potensi di bidang integrative medicine di Indonesia. Memberikan solusi yang nyata dalam bidang integrative medicine untuk menjawab masalah kesehatan masyarakat di Indonesia dengan prinsip integratif, yaitu berbasis bukti, dapat diukur, dapat dipertanggungjawabkan, efektif, efisien, dan minimal atau tanpa efek samping. Nusantara Dharma Holistik diasuh langsung oleh Dr. Medical Franciscus Saverius Sulistyo Winarto atau yang lebih kita kenal dengan nama Pak Kiki Sulistyo, yang memiliki cita-cita luhur untuk memajukan integrative medicine di Indonesia. Nusantara Dharma Holistik berkomitmen menyelenggarakan kegiatan-kegiatan ilmiah dengan skala nasional maupun internasional yang dibawakan oleh para narasumber yang berkompeten di bidang masing-masing. Mari bergabung bersama dengan Nusantara Dharma Holistik untuk memajukan integrative medicine di Indonesia. Tingkatkan kompetensi diri kita dan jadilah akupunktur terapis yang unggul dan berkompeten.
Sebagai pelopor di dunia medis dalam teknologi laser, RJ Laser terus mengembangkan produk berkualitas tinggi dengan teknologi terkini. Mengkombinasikan 3 jenis terapi secara simultan dalam satu kali aplikasi, yaitu iradiasi lokal langsung, aktivasi titik akupuntur, dan iradiasi sistemik melalui sirkulasi darah. RJ Laser Pen telah terjual ribuan unit di seluruh dunia dengan desain yang sangat ergonomis dan praktis. Dilengkapi dengan layar LCD yang mudah dibaca, pengaturan dengan satu tangan, dan beragam mode terapi yang dapat disesuaikan dengan kondisi pasien. RJ Laser Pen memiliki berbagai pilihan aplikator yang dapat digunakan untuk permukaan tubuh yang luas, mulut atau tenggorokan, trigger points, dan titik akupuntur. Memiliki berbagai macam biofrekuensi yang sudah terprogram dan banyak digunakan pada akupuntur modern telinga dan tubuh. Dengan RJ Laser Pen, kami menawarkan sensasi terapi akupuntur yang nyaman tanpa rasa sakit, sehingga cocok untuk anak-anak dan pasien dengan toleransi nyeri yang rendah. The original laser pen, powerful, compact, and versatile.
Selamat datang di jurusan Akupunktur Poltekkes Kemenkes Surakarta. Kami dengan senang hati menyambut kehadiran Bapak, Ibu, dan sahabat semua di kampus kami yang berlokasi di Jalan Lejen Sutoyo, Mojosongo, Jebres, Kota Surakarta. Selain menjadi pusat pendidikan, kawasan sekitar kampus juga dikelilingi berbagai fasilitas penting yang memudahkan tamu dari luar kota. Akses transportasi. Untuk transportasi, lokasi kampus sangat strategis dan dekat dengan berbagai sarana utama. Terminal Tirtonadi, terminal bus terbesar di Solo, berjarak sekitar 4 km. Stasiun Solo Balapan, stasiun kereta utama, berjarak sekitar 3 km. Stasiun Solo Jebres juga melayani perjalanan jarak jauh berjarak sekitar 3 km. Stasiun Purwosari di sisi barat kota berjarak sekitar 4 km. Untuk akses jalan tol, kampus ini dekat dengan pintu tol Gondang Rejo dan pintu tol Solo. Keduanya bisa dicapai sekitar 10 menit perjalanan dengan kendaraan. Fasilitas kesehatan. Untuk layanan kesehatan, tamu tidak perlu khawatir. Beberapa rumah sakit besar berada tak jauh dari kampus, di antaranya Rumah Sakit Dr. Untuk Surakarta, Rumah Sakit Umum Daerah Dr. Muwardi, Rumah Sakit Hermina, Rumah Sakit Pantiwangiyo, dan Rumah Sakit PKU Muhammadiyah. Selain itu, terdapat pula apotek yang mudah dijangkau seperti apotek K24, apotek Afiat AA, dan apotek Medika Prima. Akomodasi hotel. Bagi kamu yang berencana bermalam, tersedia pilihan hotel dengan berbagai kelas, mulai dari Swiss Bell Hotel Solo dan The Royal Surakarta Heritage untuk hotel berbintang, hingga Hotel Asia dan UNS Inn yang lebih ramah di kantong. Selain itu, Solo Paragon Hotel juga menjadi pilihan populer karena terhubung langsung dengan pusat perbelanjaan modern. Wisata dan budaya. Solo dikenal sebagai kota budaya yang kaya dengan destinasi wisata. Dari kampus, kamu dapat dengan mudah mengunjungi Keraton Surakarta Hadiningrat dan Pura Mangkunegaran, pusat sejarah dan budaya Jawa. Pasar Klewer, Pasar Gede, dan Pasar Grosir Solo, surga belanja batik dan kuliner tradisional. Masjid Syekh Zayed Solo, ikon religi baru yang megah. Solo Safari atau Taman Satwa Juruk yang cocok untuk wisata keluarga. Semua destinasi ini dapat ditempuh rata-rata dalam 10-20 menit dari kampus. Demikianlah informasi mengenai fasilitas dan destinasi penting di sekitar jurusan Akupunktur Poltekkes Kemenkes Surakarta.
Bapak Ibu hadirin yang kami hormati, webinar laser akupuntur ini dapat terlaksana berkat kerjasama antara Poltekkes Kemenkes Surakarta, DPD Hakti Jawa Tengah, Kolegium Akupuntur Terapis, dan Nusantara Dharma Holistik dengan sponsor tunggal dari RJ Laser Indonesia. Ini merupakan kolaborasi pertama yang bertujuan untuk mendorong kemajuan keilmuan akupunktur dengan menghadirkan update ilmu terkini dan membuka wawasan baru bagi para praktisi akupunktur. Pada kesempatan yang sangat istimewa ini, kita kedatangan salah satu pakar terbaik di bidang laser akupunktur, yakni Dr. Michael Weber. Beliau telah khusus terbang dari Jerman untuk workshop ini, luar biasa ya. Selama 2 hari ke depan kita akan mendalami dunia akupuntur laser. Pada hari pertama kita akan mempelajari dasar-dasar photobiomodulation, prinsip akupuntur laser serta perbandingannya dengan akupuntur jarum logam tradisional. Dan pada hari kedua kita akan masuk ke sesi praktik dan demonstrasi sehingga Bapak Ibu dapat merasakan secara langsung bagaimana metode ini dapat memperkaya praktik akupuntur dan memberikan manfaat bagi peserta dan bagi pasien-pasien kita. Workshop ini bukan hanya kesempatan untuk memperoleh ilmu baru, tetapi juga untuk saling bertukar pengalaman, membangun jejaring dan membuka wawasan terhadap inovasi dalam dunia laser akupunktur. Meskipun sebagian peserta, mungkin Bapak Ibu yang di sini belum memiliki peralatannya, tetapi pengalaman dan pengetahuan yang diperoleh di sini akan tetap menjadi bekal berharga di masa mendatang. Mari kita mulai perjalanan pembelajaran ini dengan pikiran terbuka, semangat positif dan hati yang penuh antusiasme. Sebelum acara dimulai, Bapak dan Ibu, izinkan saya menyampaikan beberapa aturan selama workshop ini berlangsung. Pertama, mohon kepada seluruh peserta untuk mengatur ponsel dalam mode silent. Kedua, akan ada sesi tanya jawab dan pertanyaan dapat dituliskan melalui Google Form yang sudah disediakan panitia, dan pertanyaan tersebut akan diterjemahkan secara langsung dan dijawab oleh Dr. Weber. Untuk mendukung kelancaran workshop ini, acara ini menggunakan aplikasi terjemahan yang nantinya Anda dapat lihat secara langsung di layar monitor. Dan selain itu, materi video akan dibagikan melalui YouTube dan sudah dilengkapi dengan subtitle. Untuk menambah semangat kita, Bapak dan Ibu, marilah kita mendengarkan sambutan dari Ketua Jurusan Akupunktur, Ketua Kolegium Akupunktur Terapis Indonesia, dan Direktur Poltekkes Kemenkes Surakarta. Sambutan yang pertama akan disampaikan oleh Ketua Jurusan Akupunktur, Poltekkes Kemenkes Surakarta, kepada Dr. Hanung Prastia SKP MSI. Disilahkan.
The Honorable Dr. Michael Weber as a message for seminar and workshop. Yang kami hormati Ketua Kolegium Akupunktur Republik Indonesia, Direktur Poltekkes Kemenkes Surakarta, Ketua Umum DPP Perhimpunan Terapis Indonesia, Ketua Asosiasi Pendidikan Tinggi Akupuntur Indonesia, para pimpinan pendidikan akupuntur di Indonesia, para guru besar, tamu undangan dan peserta workshop. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Om Swastiastu, Namo Buddhaya, salam kebajikan. Segala puji dan syukur kita naikkan kehadirat Tuhan Yang Maha Kuasa atas limpahan berkah, rahmat dan nikmat-Nya sehingga acara ini dapat diselenggarakan. Bapak Ibu yang kami hormati, saya sebagai Ketua Jurusan Akupuntur dengan penuh kehormatan dan antusiasme menyambut dengan tangan terbuka acara workshop penting dan inovatif hari ini. Laser Akupunktur Akupunktur Koordinasi Teknik. Di tengah percepatan kemajuan teknologi dan transformasi dunia kesehatan, kita sebagai pelaku ilmu akupuntur harus mampu berinovasi tanpa kehilangan jati diri dari ilmu dan sumber tersebut. Maka dari itu, tema dari hari ini tentang laser akupunktur dari akupunktur koordinasi teknik bukan sekedar tren, melainkan langkah strategis dalam praktek akupunktur di era modern. Laser akupunktur sebagai pilihan tindakan yang nyaman dapat memberi peluang besar untuk pasien yang khawatir pada jarum, khususnya pada anak-anak, orang tua, bahkan mereka yang secara psikologis sensitif terhadap prosedur tindakan invasif. Dengan sinar laser yang terkendali, kita dapat merangsang titik-titik akupuntur secara presisi, aman dan efisien. Ini bukan pengganti jarum, tapi pelengkap, penguat, dan jembatan menuju pelayanan kesehatan yang lebih inklusif. Sementara itu, the Rhythmic Akupunktur Coordination menawarkan pendekatan baru dalam penyusunan prosedur akupunktur. Fokus pada ritme alami tubuh, sinkronisasi antar titik, dan interaksi dinamik antara sistem saraf dan energi atau qi. Dengan teknik ini kita tidak hanya menyuntik titik, tapi kita berkomunikasi dengan tubuh secara keseluruhan. Mewakili jurusan Akupuntur Poltekkes Kemenkes Surakarta, kami sangat bangga terhadap kehadiran Dr. Michael Weber yang telah berkontribusi nyata dalam pengembangan teknik-teknik inovatif ini. As far as I know, Dr. Michael Weber is the president of the European CM Academy. He is one of Europe's leading experts in the field of mitochondrial medicine. He was developed a combination protocol akupunktur, laser akupunktur, and mitochondrial medicine for conditions such as ADHD, concentration problem, sleep disorder, allergic disease, atrial fibrillation, and infectious disease. Applause for him. Tepuk tangan untuk beliau. Ya. Thank you, Dr. Weber. Dr. Michael Weber, Presiden dari European CM Academy, dan beliau merupakan salah satu pakar terkemuka di Eropa dalam bidang mitochondrial medicine. Beliau juga mengembangkan protokol kombinasi akupuntur laser dan mitochondrial, termasuk untuk kondisi seperti ADHD, masalah konsentrasi, gangguan tidur, penyakit alergi, fibrilasi atrium, dan penyakit menular. Thank you so much, Dr. Michael Weber, for coming to Solo, city of culture with a variety of special infos. Hopefully in the committee will be able to take you around Solo. Bapak Ibu yang kami hormati, semoga sharing ilmu hari ini tidak berhenti di ruangan ini, tapi menjadi pemicu gerakan baru dalam dunia akupunktur Indonesia yang lebih adaptif, ilmiah dan nyaman. Untuk semua peserta, semoga ilmu ini memberikan pencerahan. Mari kita belajar, berdiskusi, dan bertukar ide, tentunya dengan semangat untuk berinovasi demi kesejahteraan manusia. Terakhir, saya mengucapkan terima kasih yang setulus-tulusnya kepada panitia penyelenggara yang telah bekerja sangat keras dan penuh semangat. Saya tahu perjuangannya sangat berat sekali. Terima kasih kepada semua panitia, juga jajaran Kolegium Akupuntur, organisasi profesi dan institusi pendidikan yang berperan dalam kegiatan ini, dan juga sponsor utama. Terima kasih. Mari kita jadikan hari ini sebagai satu langkah dalam perjalanan menuju akupuntur masa depan. Lebih canggih, lebih manusiawi, dan lebih berdampak. Karena ilmu yang tidak berkembang adalah ilmu yang berhenti bernafas. Sekali lagi, selamat datang dan selamat mengikuti workshop hari ini sampai selesai. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Terima kasih atas sambutan dan semangatnya, Bapak Ketua Jurusan Akupunktur. Sambutan yang kedua dari Ketua Kolegium Akupunktur Terapis kepada Bapak Ardian Prabowo, STR Akup, disilahkan.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi. Yang saya hormati Ketua Panitia Kegiatan beserta dengan seluruh panitia kegiatan hari ini, Internasional Webinar and Workshop Laser Puncture and the RAC Teknik Pain Free Treatment of Musculoskeletal Pain Digestive and Pediatric Condition. Yang saya hormati Direktur Poltekkes Kemenkes Surakarta, dalam hal ini diwakili oleh Bapak Wadir 1. Yang saya hormati pula Kepala Jurusan Akupuntur Poltekkes Kemenkes Surakarta, Bapak Hanung Prasetya. Yang saya hormati Ketua Asosiasi Pendidikan Tinggi Akupuntur Indonesia. Yang saya hormati Ketua Umum Dewan Pimpinan Pusat Perhimpunan Akupuntur Terapis Indonesia periode tahun 2025-2030. Yang saya hormati Kaprodi D3 Akupuntur, Kaprodi Sarjana Terapan Akupuntur dan Pengobatan Herbal, serta seluruh dosen dan staf pengajar di Poltekkes Kemenkes Surakarta. Narasumber pada kegiatan hari ini, our keynote speaker, Dr. Michael Weber. It was an honor to meet Dr. Weber, and I want to say thank you for coming to Indonesia. We know in the past few days there have been many demonstrations in Indonesia. I was worried that Dr. Weber would be able to attend to this event. But today, Dr. Weber are here. Once again, thank you, Dr. Weber. Applause to Dr. Weber. Yang saya hormati pula seluruh tamu undangan yang tidak bisa saya sebutkan satu persatu, serta peserta yang berbahagia pada hari ini. Pertama-tama marilah kita panjatkan puji syukur atas kehadirat Allah Subhanahu wa Ta'ala, Tuhan Yang Maha Esa, karena atas limpahan keberkahannya kita bisa dipertemukan pada kegiatan yang berbahagia ini. Saya berharap dengan kegiatan ini, Bapak Ibu dan rekan-rekan yang mengikuti kegiatan ini, khususnya yaitu akupuntur terapis, semakin berperan dalam mewujudkan kesejahteraan bagi masyarakat, terutama dalam meningkatkan derajat kesehatan masyarakat Indonesia melalui keilmuan akupuntur. Bapak Ibu sekalian, seperti kita ketahui bahwa beberapa waktu yang lalu Undang-Undang Kesehatan, yaitu Undang-Undang Nomor 17 Tahun 2023 dan peraturan turunannya, yaitu Peraturan Pemerintah Nomor 28 Tahun 2024 sudah diundangkan dan dijadikan sebagai dasar aturan kesehatan terbaru di Indonesia. Salah satu isi dari pasal tersebut adalah kewajiban bagi tenaga medis dan tenaga kesehatan, dalam hal ini khususnya ialah akupuntur terapis, untuk menjaga dan meningkatkan mutu dengan cara mengikuti kegiatan-kegiatan pelatihan dan atau kegiatan peningkatan kompetensi lainnya, termasuk webinar dan workshop pada hari ini. Kita tahu bahwa perkembangan ilmu akupuntur di dunia berkembang sangat cepat. Tadi sudah dijelaskan oleh Bapak Hanung terkait dengan bagaimana laser akupuntur di dunia ini. Oleh karena itu, tentunya di Indonesia ini dibutuhkan suatu inovasi-inovasi yang bisa digunakan untuk menambah keterampilan ilmu akupuntur. Seperti arahan dari Bapak Menteri Kesehatan, Bapak Budi Gunadi Sadikin, ketika rapat bersama secara luring beberapa waktu yang lalu, yaitu bagaimana kesehatan di Indonesia itu bisa semakin maju dan berkembang. Salah satunya yaitu mengikuti perkembangan dan inovasi kesehatan yang ada di dunia. Oleh karena itu saya merasa sangat bahagia karena Kolegium Akupunktur Terapis merupakan bagian dari kegiatan pada hari ini, yang mana kegiatan hari ini untuk meningkatkan kompetensi akupunktur di Indonesia yang saat ini bertaraf internasional. Terakhir, atas nama Ketua Kolegium Akupunktur Terapis, saya mengucapkan selamat belajar bagi seluruh peserta. Semoga kegiatan pada hari ini berjalan dengan lancar, sukses, penuh manfaat, dan saya berharap kegiatan-kegiatan seperti ini akan selalu dilakukan untuk meningkatkan pelayanan akupunktur terutama di Indonesia. Saya mohon maaf jika dalam penyampaian kata ada salah dan perbuatan. Segala hal-hal yang baik yang kita lakukan pasti akan kembali baik pula kepada kita. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih kepada Ketua Kolegium Akupunktur Terapis Indonesia atas sambutan dan semangatnya. Sambutan selanjutnya adalah dari Direktur Poltekkes Kemenkes Surakarta. Dalam hal ini diwakili oleh Wakil Direktur 1 kepada Bapak Adi Mardi MN, disilahkan.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Om Swastiastu, Namo Buddhaya, salam kebajikan, salam, selamat pagi, salam sehat, salam tangguh. Yang terhormat, the honorable special guest in Poltekkes Kemenkes Surakarta this morning, Dr. Michael Weber from German. Welcome to Indonesia, welcome to Surakarta, and welcome to Poltekkes Kemenkes Surakarta. Thank you very much for coming, and thank you very much for sharing the knowledge for today. Yang saya hormati, saya banggakan, Ketua Kolegium Akupunktur Terapis Bapak Ardian Prabowo, Sarjana Terapan Akupunktur. Selamat datang Bapak di Surakarta. Yang saya hormati Ketua Umum DPP Perhimpunan Akupunktur Terapis Indonesia Bapak Solikan Badri MPH yang sudah berkenan rawuh pula di Poltekkes Kemenkes Surakarta. Kemudian yang saya hormati jajaran pimpinan jurusan akupunktur, Bapak Ketua Jurusan Pak Dr. Hanung, beserta para kaprodi, sekretaris jurusan, dosen, dan sivitas akademika jurusan akupunktur. Yang saya hormati dan saya banggakan segenap undangan para guru besar yang sudah rawuh di tengah-tengah kita, matur nuwun kerawanya. Dan tentunya juga yang berbahagia saya hormati, saya banggakan seluruh peserta Internasional Webinar and Workshop Laser Akupunktur. Di penghujung kegiatan pada pagi hari ini, marilah senantiasa kita panjatkan puji syukur kehadirat Allah Subhanahu wa taala yang senantiasa melimpahkan rahmat serta hidayahnya pada kita, sehingga syukur alhamdulillah pada kesempatan pagi hari ini kita tetap diberikan nikmat sehat, nikmat sempat, nikmat selamat, dan tentunya nikmat ikhlas. Bapak Ibu sekalian, berkenan izin Bapak Direktur Poltekkes Kemenkes Surakarta pada pagi hari ini tidak bisa membersamai kita karena bersamaan dengan kegiatan kerawuan Dewan Pengawas yang pagi hari ini melaksanakan kunjungan ke Poltekkes Kemenkes Surakarta di kampus 3, kampus kami yang ada di Klaten. Sehingga beliau menitipkan pada kami untuk mendampingi kegiatan pada pagi hari ini, dan Pak Direktur menyampaikan ucapan selamat datang kepada seluruh peserta narasumber yang sudah berkenan hadir di Poltekkes Kemenkes Surakarta. Seperti yang telah dilaporkan oleh Bapak Ketua Jurusan bahwa kegiatan pada pagi hari ini adalah kegiatan yang luar biasa, kegiatan untuk peningkatan kompetensi, kapasitas rekan-rekan sejawat akupunktur dalam pengembangan profesi. Dan sebelumnya perlu kami kenalkan Bapak Ibu sekalian terkait dengan Poltekkes Kemenkes Surakarta ini, bahwa Poltekkes Kemenkes Surakarta ini adalah perguruan tinggi negeri di bawah Kementerian Kesehatan. Kami adalah Poltekkes di antara 38 Poltekkes yang ada di Indonesia. Alhamdulillah Poltekkes Kemenkes Surakarta ini mendapatkan predikat Poltekkes terbaik di Indonesia ditinjau dari kesehatan, manajemen, keuangan, dan manajemen yang terkait. Mohon tepuk tangannya dulu untuk Poltekkes Kemenkes Surakarta. Terima kasih. Dan alhamdulillah kami memiliki 20 prodi, di mana 17 diantaranya sudah terakreditasi unggul. Hal ini menunjukkan bahwa kami berkomitmen untuk memberikan pelayanan kepada masyarakat, utamanya pada mahasiswa, dan layanan kami alhamdulillah sudah melampaui standar dikti karena sudah 80% terakreditasi unggul. Kemudian khusus untuk akupunktur ini juga luar biasa, di antara 38 Poltekkes baru ada satu yang ada di Surakarta ini, sehingga Bapak Ibu, saudara-saudara sekalian yang rawuh, yang hadir pada kesempatan pagi hari ini, mohon dukungannya agar supaya prodi-prodi kami, utamanya prodi akupunktur, bisa terus berkembang dan tentunya juga membawa dampak yang positif terhadap pembangunan kesehatan yang ada di Indonesia. Sebagaimana kita ketahui bersama bahwa Menteri Kesehatan pada saat ini telah memberikan amanah pada kita, yaitu untuk mengawal transformasi kesehatan, ada 6 pilar, dan peran dari akupunktur ini luar biasa. Permen yang terkait dengan puskesmas, Bapak sekalian, di pasal 21 ini sudah mengamanahkan bahwa lulusan akupunktur ini merupakan tenaga kesehatan yang memang bisa diberdayakan untuk layanan puskesmas. Sehingga pada kesempatan pagi hari ini, syukur alhamdulillah, kita dihadiri juga oleh Bapak Ketua Kolegium. Kami titip Pak Ketua Kolegium untuk mengawal lulusan-lulusan kami yang mana pada saat ini tadi beliau sudah menyampaikan baru sedang digodok dengan pemerintah terkait dengan jabatan fungsional akupunktur. Kami berdoa, kami mendukung Bapak agar supaya kegiatan ini bisa lancar dan tentunya segera membuahkan hasil. Sehingga alumni-alumni kita, alumni akupunktur yang ada di Indonesia ini nantinya terwadai secara profesional, utamanya pada layanan formal terhadap masyarakat. Terkait dengan kegiatan pada pagi hari ini luar biasa, kami selaku pimpinan Poltekkes Kemenkes Surakarta mengucapkan apresiasi kepada Ketua Jurusan Akupunktur yang sudah menyelenggarakan kegiatan luar biasa. Kami kaget tadi dilapori Pak Hanung, Pak minta sambutan pembukaan untuk kegiatan internal seminar, masuk ke ruangan langsung ketemu Pak Ketua Kolegium. Terima kasih. Kemudian ada narasumber dari Jerman, kemudian dihadiri pula oleh para guru besar dan para pakar di bidang akupunktur terapis. Sekali lagi kami ucapkan terima kasih, dan Poltekkes Kemenkes Surakarta selalu siap untuk mendampingi, untuk berpartisipasi dan tentunya untuk berkontribusi terhadap peningkatan pengembangan keilmuan akupunktur, terutama akupunktur terapis. Saya kira demikian Bapak Ibu sekalian, tanpa panjang lebar, melaksanakan amanah dari panitia mewakili pimpinan Poltekkes Kemenkes Surakarta. Marilah Internasional Webinar and Workshop Laser Akupunktur and RAC Teknik Pain Free Treatment of Musculoskeletal Pain Digestive and Pediatric Conditions. Kita buka secara resmi dengan bacaan basmalah. Bismillahirrahmanirrahim. Demikian, selamat mengikuti kegiatan peningkatan kapasitas dan kompetensi pada hari ini. Semoga Bapak Ibu sekalian nyaman berada di Poltekkes Kemenkes Surakarta, dan tentunya kami siap membantu apapun keperluan yang diperlukan pada kegiatan peningkatan kapasitas pada pagi hari ini. Demikian, mohon maaf, saya akhiri. Wabillahi taufik wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Matur nuwun. Matur nuwun.
Terima kasih atas sambutan dan arahan dari Wakil Direktur 1 Poltekkes Kemenkes Surakarta. Sekali lagi terima kasih atas perhatian Bapak dan Ibu. Selamat mengikuti workshop dan semoga dalam menimba ilmu selalu penuh dengan semangat, dan semoga acara ini bermanfaat, menginspirasi dan meninggalkan kesan mendalam bagi kita semua. Oke, Bapak, Ibu dan hadirin yang kami hormati, marilah kita sambut narasumber kita, Dr. Michael Weber.
Ladies and gentlemen, please join me in welcoming our distinguished guest and speaker, Dr. Michael Weber, to the stage.
Mohon berkenan berfoto bersama Dr. Michael Weber, Wakil Direktur 1 Poltekkes Surakarta, Ketua Jurusan Akupunktur, beserta Bapak Ibu tamu undangan. Untuk Bapak Ibu peserta dimohon untuk berdiri karena kami akan mengambil gambar dari atas panggung. Persiapkan senyum terbaik Bapak dan Ibu, kita buat momen ini lebih berkesan. Monggo Pak. Satu, dua, tiga. Hadirin dipersilakan duduk kembali. Oke, mohon berbalik. Ya. Untuk Bapak Ibu dari Zoom, silahkan membuka kameranya.
Selamat pagi Bapak Ibu sekalian. Good morning ladies and gentlemen. Please welcome Dr. Michael Weber. So the time, states and mic is...
I don't know where to start. I'm coming from Europe, I'm coming from a different background. However, I absolutely enjoyed the opening. Now It's a little bit changing. Thank you very much. Perfect. Yeah, I think these days the world demands peace. So, salam alaikum. In Germany, we are starting to lose our traditions. I'm so impressed how a conference like this can start. I'm really touched. In Germany, we are not allowed to sing our national anthem anymore. They want to rape the flag from Germany. They want to get the flag out of Germany. I think one of the important things, this is coming already a little bit into the topic. All of us have a fantastic medical education. You have your own medical traditions. So never forget your personal backgrounds. Never forget what you've learned so far in medical schools, in schools of occupational therapy, physiotherapy. Integrate, I like to share the upcoming days in your own education. I think now none of us, we are all humans, none of us can claim to bring the ultimate truth. Many things that I've been lecturing over the last 15 to 20 years did change a bit. So we are minded in what we are doing. Yeah, for almost 2 decades now, I'm traveling all over the world to share the ideas of traditional Chinese medicine, the ideas of laser acupuncture, so replacement of the metal needle by the light needle. No, you have to stay for a second. No, don't go. Before, yeah, may I ask the 2 or the 3 of you to come up again? And of course you. And where is your friend?
Lily.
So I couldn't bring. I didn't know how many people would attend. However, as many of you may know, in 2014, together with an anesthetist from Stuttgart, I published the first textbook on laser acupuncture. So it's a big honor to donate a copy of this book to the university and to the acupuncture associations. So thank you very much. Many things that I'm going to share the upcoming 2 days. Most of the things you find in this textbook, and I hope it will be a big use for yourself and for the students as well. So thank you very much for inviting me, and yeah, let the light shine for the well-being of our patients. Thank you. And as I heard, we have another special guest from the medical university. So may I give you a copy of this book as well? Professor Ida. So very, very nice to have you here. Thank you for inviting me. And have 2 backgrounds. On the one hand, I'm a fully trained Western medical doctor. On the other hand, I got a doctorate degree in Chinese medicine. So Thank you very much. You will find many information about photomedicine that are far above the acupuncture.
Once more. More. 1, 2, 3.
So, and now the two of you have to come. Yeah. Yesterday, there you are. Please come up to the stage. No, you. Don't be shy. So, it's before such an event can take place, there are many people involved in the background, all the technicians, but there are two ladies with whom I've been discussing by email, by WhatsApp. They are very good in answering, very poor in answering once in a while. These days I'm living in Portugal, so I brought a memory from Portugal for both of you. Thank you very much for having me over. Of course. Yeah, I think any official things to add or start? Yes. May I ask in the very beginning, is there anybody who had ever before a laser pen in his hand? One. This makes it a bit easier. Sometimes in the audience there are 10%, 20% who have already lots of experience and the other never touched a laser. So I can start in the presentation from the very beginning. Can you switch over to the slides? Yeah, 30 years, maybe 35 years ago, I started my medical education, and from the first day of my medical education, I realized in the acute situation, Western medicine, allopathic medicine is fantastic, but in the more chronic situation, Western medicine is somehow blinded on one eye. So in the chronic conditions, we do need idea support from other approaches towards medicine. I think if we go in Western medicine really to the root of the disease, if we look what's going on cellular level, if we don't forget about physiology and pathophysiology, we will realize that we even in many chronic diseases, we get a better approach with the only, in comparison to the only use of defined chemical substances. Is it okay from the translation or is it too fast? It's running. Good. So by now I'm graduated as a doctor of medicine and another thesis I did in Chinese medicine, of course, on the field of laser acupuncture. I was the first director of the biggest congress of Chinese medicine out of Asia, Rothenburg Congress, which always takes place in May. And nowadays I'm the chairman of the World Acupuncture Forum, which takes place once a year in March in Davos, where the World Economic Forum takes place as well. So you are more than welcome to come in the next years. It takes 5 days, the World Acupuncture Forum in Davos. Yeah, this I should have Why is it not working? Ah, there it was. Salman Paji. Yeah, the outline for the next 2 days, and or basically for today, you see laser is working for animals as well. And beside my family, this is the living who is missing me the most these days while I'm traveling. I will do some introduction, what laser acupuncture is and what photomedicine can offer. I will talk about the difference between inserting a needle and applying light from outside. Any given acupuncture point can be treated with a laser. On specific request, we will go in quite a bit of detail, and I'm sure you will learn some more information than Kiki has given so far about the Teknik of the VAS or the RAC. We will see that especially in this field, the laser offers unique opportunities that are not possible to apply with a needle. We will look what can laser and photobiomodulation do in wound healing. This is probably the most fantastic field where you see most obviously the changes. You can see the laser in neuromuscular pain. We will focus on shoulder pain. We will look about the power of laser in obesity. We will look in pediatric diseases today, mainly on attention deficit disorder. Tomorrow in the workshop, we will go in the treatment for allergies. And in the end, I'd like to give some outline what photomedicine might be in 5 years, in 10 years, and I will share with you some really mind-blowing results about the power of light. Well, the old Chinese people have as much inhabitants as they have proverbs. One of the proverbs is not even the dragon is going new paths, even the dragon only goes paths that have been gone before. So I hope from tomorrow or day after tomorrow, you'll get the motivation to go in a new ways and new paths. Yeah, sharing the ideas of photomedicine is for me already an idea for more than 15 years, and I've been doing part of my education in China, and I've been visiting China on conferences quite often. This was a conference in Chengdu in China, and you see it was 2018, and it was the Young TCM Talents Forum. Now I'm old, so I can't go to Young Talents Forum anymore. What I like at the writing over TCM never stops advancing. I think this is the truth for whatever medicine we do. We should never stop to get better. Or another Chinese proverb, a good teacher remains a student until the end of the life. Well, in all medical traditions, not only in medical traditions, but in all religions all over the world, the power of sun is acknowledged. In ancient Egypt, the highest god was Ra. He was always shown with the sun on his head. In Western medicine, the big father of Western medicine is Hippocrates from Greece, from Kos. He established a center, a Helios center, and treated jaundice with the power of light. We nowadays, in neonate intensive care units, irradiate children with jaundice, with blue light. So we have a good experience about the power of light. But more, every living on this earth demands on the power of light. And being in an acupuncture school, the monad of yin and yang reflects the power of light. What do the plants do? The plants absorb light and grow. So we always hear in Chinese education, yin and yang are constantly transformed from one form into the other. One form demands on the other status. It's constantly moving from one form to the other. And this is what we see in the light. The plants absorb, grow, and in the winter we put, probably not here in warm Indonesia, but in Europe, we put the plants, the branches, the wood into fire to transform the stored yin energy into heat again, into kinetic energy. This has been described in the Taoistic principle 4,000 years ago. And nowadays in physics, modern physics, we learn the same. One of the most important statements of modern thermodynamics is energy never can be created, energy can only be transformed from one form into the other. So this is the idea of the laser, and when we look into the Chinese tradition, the king of medicine, as China calls him, is Sun Simiao. To the legend, he lived more than 100 years and published more than 60,000 scientific papers. Well, many of them will be published by his students. Anyhow, he was the first one to talk about laser. Now he was the first one to talk about the power of light. And what we know nowadays, little light, little laser light is much better than a high amount of laser light. Therefore, quite often we talk about LLLT, low-level laser therapy. So, this is Sun Simiao venerating the root. And interesting enough, modern science could show the plant, the leaf, tells the root, I need supplements from the source, from the ground. And the force between the communication are laser-like impulses. So even these plants communicate with laser-like impulses. The presentation changed. Who can read Chinese? No. Good. So maybe you can translate for us. Okay. So Sun Simiao said in his publication, worth 1,000 pieces of gold, Beiji Zhenjiu Xiaofang, expose babies periodically to the wind and the sun. If they are never exposed to wind or sun, this becomes the skin to become brittle. Yes, we know we need some amount of sun to produce vitamin D3. Whenever the weather is mild and warm without too much wind, have the mother to take the baby out into the sun to play. Frequent exposure to the sun congeals the blood and firms up the qi. And what is the issue? Maybe not that bad here in Indonesia, but in Europe, the children become addicted to the modern technologies, addicted to the cell phones, to the computers. So this is what Sun Simiao already did know. If babies are constantly behind the curtains, they behave like grass under huge shady trees. So we know the plants need the light. We are beings of light as well. This is quite a while ago, when we were still living in Germany. You see the pasture with the horses, and you see the fantastic colors of the rainbow. Along these colors of the rainbow, all living on this earth developed. All living on this earth need the power of the rainbow to survive, to grow. And if we would describe this picture by Chinese medicine, we would say the sunlight is the purest form of yang energy. It's just moving energy, it's kinetic energy. And when the sunlight meets the purest form of yin energy, the water, we do see the fantastic colors of the rainbow. I was very happy in 2016 in the British Acupuncture Council. They gave the conference, my ideas, my name, Receiving Light. This is what living is about. The plants absorb the light and let grow. For 50 million years, nature has used the light to let grow, so we may use low power of light to let grow and to induce repair mechanisms as well. As we will see in the upcoming 2 days, laser is so much more than the replacement of the metal needle only. Laser has so many beneficial effects that go far ahead of only the treasures of Chinese medicine and acupuncture. And just imagine there are less than 2 weeks between planting the crops and the significant growth of the crops. You may recall from your education, you may recall from high school, the plants have the chloroplasts with the chlorophyll, the green color, that absorb light. And we have similar powerhouses. They are called the mitochondria. And these are the main target for the laser irradiation, for the use of the light. The mitochondria have the antenna pigments to absorb the light, and it's especially the so-called, where you see the flash, it's especially the complex 4, the cytochrome C oxidase, that absorbs red and infrared light laser. Has anybody seen before a slide like this? Has anybody before, or can you still recall? In physiology, we call it the inner breathing. We have the outer breathing and we have the inner breathing. And this is the so-called oxidative phosphorization. From 1 mole of glucose, which is brought into the respiratory chain, in the end we get ATP, CO2 and water. What is the task of the mitochondria? Anybody who could describe what's the task of mitochondria are? Well, the mitochondria are so-called powerhouses of our cells. They produce almost all the energy. When I'm talking, when I'm walking, when my heart is beating, when hormones are synthesized, it's all depending on functioning mitochondria. Out of 1 unit of sugar, 1 unit of glucose, the body can produce, with a healthy mitochondria, 36 ATP, adenosine triphosphate. ATP is the universal currency for our energy. We may say it's part of the qi that we know from Chinese medicine. If the body switches off the mitochondria in the cancer situation, then it can produce only 2 ATP out of 1 unit of glucose. Whoops, it's already running too fast. So this is what I just mentioned. If we don't have oxygen, if we do insufficient energy production, out of 1 unit of glucose, 1 mole, we only get 2 ATP. If we add it with the mitochondria, we get together 38 units of ATP. And in the case of tumor, almost all tumors switch off the mitochondria. So this is one of the ideas of tumor therapy, to reactivate the mitochondria and bring the tumor in the programmed cells into the apoptosis. The elder we get, the less is the number of healthy mitochondria in our body. When we have chronic disease, there's a rapid decrease of healthy mitochondria. Aging process reflects a reduction of mitochondria. And when there are not enough mitochondria, we don't have enough ATP, we don't have enough energy anymore. I said mitochondria are responsible for the energy production. So what do you think? Which organ has the highest amount of mitochondria? Any answer from the online people? Heart muscle, perfect, absolutely, yes. The organ that has to beat 24 hours, the heart muscle has by far the highest amount of mitochondria. And it's for me, time and again, so blow. In a healthy heart, 33 to 38% of the volume of the heart are mitochondria. So it reflects how important small organelles are for our energy production and by this for our well-being total. The elder we get, the less number of mitochondria, the less ATP. So if we go to the very young part, if we go to the stem cells have even more mitochondria than the heart. The average body cell has about 1,000 to 2,000 mitochondria. The heart muscles up to 10,000, and the most pluripotent stem cell, right? The oocyte becomes what we are from head to bottom. It separates and separates and separates and replicates itself. So it needs lots of energy. So in the oocyte, there are more than 100,000 mitochondria. So when we talk about chronic diseases, mitochondria are one very, very important organelle. I'm not quite sure why this is mixed up, why this comes at this point of the, now I know probably, yeah, okay. So when we work the laser targets the mitochondria, the laser targets the metabolism. So once in a while, I do not go only for the treasures of Chinese medicine, but I don't forget about cellular. I have to stay away from the speaker. I do not only stick to the treasures of Chinese medicine. This was a preschool child, long-lasting history of atopic eczema, then probably going to school. The parents were afraid because the child was very much hyperactive. So we did a whole blood mineral analysis, and we saw there was a depletion of zinc, and zinc is of utmost importance to reduce allergies. He had this attention deficit hyperactivity syndrome, and the natural substance, the mineral, to reduce hyperactivity is magnesium. Magnesium breaks down our stress hormone, adrenaline, noradrenaline, dopamine.
So it's no surprise if you have deficiency of zinc that you get signs of atopic eczema, and when you have magnesium deficiency that you get hyperactivity. If you look at the tongue of the child from the perspective of Chinese medicine, have you done tongue diagnosis before? Heat signs, perfect, yes. Very, very prominent heat signs. The tip of the tongue, the heart is full of heat, but even if you look into the areas of the middle sanjiao, the coating is totally burned, so there are lots of heat signs, perfect. And heat in the body, heat in the blood wants to get out, and one of the ways how it gets out is developing eczema. By this, lots of the heat is expelled. One last slide, I think, to my beloved mitochondria. In Chinese medicine, we would define health as a fantastic balance between yin and yang in all the organs. So it's not an excess of yang energy, not a depletion of yin energy, or the other way around. Yin and yang are perfectly balanced. From the view of mitochondrial medicine, from the view of orthomolecular medicine, we could define health as a balance between inflammatory processes, between production of reactive oxygen species on the one hand, and the scavengers on the other hand. So if I have an outburst of reactive oxygen species, I get inflammation, I get degradation of cell structures. So it has to be balanced, but if we can't produce reactive oxygen species, we can't kill viruses and bacteria. Oops. If I would try to put all the informations about LLLT, about low-level laser therapy, from the point of physiology into one picture, this gives most of the informations. How does light, how does photobiomodulation, how does low-level laser therapy influence the body? Laser irradiation of an acupuncture point, laser irradiation of defined areas of the body leads to increasing the circulation of the blood on the small as well as on the big vessels. So micro and macro circulation are enhanced. Lymphatic drainage is enhanced. We know laser activates more than 100 repair genes. Laser activates the building of cartilage, chondroblasts get activated, enhances the healing of fractures, osteoblasts, osteocytes get activated. Laser do have an effect on building of elastin and proline, so forever young face, not possible, but it has a really well-aging effect. Laser has a very pronounced effect on the immune system. If I irradiate an area, inflamed area with a laser, the white blood cells get targeted. We call this in medicine the leukotaxis. The flow of white blood cells in the inflamed area is significantly increased, and the activity of the killing cells of the military in the white blood cells of the so-called macrophages of the phagocytosis gets boosted as well. So multiple effects. Laser leads to less production of pro-inflammatory substances, so prostaglandins get less expressed by the laser irradiation. And if I overdose, if I don't do classical LLLT, low-level laser therapy, if I give much higher amount of photons into the tissue, I can achieve an effect that is similar to local anesthesia, to giving lidocaine or other pain-reducing substances. So laser can have an analgesic effect as well. Laser can affect the superficial pain system, the so-called receptive pain system, and laser can affect the C-conducting fibers that go to the spinal cord and to the brain, and laser can even have an effect of release of morphine-like substances in our brain. So this is short explanation to what is in this slide. So giving you the first important information if you want to start out with the laser. It's not a question how long would you treat an acupuncture point. It's the question to bring the right amount of photons, of light energy into an acupuncture point or to an irradiated area. A little bit under the translation, you see adults, 4 joule per acupuncture point. As we will see, especially tomorrow in the workshop, I always treat acupuncture points under the control of the pulse, under the control of the reflex auriculocardial, under the control of the RAC, or the VAS, as the American call it, vascular autonomic signal. And if you get experience on this, you will find out when you apply about 4 joule per acupuncture point in the body of an adult, the pulse wave normalizes again. And interesting enough, the World Association for Laser Therapy, the WALT, it's researchers, it's lots of biologists, it's MDs, and a low number, 5 to 10%, are TCM therapists. And they come by scientific research to exactly precisely the same amount. They say for biomodulation, 4 joule per square centimeter, not per acupuncture point, 4 joule per square centimeter are the optimal energy density for biomodulation, for achieving all these positive results that I've shown in the slide before. Ear points are much more superficial, easily targeted, so it's much easier and much faster to treat ear points with the laser than body points. Brings me to the question, do you learn ear acupuncture here as well? Yes, good. We may probably discuss tomorrow a bit. There are different schools. There is the original school founded by Professor Paul Noget, who found out about ear acupuncture shortly after the Second World War. When he published his research, China got attracted. Well, somebody is doing acupuncture, and it's a European, so they put lots of effort, lots of research, and they developed ear charts similar to those from Noget with some different points. Most of the points I use are from the German acupuncture school, and those who already have been working with the laser, and when you see probably the laser in the breaks at the booth, you will find that most of the resonances you find in the laser are, according to the German school, you find Bahr. Bahr is one of the most important researchers in resonance therapy over the last 20 years. The Chinese say the younger a person is, the more superficial the qi is floating. The younger person is so much easier is to touch the chi. So if you use a metal needle in a child, you usually only need a very small needle, and most of the time only an in and out technique. It's good enough if the needle remains for 10 seconds. So it's likewise with the laser. You need only half, maybe even less of the energy density, only half of the photons to treat acupuncture point in a child comparison to an adult. So, what did you tell me on the way to the meeting? After one block, make a short break and ask, are there any questions?
Mungkin ada pertanyaan dari Bapak Ibu semua. Yes, there is a question, Dr. Weber.
Baik, terima kasih. Saya ingin bertanya tentang laser. Saya ingin bertanya tentang laser treatment basic ya. Ini kan ada 4 poin untuk telinga 0,5 joule per poin, body 1 joule sampai 2 joule per poin untuk toddler, kemudian body point 1,5 sampai 3 joule. Poin itu untuk school, kemudian untuk adult 4 joule per poin. Ini untuk panjang gelombang berapa? Karena
Okay, so Dr. Weber.
So we should tell the artificial intelligence when you ask your question, it should be translated into English.
Correct. So it's slightly modified to use only one question.
Okay.
So she was asking about you've been giving these ear, body points in adults. So this kind of jewel, which waves that you're using for these resonance?
We will go in the respect. We will go into the specific resonances. I think in the next part, in the next chapter. I'm not quite sure whether it answers the question precisely. The timing, how long do I treat, is not as important as the amount of photons to bring into the tissue. So when I have a laser pen with 100 milliwatt or a laser pen with 200 milliwatt output power, with 100 milliwatt I would have to treat double as long to bring the same amount of photon into the tissue. So the higher the output power of my laser pen is, the shorter I have to treat an acupuncture point. In the children, it's not only that from Chinese perspective, it's much easier to touch the qi, but from photomedicine, we have a similar reason why we need less amount of photons. In an adult skin, we have much more pigments. The skin is harder. The skin another black. So, from perspective of Chinese medicine, as well as from the perspective of photomedicine, in the adult, we need significantly higher amount of photons to go down into the qi area to touch and move the qi. Does this answer your question?
Gimana Ibu? Ibu Sam? Gimana apakah menjawab? Mungkin nanti berikutnya kita akan ada sesi tanya jawab, jadi mungkin lebih dari situ. Okay, carry on.
So online, no questions either? Yes, there is a question. Look, there is the translation. Perfect. First, can laser replace electroacupuncture? To my opinion, I did, sometimes I still do, but very rarely. I think the effectiveness of laser is much, much higher than electroacupuncture. We will see some specifications of laser light in the next chapter. Is laser acupuncture effective for nerve disorders such as tingling, numbness, stroke, pinched nerves, vertigo, and others? So on this question, we could have 2 days lectures. I will touch many of these topics. I don't know whether it's in the presentation, but it's such a fantastic result by a researcher, a neurosurgeon from university in Tel Aviv. Just imagine, in the animal model, he prepared the nerve ischiatic, the ischiac nerve, put a clamp on it, 43 rats. Half of the animals were treated with a laser and half of the animals were non-treated with a laser. He measured before and afterwards the conduction of nerve impulses. Well, what would you imagine if you put a metal clamp on the ischiac nerve? No conduction of nerve impulses afterwards anymore. And now comes the mind-blowing thing. You put a laser beam after taking off the clamp again, and it takes 10 minutes. It takes 10 minutes, and the conduction of nerve impulses is better than baseline. So you damage nature, put light on it, and you get better than nature was before. This is the power of light, and no chemical substance, no nothing I'm aware of comes close to the power of light. Next topic, I had half a day at the International Conference of Oriental Medicine 2 days ago in Taipei. Stroke, traumatic brain injury. Nowadays, we know, when I had the first laser device in my hand, I thought, oh, it's fantastic. I have many children in my clinic, fantastic for replacement of metal needle. And some patients with needle phobia, nice. And a few years later, there were studies from Michael Hamlin from Harvard Medical School. Laser can penetrate through the skull bone. Laser can have an effect of our central nervous system. Yes, it's a fantastic tool, but this would be a whole teaching on its own just to give you two answers to this. After traumatic brain injury, after a stroke, fantastic possibility. For RAC, reflex auriculocaudal, does a strong pulse have to be felt? If it's weakness, it's considered to be a positive reflex auriculocaudal. Well, we'll see this in detail, practical tomorrow. We will see on this topic soon. I would say basically any change in the pulse that you feel gives you an information. It's a little bit depending at which position you feel the pulse. So sometimes you may get information about depression of pulse. However, the classical Noget reflex, the classical RAC, is when you feel over the radial artery toward the tip of the thumb, put on possibly active acupuncture point, and the pulse, the amplitude, I have to say, the amplitude significantly increases and maybe slightly accelerated. So normally, typically, it's some acceleration, but even the depression gives you an information about an active point. Can laser acupuncture penetrate the cranial bones? Oh, I answered this question already. Yes, it can. For example, when used with governor vessel 20? And if so, does require an infrared wavelength? So there's a specialist who asked these questions. Very good. Yeah, it's Duma 20, the meeting point of the 100 by Hui. Fantastic point to calm down for relaxation, in headaches, in migraine, in anxiety, in fear. Fantastic point. Yes, you can treat this point. You can treat any given acupuncture point with a laser, even points close to the eye. And yes, as well, it's especially, red does penetrate a little bit as well, but especially 808, 810 nanometers give the best penetration through the skull bone. Why does slide 21, what was slide 21, say that 1200 nanometer wavelengths cannot penetrate deeper into the tissue? Isn't the longer the wavelengths, the deeper penetration? Oh, there are really some laser specialists who has an idea what the colleague is talking about. Well, we will see this in the following slides as well. Where to start? No, probably very, very short. We have an optic window in which we get the best penetration, and it's red and near infrared. 1200 nanometers is not near infrared anymore, and 1200 nanometer is absorbed by water, therefore it doesn't penetrate properly anymore. Can the RJ laser wave frequency be adjusted to 4625 Hertz? And which types of RJ laser can do this? Well, this will come. This is my most beloved resonance, the 4625 Hertz, the so-called self-healing resonance. Any device, RJ laser, whether it's the simplest laser pen, the most advanced, the most powerful 500 milliwatt, or whether you work with the so-called physio laser or Akku wave. The RJ lasers have the self-healing resonance already preset, so you don't have to adjust yourself. Are there any potential negative consequences if we over-treat beyond the recommended doses? And are the effects reversible? Well, the optic window is rather broad, or let me put it in another word. We have laser in clinical use, low-level laser, not talking about surgical laser, what are used in ophthalmology or in emergency medicine or for cutting tissues, class 3B lasers, low-level lasers, almost 6 decades in use, no reported side effects. So no lasting side effect, even if you artificially irradiate the eye, even if you apply 100 times more energy density to an acupuncture point, but you lose all, you recall the slide with the many circles, you lose a lot of the positive effects, but you won't harm the tissue, you won't find any structural issues. Does the Noget wave frequency have a range, or is it fixed? No, the frequency is always fixed. It's very precise. Different devices may produce different Hertz output power. Yes, and yeah, it's absolutely correct. Many devices are poorly calibrated. They only apply a range of resonances. Many of them don't even make proper resonance therapy. What this is, we will see in the next but one chapter. And will it still be beneficial if the Hertz or frequency outputter from the device differs? yes, it differs a lot, and it makes all of the difference. We can continue with the question. I don't have to put any slides anymore. May I ask, can laser acupuncture penetrate clothing so the patient doesn't have to undress? If so, how effective is it? Any ideas to wake you up? Can laser penetrate through the clothes? No. Well, if I may have a very, very thin white coat, some amount will penetrate. But if I have a black coat, 99% will be absorbed and won't penetrate. It doesn't make. But this 1% that penetrate may be good enough, and usually is good enough to detect the RAC. So maybe, may I hold your hand? So maybe I'm feeling his pulse, and I can manage. Thank you. And I want to check whether now what would be this point in the area would be the Dan song, the conceptual vessel 17. When I go with the laser over this area and feel the pulse, and there would be an active acupuncture point, even through the closest, I would feel this. So I've been invited maybe 20 times, often to Islamic Republic of Iran, and we had 2 days lecture on laser in infertility. And we had the last day walk-in clinic where patients came, and all of them came with polycystic ovarian disease, obese, hirsutism, so man-like hairs, and then a very slim young lady came. So normally I would have do some Western investigation, palpate the abdomen, and open and go with a laser directly over the skin, but I didn't dare. So I went over the pelvic region, and on the right side there was a significant increase in the RAC, in the pulse diagnosis. I said, something is wrong. Can't be. I have several ultrasounds. I said, have an MRI, and a week later she got the report that there must have been an extrauterine gravidity, and there was a persisting inflammatory process. So even through the close, you can feel the resonance and the change in the RAC, but it's not working for the laser. The laser is absorbed and does not penetrate good enough anymore. How long is the ideal duration of laser acupuncture therapy? Acupuncture point. This is what I tried to briefly explain before. It's not a question of how long would I treat, but it's the question to bring the amount of energy density into the acupuncture point. For joule, if I compare 100 joule output power with 500 watt output power with 100 milliwatt, it takes 5 times longer to bring the 4 joule into the acupuncture point. Is there any maximum dose for adults and children in one session treatment? So I think this question goes, if I add 5 points, 10 points, 20 points, is there any maximum dose for the whole body? So if you go out into the sun, you get 1,000 times more photons into the body than you would get with the laser. So there is no maximum dose for the whole body. May I ask, in the concept of acupuncture, there is a stimulation technique, especially in the biomolecular approach. Is the principle of laser acupuncture the same as the acupuncture needle stimulation technique? In this biomolecular, there is the question gone. I don't know what came up in the last part of the question. However, I may say you can't translate the technique of dispersing and tonification one to the laser, but with the resonances I can do more nutritional, more nourishing acupuncture point, where other resonances have a more dispersing effect. So the rest of the questions is gone, so we can continue with the slides. Can you switch back to, yeah. Laser acupuncture versus metal needle acupuncture. So, what are the advantages of laser acupuncture? Any known acupuncture point can be treated, and I mentioned even, what is this point? Bladder 1, bladder 2, gallbladder 1, stomach 2. Any given acupuncture point, even close to the eye, can be treated. It's a pain-free method. So there is no risk of infection, there is no risk of bleeding. One very specific thing I'd like to share with you is, I would say, my contribution to laser acupuncture is the Weber meridian massage. How would you describe, who is experienced TCM therapist? On this side, they are experienced. So how would you describe GI reflux in terms of Chinese medicine? No. What would be the description? What would be the syndrome in Chinese medicine? So, when I have inflamed lymph nodes, it's stagnation of phlegm. So, how would you call reflux? So, GI reflux, nowadays it's called gastroesophageal reflux disease. How would you term this with the words of Chinese medicine?
You feel pain in the stomach.
Correct, you feel pain in the stomach, absolutely correct. You feel bloating, yeah. The acidity comes up, yes. And the Chinese would say it's rebellion stomach qi. The stomach direction, the spleen qi is directed upwards, and the stomach qi is directed downwards.
As well.
Yeah, of course, absolutely correct. But reflux, Chinese would say it's rebellion of stomach qi. So first you get stagnation, and if it's too stagnated, then the stomach will say, I want to get rid of it, and you start to vomit or get reflux. This is rebellion stomach qi. And what you do? Yeah. What do you do traditionally? With a needle? What I've seen in China, they take a pretty long needle, they put in the master point of the Fu organs in the conceptual vessel 12, put it downwards with 3 heavy strokes to bring down the rebellion stomach qi again. So this, of course, you cannot do with the laser, but more effective, to my opinion, then this aggressive manipulation is this Weber meridian massage to go over the conceptual vessel and bring down the rebellion stomach cheese downwards. And in addition, you may go over the stomach meridian as well, on both sides, to bring down the stomach, the rebellion stomach chi. Very effective to reduce GI reflux or to even ease it totally off. Thank you. And resonance therapy. Many of the questions, for many of them, you will not understand what we were talking when there was the question about self-healing. This is very effective, or giving an additional information to each acupuncture point. Any given acupuncture point can be treated with laser, but with a laser I have the option to give an additional resonance information to the point. If I go back from the flip chart here to this corner, I do not treat acupuncture points like I point now with a CW, with a continuous wave mode. I always use this blinking mode, and this is called resonance therapy. I treat all by resonances. Another information is here, it doesn't cause inflammation. Tomorrow we will talk, in the afternoon probably as well, a little bit about allergies, especially allergies in children. One of the very common worldwide allergic conditions in children is the atopic eczema. The Chinese medicine calls this the wind of the four crocks. So elbow region and popliteal knee region are specifically affected. And what are the most powerful acupuncture points to get rid of heat in the body, to get rid of heat in the blood? Any ideas? Yes. Largenstein 11 Gucci is a fantastic acupuncture point to get rid of heat in the blood. Very close to it, the sedation point of the lung meridian, the lung 5 is very effective. And of course, the bladder 40 point in the popliteal region. And I said before, wind of the four crocks, these are the locations where I typically find the symptoms of the atopic eczema. And sometimes they are so overstretched, they are inflamed. You have bacteria in this area. When you have bacteria in acupuncture point, you shouldn't insert a needle. But with the laser, you can treat. You can treat these highly powerful points to reduce heat in the blood, and at the same time, recall what I said about the biological effects. Laser enhances leukotaxis. Laser enhances the killing of the bacteria in the irradiated area. So with the laser, I not only can treat these powerful acupuncture points, but at the same time, I directly go to the root of the disease. I directly treat the inflammation. So therefore, I believe in many situations, laser acupuncture is superior to the metal needle acupuncture. There was the question about tonifications, sedating techniques in the questionnaire before. This is giving part of the answers. When I insert a metal needle, I have a significantly effect directly. This would be the dotted curve, metal needle. And if I don't stimulate, the effect slowly grades down. Whereas when I use the laser, the photons pile up in the tissue, and as long as the laser is working, I have an effect on the acupuncture point. There is a study from Professor Litcher from Graz University where he irradiated the master point of circulation, the lung 9, and measured by Doppler sonography the flow in the anterior cerebral artery. and he could demonstrate with the laser, as long as the laser was working, there was an increase of the blood flow in the anterocerebral artery. So there are really some marked differences on the acupuncture point between laser and inserting a needle. Now I've been talking, I don't know, for an hour already. There is the watch. About laser. What is laser? Anybody knows what laser is? Any idea? Nobody interested in physics? Well, laser is an abbreviation and stands for light amplification by stimulated emission of radiation. Light amplification, stimulated emission of radiation. So lights, photon energy, are brought, amplified in a higher energetic state, and by different techniques, mirrors, they are brought into one wavelength and into high organization. First is the sunlight, the light of the bulbs. It contains all different wavelengths. The short wavelengths of blue light, the long wavelengths of red, and even longer wavelengths of infrared light. In the second part of the cartoon, you see one color. In physics, we say it's monochromatic, only one wavelength. And in the last part, you see the symbolism of laser light. Laser light is one color as well, but the wavelengths of the laser light are organized, are brought in phase, and physics call this coherence of light. And this is absolutely unique. Take home 4 joule per acupuncture point as energy density for body points in the adult, and take home laser is an electromagnetic wavelength, is unique among all forms of light. It's one color and it's highly organized, it's coherent. And this coherency, what is more effective? Electroacupuncture, laser acupuncture. Applying electrostim is non-coherence. It's only the used laser that is bringing a coherent, organized information into an irradiated acupuncture point, into an irradiated tissue. So what happens when a laser beam hits the tissue? I go back again. So this is our laser beam. Now it hits the tissue. Part of the photons get superficially reflected from the skin. Some of them scatter superficially, and some of them penetrate down into the tissue. Chinese terms, we would say, some of them penetrate into the qi area where we want to touch the qi. This arrow that goes straight on, the transmission is the most important, and we want to achieve as much as possible photons down into the qi area, and it's red and especially near infrared that gives this deep penetration. This tries to explain what I just said. If I have the laser with a distance to the tissue, many of the photons get reflected and cannot penetrate. If I have contact, most of the reflection is prohibited, can't take place. And if I use the weight of the laser on its own, of the laser probe, I press away the local water, compress the vessels. By this I get the deepest penetration. So if you want to treat an acupuncture point, have the laser perpendicular, so with 90 degrees, and have it with contact and have it with slight pressure over the acupuncture point. By this, you get by far the best penetration of photons into the tissue. Red in the cartoon reflects really the red light laser, the yellow, non-visible, near-infrared. So the near-infrared has a little bit more egg-shaped penetration into the tissue, and definitely 808 or 910 give a better penetration than classical red 650 nanometers. Yeah, this is another slide to try to show with distance we have lots of reflection. With contact we reduce or bring the reflection almost to zero, and with further pressing to the tissue we bring the highest amount of photons down into the tissue. So with contact and pressure we get the best transmission of photons into the irradiated acupuncture point. Yeah, here is answering the question from the online people. Why does 1200 nanometers or 1400 nanometers do not penetrate that well into the tissue? As my laser pointer is not good working on the screen, I may just go up here. If we would go from blue light to violet light, then we would here have next the UVA, UVB, UVC irradiation. Is ultraviolet light dangerous? Yes, UV light may cause aging of the skin. UV light may cause basalioma or even melanoma. So the body tries to protect itself by building the melanin. So blue light is close to the UV irradiation. So blue light is absorbed by melatonin. By melanin. Melatonin is from the brain, but is absorbed by melanin. So blue light can't be used for acupuncture. No penetration, 2 millimeters. Similar with green light. Green light, any idea? What does absorb the green light? All the colors have complementary colors. Green light is absorbed by hemoglobin, so no green light to penetrate into the tissue. So in the end, it's 650, 700 nanometers red, 808, 810, just non-visible, and there is another good penetration, 910 nanometers. Why does 1200, 1400 do not penetrate? In these long wavelengths, water becomes the chromophore. 1200, 1400 nanometers get absorbed by water. Therefore, these are not good colors for the acupuncture. So, summarize again: visible red, near infrared, short wavelengths of it are those colors that are the best for acupuncture. Here I have another example of the meridian massage according to Weber. Any idea what could be the case in this boy? Which is the area that I'm treating there? Well, this is a patient suffering from dry cough. We said GI reflux. Nowadays it's called GERD syndrome, gastro reflux disease. And this is a bit more cranial on the conceptual vessel. This is rebellion of lung qi. The lung qi has the function, dispersing function, to disperse the qi over the body. And if this is blocked or impaired, I have dry, ineffective coughing. This is called rebellion of the lung qi. What is the opening point? What is the most important acupuncture point for stagnation of the qi in the lung? Height of the nipples. It's the conceptual vessel number 17. It's translated the center of the chest, Dan Song. And any idea how this point is called? Tiantu. Perfect, yeah. It's the conceptual vessel 20. It's the heavenly chimney. So do meridian massage from Tiantu to Dan Song with the laser. And by this you very effectively bring down the rebellion lung qi, very effectively reduce the coughing. And don't do it like this. We want to bring down. So start again. And by this you bring down the rebellion of the lung qi. Of course, other points like our Neguan, pericardium 6, lung 7, lung 9, should be added, but even this on its own is very, 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 very effective. So now comes a huge chapter. So we have the chance at this point for questions again.
And maybe a convenience break after this, like 10 minutes. Would that be okay?
We make the questions and then we make the break.
Yeah. All right.
You've got a question?
Hello, my name is Dede from Jakarta. Doctor, how does laser acupuncture work in degenerative disease and support cancer care? And does photobiomodulation in obesity act only on fat cell or also on metabolic syndrome such as insulin resistance? Secondly,
continue. There were already so many questions containing. With the obesity, I can make it very easy. It will be part of the afternoon lecture. We go on to this. Is it effective in degenerative diseases? As I said, then 100 repair genes get better expressed. One of the most, to my opinion, one of the most effective tools in regenerative medicine. It's fantastic even to combine with Western regenerative medicine, to combine with exosomes or stems. And what was the third part of the question? Supportive cancer care. Well, we can take this point. What are contraindications for low level? When shouldn't we use the laser? So picking up your question, is cancer a contraindication for LLLT, for low level laser therapy, for photobiomodulation? Any ideas? What's your feeling? Is it a contraindication? correct? Maybe. About which things can we be sure in life? The voltage, I really have some difficulty. I don't know why with this microphone. I have to go some closer to my mouth. Now I can get a singer. The voltage station for laser therapy, which is the Olymp for laser therapy, clearly says low-level laser therapy cannot cause cancer. So we cannot cause cancer. But what is this in a supportive cancer care? Can we use it in supportive cancer care? Yes, yes, we can. 3 years ago, there were 3 big consensus conferences among phototherapists, oncologists, and radio-oncologists, radiotherapists using gamma irradiation for head neck tumors. About 80% of patients who get ablative chemotherapy for bone marrow transplantation and 100% of patients with head neck tumors develop oral mucositis. Most of them oral mucositis that bad that they can't eat anymore, that they can't drink anymore, that they even have difficulties to swallow their own saliva, and quite often they have severe bleeding from the mouth. And many techniques, many different herbs from Chinese medicine, Ayurveda medicine, lidocaine, pain relieving, so many things have been tested. None of them really were successful. And in cases, and we are talking about patients, cancer patients undergoing treatment during the treatment processes, and it was agreed laser irradiation is therapy number 1, first choice in these forms of cancer. So reflecting that it's a safe method even in the cancer situation. Next question, are there any other contraindications? I already mentioned this point to the eye with class 3B, never with class 4 laser. With class 3B laser, bladder 1, bladder 2, gallbladder 1, stomach 1, stomach 2 can be treated with the laser. No report in the literature after 6 decades that ever a damage to the retina, to the vision, was induced by a 3B laser. What could be possibly other contraindications?
Regarding to, I'm Shirley from Jakarta. Regarding to my colleague's question about the cell of cancer, what do you think about that case? You said that laser therapy is very, very good for a patient of the cancer, a case of the cancer. So what do you think about for the pain for patient cancer? Or just only laser acupuncture just only for the kill the cell of cancer, or can be for the pain of the patient of cancer? Thank you, Dr. Weber.
We should have picked up topics for the seminar. No, I'm always surprised when I gave my first lecture 12 years ago in Taiwan. First question was, we premature neonates with a laser? Yes, we can, but I always say, well, get your experience in normal situations before you think about this. Yeah, definitely, many other side effects of radiation therapy and chemotherapy can be treated with a laser. Polyneuropathies are a huge field where the laser has been shown to be beneficial. reducing of chemotherapy, induced GI reflux, rebellion stomach G have been reported. Even more effective the use of the laser than other antiemetics, than traditional Western medications. No, we cannot cure a tumor with laser irradiation. But we have two things to it. First, the first ever published study on low-level laser, 1959, it was the American Theodore Maiman who was producing the first laser device. Few years later, area professor Henry Meester was the first to describe the healing effects of laser, the biomodulation effects of the laser. And he treated animals with non-healing wounds who suffered from cancer. And even in the cancer situation, with radiation, the wound closed, the hair regrowed, and in most of the patients, you did see a regression of the tumor size. So once again, laser does not induce cancer and it has some effect in the reduction, but it's not the treatment. But there is a combination. I don't have any slide. It's one of my most beloved topics about photomedicine. The main action, the main vector of what we are talking these 2 days is laser for photobiomodulation, enhancing healing processes, microcirculation, enhancing lymphatic drainage, enhancing building of collagen, elastin, proline, of cartilage, and these things. So it's stimulating healings. If I combine laser with a so-called photosensitizer, maybe a natural substance like curcumin, then the mode of action is 100-degree different. Many tumor cell lines, for example, rhabdomyosarcoma, takes up the yellow color of curcumin 120 times. So 120 times is 1,000 times more than a healthy cell. And after having done infusion with ultra-small nanocurcumin, and then you do intravenous, you put a sterile single-use optic fiber, then you do intravenous blue light irradiation, then you have a targeted effect only on the tumor cells. You kill the tumor cells, and in many of patients I've seen the tumor like melting the snow in the sun. Same principle is working for severe infectious diseases. So I treated ventilated corona patients with curcumin infusions and then blue light infusions. And after 5 days, all of them were discharged from the intensive care unit. None of them was ventilated anymore. So this is a very powerful anti-inflammatory and anti-cancer as well. It's called then not photobiomodulation, but PDT, photodynamic therapy. So all the others had now their time to think about possible other contraindications.
What I've known, it is contraindicated to directly to the tumor mass, directly above pregnant uterus, to ongoing active bleeding, and to active systemic infection with fever. Can you correct us?
Yeah, very good comment, very good suggestions. And as I said in the very beginning, for really open, not everything what I'm telling you is the ultimate truth. And not only TCM, but good medical practice always continuously is advancing. Acute infection 20 years ago in all the textbooks as a contraindication. However, these are probably by now 25% of the patients I treat. So I got a crazy offer from one of the sheikhs in Dubai. He said, can you come? You treated another member a year ago with 2 years infection of the mucous membranes. My father is on the intensive care unit for the 3rd time within 1 month. It's recurrent of pneumonia. I said, no, I have to go to Solo. I will give lectures. I pay you anything you want. You write what you want to get. I said, no, I have my obligations. I won't come. I will go end of next week. So inflammatory diseases are not a contraindications for the use of laser. How is it over a tumor? Most of the members of the walls will say, no, it's not a contraindication. As a lecturer, I say it's a contraindication. Having said so, it may never happen, as you say, by the way. If I get a tumor, I definitely would use laser shower or similar to irradiate with a laser over the malignancy. There is fantastic research by a German biologist, biophysicist, Fritz Albert Popp, irradiating over malignant tumors, stops the growth of the tumors and has the chance to bring the tumor into programmed cell death, into apoptosis. All studies in vivo, so in the living animal or in the living, all studies show that laser radiation has an anti-cancer effect, even in the existing cancer. If you irradiate cancer cell in the dish, you have some simulatory effects. But by activating leukotaxis, by activating phagocytosis, by having effect on the immune cascade, prostaglandins and other, all clinical studies show conclusive. It has no cancer-inducing, it has some, I would say, limited effect on the growth of the cancer. One exception, and I'm the only one from the world who proclaims this, they say even in the area of malignant melanoma, you can irradiate. I love cellular physiology, I love molecular medicine, as well I love Chinese medicine. This is very, 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 very specific. It's none of the slides, and I didn't expect these specific questions. When I irradiate with a laser, it's not only enhancing circulation, lymphatic drainage, it's huge more. With the laser irradiation, I activate heat shock proteins. Have you ever heard about heat shock proteins? There are small and big heat shock proteins. The small heat shock proteins have all anti-cancer, anti-inflammatory effects, and all our health cells get stimulated to produce more small Dalton-sized heat shock proteins. The malignant melanoma cells, laser irradiation, use big size, heavy heat shock proteins. Cancer. So I very clearly wouldn't recommend to irradiate anything close to malignancies. Yeah, then you mentioned, you don't get the break, I'm afraid. Then you mentioned correctly, what's about pregnancy? Where are the TCM specialists? I just asked these questions. Chinese medical are there for acupuncture points in the pregnancy. I discussed with Kiki and with Sandy Suvanda, who are gynecologists. There's a no. In the Chinese literature, there are no forbidden points, only forbidden techniques. So points like Hegu, you shouldn't use in pregnancy with lots of stimulation, but you may use. Any distal body point in pregnancy can be used for legal reasons, not because of any side effect report. For legal reasons, I wouldn't irradiate lower abdominal points during the pregnancy. I treated hundreds, maybe thousands of patients, ladies, in the last trimester of the pregnancy for lower lumbar pain with fantastic results and no side effects. The legal thing is, if the baby would come with a 6 finger, look in the textbook, it's prohibited, you did so, and you will really run into issues. From physiological logic, no danger, and well, Islamic country, but in Europe, all the pregnant ladies go out, lie in the sun with their belly, and get 1,000-fold more photons in their lower abdomen, so no side effect. Yeah. So for legal reasons, I wouldn't irradiate directly into the eye. Having said so, there are now publications in age-related macular degeneration that twice a week with 5 to 10, maximum 10 millimeter output power laser, you can have positive effects in all stages of macular degeneration. There was, and I think then we make the break.
Thank you, Chair. I will ask about something interesting. What are the main components of the RG device so it can produce laser from electrical energy? That's all.
I didn't get it personally. I'm interested in something very basic. What are the main components of RJ laser device so that it can produce a laser from electrical energy? Well, he is the RJ Laserman for technical specifications. Have a word with him, discuss with the engineers from RJ Laser. The basic is initially we had argon, so gas-derived lasers from this, in German it's Edelgase, from this high-value gas substances like argon. The original lasers were like a gun. Now all these lasers are produced by laser diodes about this size, and by, I'm not quite sure, 10 to 20 mirrors, they bring the laser beam into a single direction and bring them into this coherence. Yeah, for more detailed, yeah. Yeah, what I really like that you start to ask questions. When we came from the hotel to the venue here, I said, I'm happy about questions because the slides everybody received, you can read on your own. I think you learn the most by the questions and by the practical demonstrations. So how long will be the break?
10 minutes.
10 minutes.
Yeah.
So
we
we'll be back at
now,
11. Point 11 we start again.
Correct. Kita convenience break sebentar, hanya sampai 10 menit ya. Kembali lagi. Sharp. Terima kasih.
Aku cinta Akupunktur, kitabku pelajari dengan hati yang jujur, meresap tiap titik dan jalur, menjadi jalan terang untuk tubuh yang makmur. Bakti ini bukan sekadar ilmu, namun cahaya yang menyentuh kalbu. Kau pijakan langkah di jalan penyembuhan untuk masyarakat dengan sepenuh pengabdian. Poltekkes Surakarta dapat melangkah bersama dalam semata tabu, dalam semangat juang yang tak pernah sirna. Dengan tangan terampil membangun kesehatan, menyentuh yang sulit dan kecil.
Selamat datang di jurusan Akupunktur Poltekkes Surakarta. Satu-satunya program pendidikan akupunktur milik pemerintah di Indonesia. Akupunktur modern bukan hanya warisan tradisi, kini ia berkembang, berpadu dengan ilmu medis, anatomi, fisiologi, hingga neuroscience. Di sini, kami menghadirkan pendidikan vokasi dan terapan yang lengkap, dari program D3 Akupunktur hingga sarjana terapan akupunktur dan pengobatan herbal. Program D3 kami mencetak praktisi akupunktur profesional, yang siap berkarya di puskesmas, rumah sakit, hingga praktik mandiri. Sementara, program D4 menghadirkan pendekatan holistik, menggabungkan keilmuan akupunktur dan pengobatan herbal dalam satu kurikulum terintegrasi. Didukung oleh laboratorium pendidikan yang lengkap, mulai dari laboratorium dasar, lanjutan, anatomi, hingga diagnosis. Kami memastikan setiap mahasiswa menguasai teori dan praktik secara mendalam. Lulusan kami tersebar di seluruh Indonesia, mengabdi di layanan kesehatan, menjadi wirausaha, dan ASN. Jurusan akupunktur juga aktif dalam pelayanan masyarakat. Dalam peringatan Hari Kesehatan Nasional, booth akupunktur kami dikunjungi langsung oleh Menteri Kesehatan Republik Indonesia Budi G. Sadikin dan beberapa pejabat termasuk public figure. Sebelumnya, prestasi membanggakan juga diraih oleh Ketua Jurusan kami, Dr. Hanung Prasetya, SKP MSI, yang meraih juara 2 dosen berprestasi Poltekkes Kemenkes tingkat nasional 2024. Jurusan Akupunktur Poltekkes Surakarta terakreditasi unggul oleh Lampetekes untuk prodi D3 Akupunktur dan baik sekali untuk sarjana terapan akupunktur dan pengobatan herbal, terus berinovasi dalam pendidikan dan layanan kesehatan. Kini melalui PMK nomor 19 tahun 2024, akupunktur terapis resmi diakui dan dapat diberdayakan di puskesmas, sebuah langkah maju untuk kesehatan masyarakat Indonesia. Bersama Hakti dan Kolegium Akupunktur, kami terus mendorong profesionalisme, pelatihan dan peningkatan kualitas layanan. Bergabunglah bersama kami menjadi bagian dari generasi akupunktur modern yang berbasis ilmu, tradisi, dan teknologi. Hanya di jurusan akupunktur Poltekkes Kemenkes Surakarta. Terima kasih.
Kesehatan seutuhnya bukan hanya tentang menyehatkan raga, tapi juga menyehatkan jiwa. Nusantara Dharma Holistik hadir sebagai yayasan dan lembaga pelatihan yang kredibel dan terdepan bagi para profesional yang ingin mengembangkan potensi di bidang integrative medicine di Indonesia. Memberikan solusi yang nyata dalam bidang integrative medicine untuk menjawab masalah kesehatan masyarakat di Indonesia dengan prinsip integratif, yaitu berbasis bukti, dapat diukur, dapat dipertanggungjawabkan, efektif, efisien, dan minimal atau tanpa efek samping. Nusantara Dharma Holistik diasuh langsung oleh Dr. Medical Franciscus Saverius Sulistyo Winarto atau yang lebih kita kenal dengan nama Pak Kiki Sulistyo, yang memiliki cita-cita luhur untuk memajukan integrative medicine di Indonesia. Nusantara Dharma Holistik berkomitmen menyelenggarakan kegiatan-kegiatan ilmiah dengan skala nasional maupun internasional yang dibawakan oleh para narasumber yang berkompeten di bidang masing-masing. Mari bergabung bersama dengan Nusantara Dharma Holistik untuk memajukan integrative medicine di Indonesia. Tingkatkan kompetensi diri kita dan jadilah akupuntur terapis yang unggul dan berkompeten.
Sebagai pelopor di dunia medis dalam teknologi laser, RJ Laser terus mengembangkan produk
Bapak Ibu
kualitas
sekalian,
tinggi dan
mari kita
teknologi
bersiap-siap
terbaru
untuk
menyaksikan
sesi selanjutnya.
terapi secara simultan dalam satu kali aplikasi, yaitu iradiasi lokal langsung, aktivasi titik akupuntur, dan iradiasi sistemik melalui sirkulasi darah. RJ Laser Pen telah terjual ribuan unit di seluruh dunia dengan desain yang sangat ergonomis dan praktis. Dilengkapi dengan layar LCD yang mudah dibaca, pengaturan.
Cek, cek, cek. Ayo kita mulai semuanya. Ayo, Mas, kalau kayak gini kita nggak ada panggilan lagi ya? Panggilan. Bemper coba kali ya, biar. Ya.
Thank you.
Ayo Bapak Ibu,
Cek.
sudah selesai break time-nya. Mungkin yang berada di RJ? Nanti bisa
RJ
bertanya lagi.
people, the break is over.
Pak Fritz.
Oke, perhatian teman-teman semua, para peserta webinar, untuk segera menempati tempat duduk masing-masing karena acara segera dimulai. Dr. Weber sudah bersiap di depan panggung, mohon kerjasamanya untuk mempercepat langkahnya. Terima kasih. Perhatian kepada teman-teman untuk segera menempati tempat duduk masing-masing. Untuk yang di booth laser segera kembali dulu karena Dr. Weber akan segera untuk memulai. Terima kasih.
Dear Fritz, we want to continue the lecture.
Untuk booth laser nanti ada waktunya tersendiri, segera mengikuti dengan seksama.
So, we had some information about light in general. We discussed a little bit about the difference between the use of the traditional acupuncture needle and bringing light into the tissue. And now comes what I understood in the first discussion, one of the most interesting topics for you here to discuss. So, who has attended the class of Kiki on the detection of the RAC, of the VAS, of the reflex auriculocaudal?
I did.
1, 2, 3, so 4. So the majority is not aware. Okay, I did expect different. To probably wake you up a little bit, can you please just bring your chair and Fritz, can you give me one pen? Thank you. Okay, whoever. So before I use the laser, I just want to describe the basic idea, the basic concept about the RAC, reflex auriculocaudal. Most parts of the world nowadays call it the VAS, the vascular autonomic signal. The big man of modern ear acupuncture, Professor Paul Noguet from Lyon, found out that many of his patients from Africa had a cut Here, probably it's the best if you can turn over now to the recording. Had a cut here in this part of the ear. And he asked him, what did happen? And all of them told, we had severe back pain, and the healer of our village came and had a hot knife, a hot needle, and by destroying this point, the pain immediately was gone. And they said, wow, that's interesting. And he started initially with blood draining needles, then with acupuncture, and found out, yeah, this is the cauterization area for lower lumbar pain. So we have here the lumbar spine. And then he used 100 different tools to find out. He has a ear chart on different colors that affect different parts of the ear. He worked, this was most of his initial work, with pencils, and found out on pressure they do react. And all of a sudden, the patient, who was always sitting at the head of the patient, he found, wow, just the pulse changes when the patient reports. I go with the pain. Oh, it's painful. And at the same time, I feel a change in the pulse wave. And this was the basis for this reflex auriculocaudal. Noget thought it's only valuable for ear points, and he thought these ear points react with the heart. He called it reflex auriculocaudal. Nowadays we know it's a temporary increase in the peripheral sympathetic tonus, so therefore the term vascular autonomic signal is more precise, and for sure any body point reacts as well as any active ear acupuncture point. Moreover, it's fantastic to find out even about fields of disturbances, whether you have dental foci, inflammation in the dental region, or deep located cysts in the muscles or even in the bone structure. So just to show you, you may not do it only in the lying patient, but you may do it in the treatment situation. Traditionally, in Chinese medicine, we have the 3 pulse position, Chun Guanqi, by which we can detect whether there is a pathology in a specific organ. You may still go for this technique. The original technique by Noget was to feel the pulse over the radial artery floating towards the tip of the thumb. So I will do it the traditional Noget way and describe to you how I do it. And yeah, you could be my tripod now. There was the question about the quality of lasers for 2 specifications. I have laser devices from more than 20 branches in my clinic. For 2 specifications, I think this one is for acupuncture by far the best. First of all, in no other device, the resonances are so well calibrated, so when you want to apply 10 hertz, it will be 10 hertz. When you want to apply self-healing 4625, it will be this resonance. This one thing, and probably more important, when I work with this device, it has maximum output power of 200 milliwatt. When I press the start button for 5 seconds, the output power is directly reduced to 5 milliwatt only. So I feel the pulse and go over a suspected area. In this case, over the pericardium meridian, and pericardium 6, the neg1 point is reflecting to the pulse. So not having exchanged any word with him, he was, there is, I can't say whether it's acute or chronic situation, there is some weakness with the pericardium, with the neg1. So there may be some weakness in the middle Sanjiao. By this method, I get the precise location of the acupuncture point, and having found the acupuncture point with arrows up and down, I easily can change between different resonances. And what are the different resonances? We will see in the upcoming slides. With this method, No-G-A, resonance of disharmony, checking over the body, you can check for any underlying disease. And from my school, from the German Association for Acupuncture and Auricular Medicine, in the highest degree, you are not allowed to talk to the patient. You have to make the diagnosis just by checking over the body or over the ear for fields of disturbance. This was just a very brief introduction how and feel over the radial artery and check with the laser, do I find an area in which the pulse, the amplitude of the pulse suddenly piles up. And I can do it on body points, and I could do it on ear acupuncture points. Basically, any ear acupuncture point has the reflection on a body acupuncture point. Probably to wake you up, and then we start with a lecture again. Probably we do one interesting thing. You can put away this. You can stand up as well. I don't know how experienced you are. How would you find the liver 13 point? Liver 13. 1-3, yes, correct. You can use your elbow and go with the elbow, and I call it the point elbow without elbow. You get the point liver 13. And then I'd like to ask you, press on this point. How does it feel? Oh, you have to probably translate? No. How does it feel when you press on this point? Does it cause discomfort? In whom does it take discomfort, and who doesn't feel anything by pressing on this point? In whom does it take some discomfort? Who does feel discomfort?
Yang
You
ngerasa
do?
nggak
You have
nyaman
to
ketika
show as well?
dipakai
Yeah.
liver 13-nya.
So these who get some discomfort are the people who are really want to push things forwards. Those who don't feel anything are all the lazy bones. This point reflects in ear acupuncture in the incisura intertrachica between tragus and antitragus, the ACTH point, adrenocorticotrophus hormone. When we are under tension, when we are under stress, this point gets under stress. When we want to lecture and give a good lecture, we have to have a certain tension. Maybe it's general, but really if you want to achieve something in life, you must have some good power in your wood element and liver and gallbladder. The good thing is you usually achieve something. The bad thing is you run into risk to get muscular tensions, to get hypertension, and other things. Yeah, this was just to wake you up, your lazy bones. Most of them didn't feel anything. So please back to the presentation mode. Yeah, some people say it's a Chinese proverb, others say it's from Mark Twain. If your only tool is a hammer, every problem becomes a nail. If your only tool is a needle, you will run into problems. And the fantastic thing is about the laser, I can replace the nail, the needle, and I have many other options. So this is sort of summary. We talked a little bit about the pink, purple part. The laser is acting independently from Chinese ideas, independently from acupuncture, by biomodulation. We discussed many of the things that can be achieved by photobiomodulation. We mentioned about the difference laser and metal needle we can replace for laser acupuncture. When I work, I would say in general, but especially when I work with young energy, when I work with light, I have to have the antenna pigments, I have to have the so-called chromophores to absorb the light and to have an effect. So if I don't have the substances in the mitochondria, the laser won't proper work. And topic for now, I can significantly boost and enhance the effectiveness of the laser by giving the right resonance information to the pathological acupuncture point. There is a whole field on its own, bioresonance therapy. To my opinion, all these bioresonance people should work with the laser, because any bioresonance, any resonance is conducted at the best by laser light. Yeah. These are the devices, or one of the devices we use in our clinic. I don't know whether they were popular here in Indonesia. When I was as young as you are, I had this as a student on my desk, the Newton swing. You let one ball fall and the same resonance information is given to the next ball, the next ball, the next ball, the next ball. And finally, the last ball you never touched is swinging in the same rhythm with the same resonance. And this is very simply the idea of resonance therapy. You give a certain information by which you expect it will go in resonance with the irradiated tissue and then brings a harmonizing effect. So nowadays I never work CW, continuous wave mode. I always work with resonance therapy. The big thing about resonance therapy, it enhances the uptake of photons, and at the same time it has an organizing effect for the tissue. Yeah, this is Chinese medicine. Anyway, yeah, here's the colleague who is speaking Mandarin fluently. No, at the moment. The Chinese character for music is this jue. It reflects the swinging of the universe. And if you add one single piece, a word part, a radical, if you add something over the term of music, it becomes medicine. So the old tradition of Chinese medicine is using resonance is music, and many of the Chinese tradition is working. They have a pentatonic, a special music system for different diseases. They have resonance therapy for lung diseases. Shao Shang, Lang 11, is the second tone of the Chinese pentatonic music. So it's reflected in many acupuncture points, the ideas that music, that resonances can contribute to healing processes. If I would say, here is 1 second. Continuous flow of photons. This would mean CW. This I'm not using in the clinic anymore. If this would be 1 second, in this time, laser off, laser on, laser off, laser on, there are 2 impulses in this 1 second, and 1 impulse per second is called, in physics, 1 hertz. So, if this would be 1 second, very easy, what would be the resonance in the figure 3? It's too easy, the question. 4, of course, it would be 4. So this would be 4 resonances in 1 second, 4 impulses in 1 second. And now imagine there was the question from one laser specialist in the audience, in the online audience, what's about the self-healing resonance? 4,625 hertz. So 4,625 times in 1 second, the laser is on and off. We cannot imagine, or I have difficulties to imagine how it's possible to calibrate devices on this resonance. There are even higher resonances that are in use. What we should know, in a good calibrated device, half of the time the laser is clearly cut off and half of the time the laser is working. And we have been testing many devices at the university, and many of the devices only have a sinus curve-like wave. The laser is not really off, and this is more or less continuous wave. This is not resonance. In the well-calibrated devices, half of the time the laser is off, half of the time it's on. Light on its own is a resonance. So we have to keep in mind we are talking about 2 different frequencies. We have the primarily frequency, the swinging, the electromagnetic wavelengths of the light, and on this we put a second resonance with the on and off of the light. And to demonstrate how powerful a good resonance is, I took this from one of a very nice textbook on healthy and non-healthy food. An apple, very thin slided, only 50-fold. You can do it with your microphone in the clinic. Find only 50 folds enlarged. It's, I would say, almost a disaster. And in the natural grown, under natural sunlight, without artificial conditions, we have a very nice corona-like, like the corona of the sun, not the coronavirus, picture. And when I even enlarge further, when I go to 200, 500-fold enlargement, it reflects Chinese medicine again. The Chinese always say, we have the microcosm in the macrocosm. Ear acupuncture, the microcosm of the macrocosm of the body in one ear. We have the Korean hand acupuncture. We have the reflex zones at the foot. And here we can see, if we have a small apple slice, 500 times enlarged, it likes small apple trees standing beside each other. This is the power of biological grown, of natural resonances, of light. And this is the book from Dancer. Unfortunately, it's only available in German. The unusual power in our daily diet, the difference between biological grown, he has it on I think 100 different parts of our diet. So resonance have an important effect. And as I said before, we have two different resonances. The color, blue light short wavelengths, red light longer wavelengths, and we put a different frequency, a different resonance given in hertz onto the laser beam to have different effects. So it's an adding of two different frequencies. Does it have any meaning? A good friend of mine is Andrea Völdi, veterinarian doctor from Munich. She did very simple but very explaining experiments. She used a membrane and put salt crystals or small sand on this membrane and irradiated the membrane with a resonance of disharmony. We will see this in a few minutes with a Nogier resonance. I just used in the colic the Nogier resonance, the resonance of disharmony. And she repeated 100 times, and basically it was more or less always the same picture that occurred. So this reflects the main idea of resonance therapy. Resonances have a predictable effect on the irradiated tissues. Nogier was the first one to describe these different resonances. He described from A to G zone-dominant resonances of the ear. And these zone-dominant resonances reflect the same resonances on the body. So in the supratragus region, we have the region of A, the disharmony detection resonance. Here in the concha region, we have the dominant resonance of B, the so-called nutritional resonance. In the upper part of the ear, we have the bones, we have the muscles, and there is the orthopedic resonance, the muscular resonance C, 1168 Hertz. Peripheral nerves and bone marrow, Nogier E. And in the area, baby in mother's womb, upside down, here is the head. In the head region, we have the regions F and G. And it reflects a little bit the development of our body, the nervous structures. Our brain is derived from the ectoderm. I don't know who has it still in mind. Initially, we have the oocyte. It starts to replicate itself, and after a while, it develops the three so-called germ layers: endoderm, ectoderm, and in between, the mesoderm. The endoderm, inner organs, and the mesoderm becomes our bones and our muscles. And interesting enough, what we know from biology, from embryology, from the development of the fetus, is one by one reflected by the ear zones described by Nogier. And these are all these different frequencies, A to G, that have been described by Professor Paul Noget. Initially, he worked with low frequencies. Later on, he discovered that the higher frequencies are working better. So it's basically a similar, I wouldn't say the same, similar resonance. If you do play an instrument, it's the higher octave. So it's mathematical and musical calculation behind it. So if you double 2.28 hertz, it becomes 4.56. If you double 4.56, it becomes 9.12. If you double 1.12, 18. So it's always doubling. And when you double 73, no, where is it? No, there. G 140. If you double 146, it becomes 292 hertz, and it doubles time and again. Noget A is the resonance of disharmony. If you want to find active acupuncture points, if you want to check, is there an inflammation in the root canal? Is there any deep pathology in the tennis elbow? Then you will feel the pulse, as I just demonstrated, and go with A and find the pathological point. B, nutritional resonance, inner organs, so whether you have COPD or asthma, whether you have a stomach problem, whether you have a gallbladder, kidney problem, Noget B most likely will be the best resonance. If you have muscular impairment, I always like to call it the orthopedic frequency. Normally the 1168 hertz will be the best. D relates to the tragus. It has an effect on left-right communication, so laterality. E is the bone marrow and peripheral nerve resonance. F is the psychotic resonance, and G, the psychosomatic resonance. So when we talk later on or tomorrow about, there was the question, speech delay, when we talk about anxiety, quite often it's the G, the psychosomatic resonance, or ADHS, G, quite often G, the best resonance for the treatment. One back. Professor Frank Barr, the most famous student of Paul Noget, did discover much more resonances than Paul Noget. And many of the resonances are correlated with each other. So maybe you find a field of disturbance by A, then you may treat later on with bar 5 the anti-oscillatory resonance. So these are the 7 basic resonances described by Professor Frank Barr, and these are the correlating 7 basic resonances described by Noget. It's a whole weekend or multiple weekend education on this. Noget A again, about a few of the resonances I just like to go into with a little bit more detail. A, so important, it's the directly cellular resonance, the acute disturbances, it's the detection resonance to find active acupuncture points, deep lying pathology, fields of disturbance, inflammation, pain do react at the best by using the laser on the Noget A mode. At the same time, it's the natural resonance of the mucous membranes. So when you have foci in the mucous membranes of the mouse, most likely A will be the best resonance for the treatment. So A does give somehow, I may say, a bit of deeper penetration, where the integrative resonance to A, the anti-oscillatory resonance B, connects the tissue again. So it's building like a net. So bar 5 is like cell field, one of these universal resonances. If you say, okay, I got the message, 4 joule per square centimeter. I got the message, use the laser with a resonance, but I feel so insecure with the pulse testing. I don't get the information. You may treat any acupuncture point with a cell field resonance, 4,625 Hertz, or you may use the bar 5 resonance. In all patients, you will be better than giving the laser on the CW mode. Cell field, as well as bar 5, is good calibrated in the laser pen, in the laser shower, in the physiolaser, AccuWave. So any laser, at least from RJ, has these devices preset, and you don't have to keep in mind any of these resonances, these numbers. They are preset. You only have to an idea what would be the best in which situation. So like A, it's the directly cellular resonance. It's integrative, where the one is diagnostic. Anti-oscillatory, fantastic if you have patients with anxiety. An important resonance by the Tourette syndrome. So it's the therapeutic resonance for Noget detected fields of disturbances. So this is summary of the slides before. So you may use A at the best for diagnostic modus, whereas B is by far more effective for the treatment mode. Noget B, 292 Hertz, doubled is 584 Hertz. So Noget B, the middle B, we recall it's in the region of our inner organs. Indications, nutritional resonance. Inner organs need to be supported. Nutritional resonance, metabolic resonance. So sometimes B is good, obesity, to activate the metabolism of all inner organs. And at the same time, it has a good effect for the immune system. I shouldn't have shown probably these pictures before lunchtime. This is a patient. We will talk later on in more detail on wound healing disorders. As you may imagine, this patient was scheduled for amputation. By surgical maneuvers that didn't bring any results, but still we, of course, continued. By laser irradiation with a nutritional resonance B, we achieved almost a total healing of this terrible wound. You see all the tendons, you see even down the bony structures. So extraordinarily powerful. Why is it so powerful? The laser on its own. Here is no circulation anymore. Enhances micro and macro circulation. The laser, thousands of things I can't mention. The laser activates the so-called angiogenetic growth factors. So the laser irradiation leads to new building of vessels. Anti-inflammatory. You see this green pus. The inflammation, the bacteria get better attacked by leukotaxis and activation of cytosis. We don't have the time to go through all the different resonances, so I just picked up in the end the Noget G resonance. It's the resonance of psychosomatic, of aggression, fear, anxiety. And the I, is it here? Yeah. our fetus, you all know, in the center of the lobulus, like here's the eye point. So of course, eye disorders of neurological disease quite often are included, and the sinusitis is always, not always, most of the time, best treated with G as well. So once again, for those who do our ear acupuncture or for rehearsal, here would be the stomach, here would be the lung, here would be the small intestine, the large intestine, here would be gallbladder, here would be kidney. So all inner organs get at best treated with B, nutritional. Here in the lobulus region is G, the dominant. So most of the diseases of the central nervous system are best treated with Noge G. There are hundreds, no, altogether thousands of different resonances described in the literature. You find all of them in my textbook, Laser Acupuncture. All the devices are capable to give precise resonances. Just to pick out two general resonances, I said anti-oscillatory bar 5, 9,592 Hertz. We mentioned already self-feel as my most beloved resonance, and another is the chi motion, the moving chi resonance, 7,695 Hertz. We have resonances for pain, pain with inflammation, for allergies, for hearing loss, anti-aging. So there are many, many different resonances that can be used and that are preset in the device. Do you recall what I said about Chinese medicine? How would you define health in Chinese medicine? In Chinese medicine, we would say health, the monad of yin and yang in every organ is totally balanced. Shining, shining yang, young, powerful yin. 20-year-old is described, the monad as the biggest. I said, from the view of orthomolecular mitochondrial medicine, we would say health is a balance between ROS, reactive oxygen species, and their scavengers. Did you ever look in the WHO? They say health is the absence of a disease. Oh yeah, I agree. Of course, of course. Resonance therapy. How would you define a disease? From the point of resonance therapy, first of all, health. The first part of the cartoon, a harmonic swinging in the organ, a harmonic swinging in the kidney tissue, in the liver tissue, the muscles, highly coherent field. So we would say this is ideal health, optimal organization, optimal health. Whereas disease can be described, and Fritz Albert Popp described very well that disease is an incoherent field, a situation of disorganization with many, many different swingings in the organ. And this brings me back to the question we had before the break. Can we use laser in cancer situations? Yes, we can and we should. And Tine Karu, an Estonian photobiologist, said, if you have a laser device and have patient with cancer and don't use laser, you do medical malpractice. But I mentioned as well, if I put a laser over a tumor, it reduces the incoherence in the tumor field, and POP could show in liver tumors that they stopped to grow. So if we use this highly organized laser beam over the diseased tissue, step by step, applying this coherent signal, we tonify, we booster the natural resonance, and we achieve a regaining of health by stabilizing this field. We assimilate step by step frequencies of disturbances, and the system, the organ, the cells find the way back in the natural swinging. And really, I think this is one of the big additional benefits to the pain-free method and all the other things that we discussed before. The resonance therapy can contribute to healing purposes by normalizing pathological swingings in organ and cells again. This is from ZAA, Springer Press, publication from summer last year. I did together with Professor Barr, where I summarized on the fact of resonance therapy. This is the B we have seen before. The right resonance can significantly increase the survival of stem cells. The right resonance therapy has even an effect on our genetic inheritance. The right resonance has an effect of the telomeres. So even from biology point of view, not talking about Chinese medicine, even down to the biological point of view, resonances are extraordinarily powerful. At this point, I may ask all of us to have a short breathe in and breathe out. On the 4th of July, Professor Barr did pass away with 81 years of age. Nobody else than him developed, no, you can't say developed, detected, they are all nature given, detected so many resonances, so many new ear acupuncture points than him. So we may give him one big release. Yeah. Questions about resonance.
Dr. Weber, it's very interesting concept about when our organ is not working properly, so the resonance become this, like say, this resonance, this harmony. But how can we detect this harmony, and with what kind of resonance that we need to use to correct this harmony? How can we measure it, and how can we choose to treat it?
Yeah, of course, the important question. Otherwise, it's an interesting concept, but if we can't apply it in the clinic, it doesn't make much help. So bring me back to the statement. If you have difficulties to decide, there are two options. The most simple option, treat everything with the anti-oscillatory resonance with bar 5. And you saw this fine net that occurred with the bar 5 resonance. With the bar 5 resonance, anti-oscillatory, you bring every tissue, every organ in a more harmonic swinging. Second answer, go by the table. I'm sure you get the most important resonance tables by Fritz and their team. You have acute inflammation of the mucous membranes, you have an AFTE, natural resonance mucous membrane, I treat with A. I have a patient with COPD, with asthma, with chronic inflammatory bowel disease, with kidney insufficiency, I treat with B. I have patients with neuromuscular issues, I treat with C. I have a patient with Tourette syndrome, I treat with G. I could just go by table. And the pre-demonstration, if you know how to use the patient's energy field by going over acupuncture points with the right resonance, I can guarantee you, maybe it's today, maybe it's in 2 years, all of a sudden, now I understand what Dr. was talking, then you will feel the change in the amplitude. I met last September a company in Taipei. They developed a special technology with the camera of the modern cell phones. They make this reflex auricular visible. They say within the next 2 years we have it on the market. So this would be, of course, very, very beneficial for making quick, precise diagnosis. Time out? No. Yes. Can't be.
We're about to have lunch.
Well, the problem is inviting Dr. Weber means he will never stop talking. Yeah, it's your show now.
Okay, if that's okay, I have lunch now about 45 minutes. Okay. Mungkin setelah ini barangkali nggak apa-apa? Ya, oke. Pak Ibu, kita akan istirahat 45 menit. Jadi kita kembali lagi di sini jam 1 kurang 5. Oke, terima kasih. Sampai bertemu ya. Jam 1 kurang 15 menit.
Ya.
Terima kasih.
Ya. Bagi Bapak Ibu, silakan untuk mengambil makan siang. Untuk nama-nama yang ada di registrasi, bisa untuk mengambil makan siangnya di depan ya. Terima kasih.
Jurusan Akupunktur Poltekkes Kemenkes Surakarta, kami dengan senang hati menyambut kehadiran Bapak, Ibu, dan sahabat semua di kampus kami yang berlokasi di Jalan Raden Sutoyo Mojosongo, Jebres, Kota Surakarta. Selain menjadi pusat pendidikan, kawasan sekitar kampus juga dikelilingi berbagai fasilitas penting yang memudahkan tamu dari luar kota. Akses transportasi. Untuk transportasi, lokasi kampus sangat strategis dan dekat dengan berbagai sarana utama. Terminal Tirtonadi, terminal bus terbesar di Solo, berjarak sekitar 4 km. Stasiun Solo Balapan, stasiun kereta utama, berjarak sekitar 3 km. Stasiun Solo Jebres juga melayani perjalanan jarak jauh, berjarak sekitar 3 km. Stasiun Purwosari di sisi barat kota, berjarak sekitar 4 km. Untuk akses jalan tol, kampus ini dekat dengan pintu tol Gondang Rejo dan pintu tol Solo. Keduanya bisa dicapai sekitar 10 menit perjalanan dengan kendaraan. Fasilitas kesehatan. Untuk layanan kesehatan, tamu tidak perlu khawatir. Beberapa rumah sakit besar berada tak jauh dari kampus, di antaranya Rumah Sakit Dr. Un Surakarta, Rumah Sakit Umum Daerah Dr. Muwardi, Rumah Sakit Hermina, Rumah Sakit Pantiwaluyo, dan Rumah Sakit PKU Muhammadiyah. Selain itu, terdapat pula apotek yang mudah dijangkau seperti apotek K24, apotek Afiat AAA, dan apotek Medika Prima. Akomodasi hotel. Bagi kamu yang berencana bermalam, tersedia pilihan hotel dengan berbagai kelas, mulai dari Swiss Bell Hotel Solo dan The Royal Surakarta Heritage untuk hotel berbintang, hingga Hotel Asia dan UNS Inn yang lebih ramah di kantong. Selain itu, Solo Paragon Hotel juga menjadi pilihan populer karena terhubung langsung dengan pusat perbelanjaan modern. Wisata dan budaya. Solo dikenal sebagai kota budaya yang kaya dengan destinasi wisata. Dari kampus, kamu dapat dengan mudah mengunjungi Keraton Surakarta Hadiningrat dan Pura Mangkunegaran, pusat sejarah dan budaya Jawa. Pasar Klewer, Pasar Gede, dan Pasar Grosir Solo, surga belanja batik dan kuliner tradisional. Masjid Syekh Zayed Solo, ikon religi baru yang megah. Solo Safari atau Taman Satwa Juruk yang cocok untuk wisata keluarga. Semua destinasi ini dapat ditempuh rata-rata dalam 10-20 menit dari kampus. Demikianlah informasi mengenai fasilitas dan destinasi penting di sekitar jurusan Akupunktur Poltekkes Kemenkes Surakarta.
terus bersatu dalam benang merah nilai. Dari Surakarta kita bersatu, ilmu dan karya lintas penjuru. Laser Akupunktur harapan baru, tanpa rasa sakit sehat menyatu. Muskuloskeletal pain hilang perlahan, gigi start tanpa pediatrik pulih aman. Dengan resi teknik kita temukan solusi modern masa depan. Pain free treatment, healing with light, dari Dr. Michael Weber, shining so bright. European TCM Laser Academy memandu, kita tingkatkan nyambung di hati yang satu. Jurusan akupunktur jadi andalan, kolegium dan hati bersama tangan. Dharma holistik, RJ laser terdepan dari dunia untuk Indonesia. Teknologi dan tradisi menyatu cipta, bersama kita melangkah menuju kesehatan tanpa luka. Pain free treatment, healing with light, dari Dr. Michael Weber, shining so bright. European TCM Laser Academy memandu, kita tingkatkan nyambung di hati yang satu. Pain free treatment, healing with light, dari Dr. Michael Weber, shining so bright. European TCM Laser Academy memandu, kita tingkatkan nyambung di hati yang satu. Di hati yang satu. Pain free treatment, healing with light, dari Dr. Michael Weber, shining so bright. European TCM Laser Academy memandu, kita tingkatkan ilmu di hati yang satu. Kemenkes hadir memberi dukungan, jurusan akupunktur jadi andalan, kolegium dan hati bersama tangan. Dharma holistik, RJ laser terdepan. Pain dunia untuk Indonesia, teknologi dan tradisi menyatu cipta, bersama kita melangkah menuju kesehatan tanpa luka. Pain free treatment, healing with light, dari Dr. Michael Weber, shining so bright. European TCM Laser Academy memandu, kita tingkatkan nyambung di hati yang satu. Di hati yang satu. Kita tingkatkan nyambung di hati yang satu. Surakarta jadi saksi, ilmu ini kan terus bersemi. Laser Akupunktur jalan pasti untuk sehatkan bumi ini.
Selamat datang di jurusan Akupunktur Poltekkes Surakarta, satu-satunya program pendidikan akupunktur milik pemerintah di Indonesia. Akupunktur modern bukan hanya warisan tradisi, kini ia berkembang, berpadu dengan ilmu medis, anatomi, fisiologi, hingga neuroscience. Di sini, kami menghadirkan pendidikan vokasi dan terapan yang lengkap, dari program D3 Akupunktur hingga sarjana terapan akupunktur dan pengobatan herbal. Program D3 kami mencetak praktisi akupunktur profesional yang siap berkarya di puskesmas, rumah sakit, hingga praktik mandiri. Sementara program D4 menghadirkan pendekatan holistik, menggabungkan keilmuan akupunktur dan pengobatan herbal dalam satu kurikulum terintegrasi. Didukung oleh laboratorium pendidikan yang lengkap, mulai dari laboratorium dasar, lanjutan, anatomi, hingga diagnosis. Kami memastikan setiap mahasiswa menguasai teori dan praktik secara mendalam. Lulusan kami tersebar di seluruh Indonesia, mengabdi di layanan kesehatan, menjadi wirausaha, dan ASN. Jurusan akupunktur juga aktif dalam pelayanan masyarakat. Dalam peringatan Hari Kesehatan Nasional, booth akupunktur kami dikunjungi langsung oleh Menteri Kesehatan Republik Indonesia Budi G. Sadikin dan beberapa pejabat termasuk public figure. Sebelumnya, prestasi membanggakan juga diraih oleh Ketua Jurusan kami, Dr. Hanung Prasetya, SKP MSI, yang meraih juara 2 dosen berprestasi Poltekkes Kemenkes tingkat nasional 2024. Jurusan akupunktur Poltekkes Surakarta terakreditasi unggul oleh Lampetekes untuk prodi D3 akupunktur dan baik sekali untuk sarjana terapan akupunktur dan pengobatan herbal, terus berinovasi dalam pendidikan dan layanan kesehatan. Kini melalui PMK nomor 19 tahun 2024, akupunktur terapis resmi diakui dan dapat diberdayakan di puskesmas, sebuah langkah maju untuk kesehatan masyarakat Indonesia. Bersama Hakti dan Kolegium Akupunktur, kami terus mendorong profesionalisme, pelatihan dan peningkatan kualitas layanan. Bergabunglah bersama kami menjadi bagian dari generasi akupunktur modern yang berbasis ilmu, tradisi, dan teknologi. Hanya di jurusan akupunktur Poltekkes Kemenkes Surakarta. Terima kasih.
Kesehatan seutuhnya bukan hanya tentang menyehatkan raga, tapi juga menyehatkan jiwa. Nusantara Dharma Holistik hadir sebagai yayasan dan lembaga pelatihan yang kredibel dan terdepan bagi para profesional yang ingin mengembangkan potensi di bidang integrative medicine di Indonesia. Memberikan solusi yang nyata dalam bidang integrative medicine untuk menjawab masalah kesehatan masyarakat di Indonesia dengan prinsip integratif, yaitu berbasis bukti, dapat diukur, dapat dipertanggungjawabkan, efektif, efisien, dan minimal atau tanpa efek samping. Nusantara Dharma Holistik diasuh langsung oleh Dr. Medical Franciscus Saverius Sulistiowinarto atau yang lebih kita kenal dengan nama Pak Kiki Sulistyo, yang memiliki cita-cita luhur untuk memajukan integrative medicine di Indonesia. Nusantara Dharma Holistik berkomitmen menyelenggarakan kegiatan-kegiatan ilmiah dengan skala nasional maupun internasional yang dibawakan oleh para narasumber yang berkompeten di bidang masing-masing. Mari bergabung bersama dengan Nusantara Dharma Holistik untuk memajukan integrative medicine di Indonesia. Tingkatkan kompetensi diri kita dan jadilah akupuntur terapis yang unggul dan berkompeten.
Sebagai pelopor di dunia medis dalam teknologi laser, RJ Laser terus mengembangkan produk berkualitas tinggi dengan teknologi terkini, mengkombinasikan 3 jenis terapi secara simultan dalam satu kali aplikasi, yaitu iradiasi lokal langsung, aktivasi titik akupuntur, dan iradiasi sistemik melalui sirkulasi darah. RJ Laser Pen telah terjual ribuan unit di seluruh dunia dengan desain yang sangat ergonomis dan praktis. Dilengkapi dengan layar LCD yang mudah dibaca, pengaturan dengan satu tangan, dan beragam mode terapi yang dapat disesuaikan dengan kondisi pasien. RJ Laser Pen memiliki berbagai pilihan aplikator yang dapat digunakan untuk permukaan tubuh yang luas, mulut atau tenggorokan, trigger points, dan titik akupuntur. Memiliki memiliki berbagai macam biofrekuensi yang sudah terprogram dan banyak digunakan pada akupuntur modern telinga dan tubuh. Dengan RJ Laser Pen, kami menawarkan sensasi terapi akupuntur yang nyaman tanpa rasa sakit, sehingga cocok untuk anak-anak dan pasien dengan toleransi nyeri yang rendah. The original laser pen, powerful, compact, and versatile.
Selamat datang di jurusan Akupunktur Poltekkes Surakarta. satu-satunya program pendidikan akupunktur milik pemerintah di Indonesia. Akupunktur modern bukan hanya warisan tradisi, kini ia berkembang, berpadu dengan ilmu medis, anatomi, fisiologi, hingga neuroscience. Di sini, kami menghadirkan pendidikan vokasi dan terapan yang lengkap, dari program D3 Akupunktur hingga sarjana terapan akupunktur dan pengobatan herbal. Program D3 kami mencetak praktisi akupunktur profesional yang siap berkarya di puskesmas, rumah sakit, hingga praktik mandiri. Sementara, program D4 menghadirkan pendekatan holistik, menggabungkan keilmuan akupunktur dan pengobatan herbal dalam satu kurikulum terintegrasi. Didukung oleh laboratorium pendidikan yang lengkap, mulai dari laboratorium dasar, lanjutan, anatomi, hingga diagnosis. Kami memastikan setiap mahasiswa menguasai teori dan praktik secara mendalam. Lulusan kami tersebar di seluruh Indonesia, mengabdi di layanan kesehatan, menjadi wirausaha, dan ASN. Jurusan akupunktur juga aktif dalam pelayanan masyarakat. Dalam peringatan Hari Kesehatan Nasional, booth akupunktur kami dikunjungi langsung oleh Menteri Kesehatan Republik Indonesia Budi G. Sadikin dan beberapa pejabat termasuk public figure. Sebelumnya, prestasi membanggakan juga diraih oleh Ketua Jurusan kami, Dr. Hanung Prasetya, SKP MSI, yang meraih juara 2 dosen berprestasi Poltekkes Kemenkes tingkat nasional 2024. Jurusan akupunktur Poltekkes Surakarta terakreditasi unggul oleh Lampetekes untuk prodi D3 Akupunktur dan baik sekali untuk sarjana terapan akupunktur dan pengobatan herbal. Terus berinovasi dalam pendidikan dan layanan kesehatan. Kini melalui PMK nomor 19 tahun 2024, akupunktur terapis resmi diakui dan dapat diberdayakan di puskesmas, sebuah langkah maju untuk kesehatan masyarakat Indonesia. Bersama Hakti dan Kolegium Akupunktur, kami terus mendorong profesionalisme, pelatihan dan peningkatan kualitas layanan. Bergabunglah bersama kami menjadi bagian dari generasi akupunktur modern yang berbasis ilmu, tradisi, dan teknologi. Hanya di jurusan akupunktur Poltekkes Kemenkes Surakarta. Terima kasih.
Kesehatan seutuhnya bukan hanya tentang menyehatkan raga, tapi juga menyehatkan jiwa. Nusantara Dharma Holistik hadir sebagai yayasan dan lembaga pelatihan yang kredibel dan terdepan bagi para profesional yang ingin mengembangkan potensi di bidang integrative medicine di Indonesia. Memberikan solusi yang nyata dalam bidang integrative medicine untuk menjawab masalah kesehatan masyarakat di Indonesia dengan prinsip integratif, yaitu berbasis bukti, dapat diukur, dapat dipertanggungjawabkan, efektif, efisien, dan minimal atau tanpa efek samping. Nusantara Dharma Holistik diasuh langsung oleh Dr. Medical Franciscus Saverius Sulistyo Winarto atau yang lebih kita kenal dengan nama Pak Kiki Sulistyo, yang memiliki cita-cita luhur untuk memajukan integrative medicine di Indonesia. Nusantara Dharma Holistik berkomitmen menyelenggarakan kegiatan-kegiatan ilmiah dengan skala nasional maupun internasional yang dibawakan oleh para narasumber yang berkompeten di bidang masing-masing. Mari bergabung bersama dengan Nusantara Dharma Holistik untuk memajukan integrative medicine di Indonesia. Tingkatkan kompetensi diri kita dan jadilah akupuntur terapis yang unggul dan berkompeten.
Sebagai pelopor di dunia medis dalam teknologi laser, RJ Laser terus mengembangkan produk berkualitas tinggi dengan teknologi terkini, mengkombinasikan 3 jenis terapi secara simultan dalam satu kali aplikasi, yaitu iradiasi lokal langsung, aktivasi titik akupuntur, dan iradiasi sistemik melalui sirkulasi darah. RJ Laser Pen telah terjual ribuan unit di seluruh dunia dengan desain yang sangat ergonomis dan praktis. Dilengkapi dengan layar LCD yang mudah dibaca, pengaturan dengan satu tangan, dan beragam mode terapi yang dapat disesuaikan dengan kondisi pasien. RJ Laser Pen memiliki berbagai pilihan aplikator yang dapat digunakan untuk permukaan tubuh yang luas, mulut atau tenggorokan, trigger points, dan titik akupuntur. Memiliki berbagai macam biofrekuensi yang sudah terprogram dan banyak digunakan pada akupuntur modern telinga dan tubuh. Dengan RJ Laser Pen, kami menawarkan sensasi terapi akupuntur yang nyaman tanpa rasa sakit, sehingga cocok untuk anak-anak dan pasien dengan toleransi nyeri yang rendah.
The original laser pen, powerful, compact, and versatile.
Selamat datang di jurusan Akupunktur Poltekkes Surakarta, satu-satunya program pendidikan akupunktur milik pemerintah di Indonesia. Akupunktur modern bukan hanya warisan tradisi, kini ia berkembang, berpadu dengan ilmu medis, anatomi, fisiologi, hingga neuroscience. Di sini, kami menghadirkan pendidikan vokasi dan terapan yang lengkap, dari program D3 Akupunktur hingga sarjana terapan akupunktur dan pengobatan herbal. Program D3 kami mencetak praktisi akupunktur profesional yang siap berkarya di puskesmas, rumah sakit, hingga praktik mandiri. Sementara, program D4 menghadirkan pendekatan holistik, menggabungkan keilmuan akupunktur dan pengobatan herbal dalam satu kurikulum terintegrasi. Didukung oleh laboratorium pendidikan yang lengkap, mulai dari laboratorium dasar, lanjutan, anatomi, hingga diagnosis. Kami memastikan setiap mahasiswa menguasai teori dan praktik secara mendalam. Lulusan kami tersebar di seluruh Indonesia, mengabdi di layanan kesehatan, menjadi wirausaha, dan ASN. Jurusan akupunktur juga aktif dalam pelayanan masyarakat. Dalam peringatan Hari Kesehatan Nasional, booth akupunktur kami dikunjungi langsung oleh Menteri Kesehatan Republik Indonesia Budi G. Sadikin dan beberapa pejabat termasuk public figure. Sebelumnya, prestasi membanggakan juga diraih oleh Ketua Jurusan kami, Dr. Hanung Prasetya, SKP MSI, yang meraih juara 2 dosen berprestasi Poltekkes Kemenkes tingkat nasional 2024. Jurusan Akupunktur Poltekkes Surakarta terakreditasi unggul oleh Lampetekes untuk prodi D3 Akupunktur dan baik sekali untuk sarjana terapan akupunktur dan pengobatan herbal. Terus berinovasi dalam pendidikan dan layanan kesehatan. Kini melalui PMK nomor 19 tahun 2024, akupunktur terapis resmi diakui dan dapat diberdayakan di puskesmas, sebuah langkah maju untuk kesehatan masyarakat Indonesia. Bersama Hakti dan Kolegium Akupunktur, kami terus mendorong profesionalisme, pelatihan, dan peningkatan kualitas layanan. Bergabunglah bersama kami menjadi bagian dari generasi akupunktur modern yang berbasis ilmu, tradisi, dan teknologi. Hanya di jurusan akupunktur Poltekkes Kemenkes Surakarta. Terima kasih.
Kesehatan seutuhnya bukan hanya tentang menyehatkan raga, tapi juga menyehatkan jiwa. Nusantara Dharma Holistik hadir sebagai yayasan dan lembaga pelatihan yang kredibel dan terdepan bagi para profesional yang ingin mengembangkan potensi di bidang integrative medicine di Indonesia. Memberikan solusi yang nyata dalam bidang integrative medicine untuk menjawab masalah kesehatan masyarakat di Indonesia dengan prinsip integratif, yaitu berbasis bukti, dapat diukur, dapat dipertanggungjawabkan, efektif, efisien, dan minimal atau tanpa efek samping. Nusantara Dharma Holistik diasuh langsung oleh Dr. Medical Franciscus Saverius Sulistyo Winarto, atau yang lebih kita kenal dengan nama Pak Kiki Sulistyo, yang memiliki cita-cita luhur untuk memajukan integrative medicine di Indonesia. Nusantara Dharma Holistik berkomitmen menyelenggarakan kegiatan-kegiatan ilmiah dengan skala nasional maupun internasional yang dibawakan oleh para narasumber yang berkompeten di bidang masing-masing. Mari bergabung bersama dengan Nusantara Dharma Holistik untuk memajukan integrative medicine di Indonesia. Tingkatkan kompetensi diri kita dan jadilah akupunktur terapis yang unggul dan berkompeten.
Sebagai pelopor di dunia medis dalam teknologi laser. RJ Laser terus mengembangkan produk berkualitas tinggi dengan teknologi terkini, mengkombinasikan 3 jenis terapi secara simultan dalam satu kali aplikasi, yaitu iradiasi lokal langsung, aktivasi titik akupuntur, dan iradiasi sistemik melalui sirkulasi darah. RJ Laser Pen telah terjual ribuan unit di seluruh dunia dengan desain yang sangat ergonomis dan praktis. Dilengkapi dengan layar LCD yang mudah dibaca, pengaturan dengan satu tangan, dan beragam mode terapi yang dapat disesuaikan dengan kondisi pasien. RJ Laser Pen memiliki berbagai pilihan aplikator yang dapat digunakan untuk permukaan tubuh yang luas, mulut atau tenggorokan, trigger points, dan titik akupuntur. Memiliki berbagai macam biofrekuensi yang sudah terprogram dan banyak digunakan pada akupuntur modern telinga dan tubuh. Dengan RJ Laser Pen, kami menawarkan sensasi terapi akupuntur yang nyaman tanpa rasa sakit, sehingga cocok untuk anak-anak dan pasien dengan toleransi nyeri yang rendah.
The original laser pen, powerful, compact, and versatile.
pelopor di dunia medis dalam teknologi laser, RJ Laser terus mengembangkan produk berkualitas tinggi dengan teknologi terkini. Mengkombinasikan 3 jenis terapi secara simultan dalam satu kali aplikasi, yaitu iradiasi lokal langsung, aktivasi titik akupuntur, dan iradiasi sistemik melalui sirkulasi darah. RJ Laser Pen telah terjual ribuan unit di seluruh dunia dengan desain yang sangat ergonomis dan praktis. Dilengkapi dengan layar LCD yang mudah dibaca, pengaturan dengan satu tangan, dan beragam mode terapi yang dapat disesuaikan dengan kondisi pasien. RJ Laser Pen memiliki berbagai pilihan aplikator yang dapat digunakan untuk permukaan tubuh yang luas, mulut atau tenggorokan, trigger points, dan titik akupuntur. Memiliki berbagai macam biofrekuensi yang sudah terprogram dan banyak digunakan pada akupuntur modern telinga dan tubuh. Dengan RJ Laser Pen, kami menawarkan sensasi terapi akupuntur yang nyaman tanpa rasa sakit, sehingga cocok untuk anak-anak dan pasien dengan toleransi nyeri yang rendah.
The original laser pen, powerful, compact, and versatile.
Sebagai pelopor di dunia medis dalam teknologi laser, RJ Laser terus mengembangkan produk berkualitas tinggi dengan teknologi terkini. Mengkombinasikan 3 jenis terapi secara simultan dalam satu kali aplikasi, yaitu iradiasi lokal langsung, aktivasi titik akupuntur, dan iradiasi sistemik melalui sirkulasi darah. RJ Laser Pen telah terjual ribuan unit di seluruh dunia dengan desain yang sangat ergonomis.
Harapan baru tanpa rasa sakit, sehat menyatu. Muskuloskeletal pain hilang perlahan, digestar tanpa pediatrik pulih aman. Dengan resi teknik kita temukan solusi modern masa depan. Pain free treatment, healing with light, dari Dr. Michael Weber, shining so bright. European PCM Laser Academy membantu kita tingkatkan nyambung di hati yang satu. Jurusan akupunktur jadi andalan, kolegium dan hati bersama tangan. Dharma holistik, RJ Laser terdepan dari dunia untuk Indonesia. Teknologi dan tradisi menyatu cita, bersama kita melangkah menuju kesehatan tanpa luka. Pain free treatment, healing with light, dari Dr. Michael Weber, shining so bright. European PCM Laser Academy membantu kita tingkatkan nyambung di hati yang satu. Pain free treatment, healing with light, dari Dr. Michael Weber, shining so bright. European PCM Laser Academy membantu kita tingkatkan nyambung di hati yang satu. Laser Academy memandu kita tingkatkan ilmu di hati yang satu. Kemenkes hadir memberi dukungan, jurusan akupunktur jadi andalan. Kolegium dan hati bersama tangan, tema holistik RJ Laser terdepan. Raih dunia untuk Indonesia, teknologi dan tradisi menyatu cipta. Bersama kita melangkah menuju kesehatan tanpa luka. Buying free treatment, healing with light dari Dr. Michael Weber, shining so bright. European PCM Laser Academy membantu kita tingkatkan ilmu di hati yang satu. Di hati yang satu. Kita tingkatkan ilmu di hati yang satu. Surakarta jadi saksi, ilmu ini kan terus bersemi. Laser Akupunktur jalan pasti untuk sehatkan bumi ini. Terserah menyebar lintas Nusantara. Aku cinta akupunktur, kitabku pelajari dengan hati yang jujur, meresap tiap titik dan jalur, menjadi jalan terang untuk tubuh yang makmur. Bakti ini bukan sekadar ilmu, namun cahaya yang menyentuh kalbu. Ku pijakan langkah di jalan penyembuhan untuk masyarakat dengan sepenuh pengabdian. Poltekkes Surakarta tak melangkah bersama dalam semata tabu, dalam semangat juang yang tak pernah sirna, mengukir masa depan dengan tangan terampil, membangun kesehatan, menyentuh yang sulit dan kecil. Hati bakti para akupunkturis bersatu dalam benang merah nilai dan mutu. Kolegium berjuang teguh dalam keilmuan, menjaga tradisi, menapaki kemajuan. Dharma holistik jadi lentera terang, menyebarkan ilmu dalam kaidah yang panjang. TCM bukan hanya metode penyembuhan, tapi warisan jiwa, kearifan dan ketulusan. Aku cinta akupunktur, aku cinta akupunktur, kitabku pelajari penuh syukur, baktiku berikan pada sesama lewat jarum harapan menyala. Poltekkes Surakarta bersatu langkah dalam ilmu dan karya yang indah. Akupunkturis teguh berbakti bersama hati, kolegium mengawal ilmu sejati. Dharma holistik jadi cahaya, terserah menyebar lintas Nusantara. Dari Surakarta kita bersatu, ilmu dan karya lintas penjuru. Laser Akupunktur harapan baru, tanpa rasa sakit sehat menyatu. Muskuloskeletal pain hilang perlahan, digestarkan biatrik pulih aman. Dengan resi teknik kita temukan solusi modern masa depan. Pain free treatment, healing with light dari Dr. Michael Weber, shining so bright. European TCM Laser Academy membantu kita tingkatkan yang di hati yang satu. Jurusan akupunktur jadi andalan, kolegium dan hakti bersama tangan. Dharma holistik, RJ laser terdepan dari dunia untuk Indonesia. Teknologi dan tradisi menyatu cita, bersama kita melangkah menuju kesehatan tanpa luka. Pain free treatment, healing with light dari Dr. Michael Weber, shining so bright. European TCM Laser Academy membantu kita tingkatkan yang di hati yang satu. Pain free treatment, healing with light dari Dr. Michael Weber, shining so bright.
Perhatian kepada hadirin sekalian, acara akan segera dimulai. Dengan hormat kami mohon kepada Bapak Ibu untuk segera memasuki ruangan dan menempati tempat duduk yang telah disediakan.
Cinta akupunktur, kitabku pelajari dengan hati yang jujur, meresapi api, titik dan jalur, menjadi jalan terang untuk tubuh yang makmur. Bakti ini bukan sekadar ilmu, namun cahaya yang menyentuh kalbu. Kau pijakan langkah di jalan penyembuhan untuk masyarakat dengan sepenuh pengabdian. Poltek Surakarta dapat melangkah bersama dalam semua tabu, dalam semangat juang yang tak pernah sirna, mengukir masa depan
Selamat datang di jurusan Akupunktur Poltekkes Surakarta. Satu-satunya program pendidikan akupunktur milik pemerintah di Indonesia. Akupunktur modern bukan hanya warisan tradisi, kini ia berkembang, berpadu dengan ilmu medis, anatomi, fisiologi, hingga neuroscience. Di sini, kami menghadirkan pendidikan vokasi dan terapan yang lengkap, dari program D3 Akupunktur hingga sarjana terapan akupunktur dan pengobatan herbal. Program D3 kami mencetak praktisi akupunktur profesional yang siap berkarya di puskesmas, rumah sakit, hingga praktik mandiri. Sementara, program D4 menghadirkan pendekatan holistik, menggabungkan keilmuan akupunktur dan pengobatan herbal dalam satu kurikulum terintegrasi. Didukung oleh laboratorium pendidikan yang lengkap, mulai dari laboratorium dasar, lanjutan, anatomi, hingga diagnosis. Kami memastikan setiap mahasiswa menguasai teori dan praktik secara mendalam. Lulusan kami tersebar di seluruh Indonesia, mengabdi di layanan kesehatan, menjadi wirausaha, dan ASN. Jurusan akupunktur juga aktif dalam pelayanan masyarakat. Dalam peringatan Hari Kesehatan Nasional, booth akupunktur kami dikunjungi langsung oleh Menteri Kesehatan Republik Indonesia Budi G. Sadikin dan beberapa pejabat termasuk public figure. Sebelumnya, prestasi membanggakan juga diraih oleh Ketua Jurusan kami, Dr. Hanung Prasetya, SKP MSI, yang meraih juara 2 dosen berprestasi Poltekkes Kemenkes tingkat nasional 2024. Jurusan Akupunktur Poltekkes Surakarta terakreditasi unggul oleh Lampetekes untuk prodi D3 Akupunktur dan baik sekali untuk sarjana terapan akupunktur dan pengobatan herbal. Terus berinovasi dalam pendidikan dan layanan kesehatan. Kini melalui PMK nomor 19 tahun 2024, akupunktur terapis resmi diakui dan dapat diberdayakan di puskesmas, sebuah langkah maju untuk kesehatan masyarakat Indonesia. Bersama Hakti dan Kolegium Akupunktur, kami terus mendorong profesionalisme, pelatihan, dan peningkatan kualitas layanan. Bergabunglah bersama kami menjadi bagian dari generasi akupunktur modern yang berbasis ilmu, tradisi, dan teknologi. Hanya di jurusan akupunktur Poltekkes Kemenkes Surakarta. Terima kasih.
Kesehatan seutuhnya bukan hanya tentang menyehatkan raga, tapi juga menyehatkan jiwa. Nusantara Dharma Holistik hadir sebagai yayasan dan lembaga pelatihan yang kredibel dan terdepan bagi para profesional yang ingin mengembangkan potensi di bidang integrative medicine di Indonesia. Memberikan solusi yang nyata dalam bidang integrative medicine untuk menjawab masalah kesehatan masyarakat di Indonesia dengan prinsip integratif, yaitu berbasis bukti, dapat diukur, dapat dipertanggungjawabkan, efektif, efisien, dan minimal atau tanpa efek samping. Nusantara Dharma Holistik diasuh langsung oleh Dr. Medical Franciscus Saverius Sulistiowinarto atau yang lebih kita kenal dengan nama Pak Kiki Sulistyo, yang memiliki cita-cita luhur untuk memajukan integrative medicine di Indonesia. Nusantara Dharma Holistik berkomitmen menyelenggarakan kegiatan-kegiatan ilmiah dengan skala nasional maupun internasional yang dibawakan oleh para narasumber yang berkompeten di bidang masing-masing. Mari bergabung bersama dengan Nusantara Dharma Holistik untuk memajukan integrative medicine di Indonesia. Tingkatkan kompetensi diri kita dan jadilah akupuntur terapis yang unggul dan berkompeten.
Sebagai pelopor di dunia medis dalam teknologi laser, RJ Laser terus mengembangkan produk berkualitas tinggi dengan teknologi terkini, mengkombinasikan 3 jenis terapi secara simultan dalam satu kali aplikasi, yaitu iradiasi lokal langsung, aktivasi titik akupuntur, dan iradiasi sistemik melalui sirkulasi darah. RJ RJ Laser Pen telah terjual ribuan unit di seluruh dunia dengan desain yang sangat ergonomis dan praktis. Dilengkapi dengan layar LCD yang mudah dibaca, pengaturan dengan satu tangan, dan beragam mode terapi yang dapat disesuaikan dengan kondisi pasien. RJ Laser Pen memiliki berbagai pilihan aplikator yang dapat digunakan untuk permukaan tubuh yang luas, mulut atau tenggorokan, trigger points, dan titik akupunktur. Memiliki berbagai macam biofrekuensi yang sudah terprogram dan banyak digunakan pada akupuntur modern telinga dan tubuh. Dengan RJ Laser Pen, kami menawarkan sensasi terapi akupuntur yang nyaman tanpa rasa sakit, sehingga cocok untuk anak-anak dan pasien dengan toleransi nyeri yang rendah.
The original laser pen, powerful, compact, and versatile.
Selamat datang di jurusan Akupunktur Poltekkes Surakarta. Satu-satunya program pendidikan akupunktur milik pemerintah di Indonesia. Akupunktur modern bukan hanya warisan tradisi, kini ia
Sebagai pelopor di dunia medis dalam teknologi laser, RJ Laser terus mengembangkan produk berkualitas tinggi dengan teknologi terkini. Mengkombinasikan 3 jenis terapi secara simultan dalam satu kali aplikasi, yaitu iradiasi lokal langsung, aktivasi titik akupuntur, dan iradiasi sistemik melalui sirkulasi darah. RJ Laser Pen telah terjual ribuan unit di seluruh dunia dengan desain yang sangat ergonomis dan praktis. Dilengkapi dengan layar LCD yang mudah dibaca, pengaturan dengan satu tangan, dan beragam mode terapi yang dapat disesuaikan dengan kondisi pasien. RJ Laser Pen memiliki berbagai pilihan aplikator yang dapat digunakan untuk permukaan tubuh yang luas, mulut atau tenggorokan, trigger points, dan titik akupuntur. Memiliki berbagai macam biofrekuensi yang sudah terprogram dan banyak digunakan pada akupuntur modern telinga dan tubuh. Dengan RJ Laser Pen, kami menawarkan sensasi terapi akupuntur yang nyaman tanpa rasa sakit, sehingga cocok untuk anak-anak dan pasien dengan toleransi nyeri yang rendah.
The original laser pen, powerful, compact, and versatile.
Perhatian kepada hadirin sekalian, acara akan segera dimulai. Dengan hormat kami mohon kepada Bapak Ibu untuk segera memasuki ruangan dan menempati tempat duduk yang telah disediakan.
Bapak Ibu, dimohon untuk segera menempati kursinya masing-masing karena acara akan segera dimulai. Sekali lagi, mohon Bapak Ibu untuk segera menempati kursinya masing-masing. Ya.
It's like we can reduce.
Ladies and gentlemen, please join me in welcoming our distinguished guest and speaker, Dr. Michael Weber, to the stage.
Yeah, thank you very much for coming back. Maybe before we go into further theory, despite the fact that we are already a little bit behind schedule, to wake you up, I'd like to have one what I think we had similar things for lunch. They were reasonable, not perfect for tonifying the middle sanjiao, and anyway, after a meal, the digestive system goes a little bit under stress. So, who feels exhausted at the most, or who feels bloated in the upper abdomen, who wants to get a short demonstration treatment? You again? We can otherwise, yes? Thank you. Well, I always say, observe everything you get from the patient before you do anything else. So I hope you don't.
We move slightly in so the camera can better view, so that the Zoom people can see you as well.
Welcome to the Zoom people. So when I asked for the first time, the dear colleague with a powerful liver, I will come. And now he said directly, I will come. So can you just come over? Just for a minute and for have a seat here. Focusing into the camera. Look the way he's going. Very straight. And when you see his face or his whole appearance, it's very how to say, angulated face. So he has powerful jaws. He can bite his way through life. So you just by observing the physiognomy, you can be almost sure that there is a wiry pulse in the second position, reflecting that he has most likely a powerful wood element. Thank you. It has nothing to do what is good, what is bad. When I asked again, they had somehow forced you to come here. So you are more a type who has sensation for moments. You are more a type who's digesting situations. You are not like anything. Our biggest strength, the same. Our weaknesses. So I would expect when we palpate your pulse, that there will be in the first position some either it will be excess pulse or it will be significantly reduced pulse. When we will look at the tongue, most likely we will see significant impressions from the teeth. We will most likely find coating on the
It's not primarily a pulse or a tongue diagnosis. I just tell you how we can approach. The spleen is responsible for keeping the organ in place. The spleen is responsible to prevent bruises. The skin is nourishing our muscles. Liver and gallbladder are responsible for tonification and relaxation. Can you show us the tongue? Yeah. So the tongue is slightly coated. There are impressions of the teeth. So I think for you it's really good to get some tonification in the middle sanjiao. Yeah. It's good for all of us anyway. There are many schools in China. There is a fire school, and the biggest school are the inner center in a middle school. There is one of these many proverbs. If you know how to fix the middle burner, you can treat any diseases. Or another point, if you know to fix the middle burner, you can treat 1,000 different diseases. So, can you a little bit closer? Can you, camera? Can you probably close?
Kamera. Ada yang bisa bantu untuk melihat kamera di sini?
Focus. Yeah, perfect. Well, let's wake up everybody. What would be the resonance to find out active acupuncture points? Which resonance should I use? A, perfect. Very good. So the detection mode 8, and by pressing the start button for 5 seconds, the output power of 200 milliwatt. If I would check with 200 milliwatt, I would directly treat the points. With 5 milliwatt, it's only the detection mode. So I can go over the ear and find out where are the active points. And I'm sure that we would find something in the neg 1, that would find something in the Susandi, in the stomach 36. But I'd like to show first whether there is activity in the stomach point of the ear. So I feel her pulse. Press the start button for 5 seconds. Output power is reduced to 5 milliwatt only, and then I'm going to scan over the ear. Yeah, it's very as expected. It's even getting worse. I put you in the room. You will focus or you will focus?
Yang fokus Mas ya. Kalau agak sini. Oh.
Ya gitu, kan agak sini, ya seharusnya sini.
So I may just for those who are not familiar with Oriental medicine at this point. As I said, this is the so-called concha region. Here's the stomach, and even with the laser not working, just touching, This is a Paul and just touch it. Feel here would be left and right lung. Here would be small intestine, large intestine, gallbladder, liver, ovaries. Here would be the atlanto-occipital joint, cervical spine, breast spine, lumbar spine, and sacrum. So again, I press the start button, 5 seconds. Feel her pulse floating to the tip of my thumb. And already from this distance, I feel an increase of the pulse. So it's not only the stomach, it's the spleen that is reacting as well. There is a little bit of reaction in the lower, in the last part of the breast spine and upper part of the lumbar spine. And relaxating point, Haldol-like point. So I now go to the nutritional resonance, go to what point I found out, the stomach point, and yeah, it's already getting better. I said in the chart, usually it's 0.1 to 1.2 joule for treating of ear points. Now it was 1 joule for the treatment of the stomach point. Short pressing, full output power, 200 milliwatt. The spleen point is reacting. This relaxation point, the Haldol point, is active. And the lower part of the thoracic spine. And L2. Number 2. Did you feel anything from the treatment? So it's a pain-free method. It's not even called causing warming. In some literature they call it cold lasers because the working principle is not heat, it's really only dispelling the photons. Now I go back to the detection mode, to 292 Hertz, to A, and at least both stomach point as well as the spleen point at the moment are in a regular rhythm again. So this was a very rapid just to show you the basic principle about the resonance therapies. Thank you very much. I'm not allowed to go, or you, to the speakers. Good. We've finished with this slide before. Yeah, now comes, you already saw one picture for the wound healing. For me, one of the most obvious demonstrations about the healing power of light, laser in wound healing. Well, in wound healing we have basically 3 phases. We have the acute wound, where we have the accident, millions of cells die, go into necrosis. This will lead to inflammatory processes. The next phase will be that the wound is getting wet. So we have the exudation phase. It starts the first counteracting, it starts to proliferate, and then comes the phase of regrowing of cells, of regeneration. Photomedicine plus laser acupuncture is active in any of these phases. We have the first phase, the inflammation. Let's talk, or let's rethink. What did I say in the morning? Laser leads white blood cells much more rapidly into inflamed areas. So the leukotaxis is improved. There is, despite the fact that is our own cells, they are dead cells, lymphatic cells. They have to be resolved, they have to be excreted from the body. So they have to be digested by phagocytosis. So in the first phase, laser very effective. Second phase, exudation proliferation. Laser enhances micro and macro circulation. So the exudation is much more rapidly resolved. We enhance lymphatic flow, so the exudation is much more rapidly diluted. Proliferation. Laser activates about, or no, not about, more than 100 repair genes. Fibrinogen, elastin, hyaluronic acid effects. So multiple effects in the proliferation. And I mentioned before as well, laser activates the angular growth factor. So I get new vessels into the damaged wound. And of course, the regenerative process is boosted as well. The normal wound healing, what you find in the literature, is on average 21 to 28 days. And I will show you examples how powerful the laser can outrange this. Well, we know all, we have the surgical wound under sterile conditions, the aseptic wound, we have the inflamed, the septic wound with bacteria inside. How would you define a wound like this with the words of Chinese medicine? Very good, very good. Definitely these pus in the wound, this most likely greenish super infection, is toxic heat in the wound. Around the wound, all around tissue, it's red, it's heat. And of course, all over, it's blockage of qi and blockage of xue, blockage of the blood. And we have qi and blood stagnation. Blood flow is reduced, qi flow is reduced, we have dampness, we have heat, and we even have, as you correctly said, toxic heat. What does the laser do? The laser enhances the blood flow, so we counteract this, not only from the view of Western medicine, from Chinese medicine as well. Light is qi. Light is yang qi, the purest form of yang, yang in. So I bring fresh yang qi energy into the wound. So more qi, and laser moves the qi. Laser resolves lymphatic blockages, dampness is relieved. And to some extent, the laser can contribute to resolving of heat by enhancing the blood flow again as well. So almost all pathology from Western point of view, as well as from Chinese point of view, can be altered by the right amount of photons in the tissue. This was 20 years ago, a patient who came into my clinic with his son. Son had asthma, and whether it was 7 o'clock in the morning or 8 o'clock in the evening, he always joined in with the son. I said, don't you have to work? You are always coming with your son. And then he lifted up the trousers and said, for almost 2 years, the surgeon cannot manage to get the wound. He had diabetes, not too bad, but not ideally controlled. So we started out with a laser pen. We treated with the laser square centimeter, point. I can't say exactly. So the whole treatment only of the wound, not about what we did from Chinese medicine. Only the treatment of the wound took about 20 minutes. After 15 treatments, 18 treatments, I have to look in the chart, we achieved a totally healing of the wound. A little bit of hemosiderosis, pigmentation was left. The attending surgeon said, wow, that's impressive. I have 100 patients for you to send. And then I said, okay, it's time for the laser shower. So we got a laser device by which we can treat almost all of the wound in one treatment. I think it's in the booth as well. 16 laser beams coming out of the shower at the same time. So if you are a surgeon, if you have lots of patients with diabetic ulcers, the shower is a fantastic tool. What is the affected meridian? Which the spleen meridian is affected. Spleen 1, spleen 2, spleen 3, spleen 4. And very close to an important point, the Sanjinjiao, the meeting point of the 3 yin meridians was affected. So beside using the power of the light on its own, which is fantastic, we treated the associated acupuncture points, and we did my beloved meridian massage to open up, to reactivate the spleen meridian. This is from a good friend of mine, Uwe Petermann, veterinarian doctor. He got this dog admitted after a motor car accident, and you have to amputate the leg. He said, well, maybe I go for the laser. And you see, there is the bone, periostis gun, bone open surface. There's already first starting epidurization, one day afterwards. So 11 minus or 29 minus 11, 18, 17 days. 17 days later, there's already new skin coming up. There's new hair growing. It's, in my opinion, there is no other option in medicine with such a fantastic effect. Everywhere in our body, we have stem cells in the skin, In every organ, a stem cell. We activate, I didn't talk about this yet, we activate the local stem cells. And of course, irradiating a bone in this area, we bring the stem cells from the bone into the blood flow as well. Uwe Petermann nowadays is only treating horses, not small animals anymore. When a horse, the owner comes to his clinic, they have to sign, we can't do it as medical doctors, they have to sign a contract from this moment on. You won't use any antibiotics, you wouldn't use any anti-inflammatory substances, so no ibuprofen, no paracetamol, you won't use any cortisol, and he only treats some points with needle, but he says 95% of his treatment is by laser treatment. So he's even more radical than me. This is one really of this very impressive, simple cases. The lady had a bicycle accident and came on the day after the accident to the clinic. You see, we have this first phase. We have lots of necrosis. We have starting exudation. We treated the day after, one after the accident. On day 2, no exudation anymore. On day 4, the size of the wound was significantly reduced. On day 7, it was already totally covered. There was a dry wound. Then we stopped the treatment already. And this is day 9. Last 2 days, we didn't apply any achievement. So within 10 days, there was almost what we call restitutio ad integrum, almost totally healing of the wound within 10 days. These are more complicated cases. This is a publication from, I think, 2 years ago, a combination of photodynamic therapy and multi-wavelength photobiomodulation in chronic wound healing disorders. I mentioned on the question of the cancer earlier on, if you have severe systemic infections, then we do photodynamic therapy. So we were working with blue light and riboflavin locally. And in the last 2 weeks, we only applied photobiomodulation. So wound in the acute situation, treat every day, 3 to 5 times weekly until healing. Number of treatments, of course, very much depend on the severity of the disease. 4 to 10, I mentioned in the severe old wound in the patient with the diabetic ulcer, I think we had 18 treatments. Next question. What could be possible resonance for the therapy? Which resonance, which frequency would you suggest? B. Yes, correct. I don't know what I've written here in the slide. Noje B. Yes. In the first 1 or 2, maybe it's A, acute disharmony, acute disturbances. Usually the nutritional resonance B would be perfect. And of course, what we already mentioned several times, the self-healing resonance, 4,625 Hertz, would be a good resonance. Another resonance, there's chi blockage, so the chi moving resonance could be another option in this situation. I have to add, when I have an acute wound, when the pathology is directly at the surface, when I don't need to penetrate through the skin, through the subcutaneous, then for the irradiation of the wound, about 2 joules per square centimeter are already good enough. If you apply 4, like always, it's not overdosing. Yeah. Wound healing. What I'd like to add is what I mentioned in the foot. Of course, we should always think about what we know from Chinese medicine. So first of all, meridian massage to open up the chi flow. Secondary, we may think about chi moving acupuncture points. So the most powerful, the master point, there are 8 Hui points, most influential acupuncture points in Chinese medicine. And one of them is, I mentioned in the morning already, the Taiwan, the Lang 9 point at the wrist, by which we can treat peripheral arterial or venous disease, coronary heart disease. It's a very powerful point to enhance the circulation in the blood. Then, when we have wounds with lots of dampness, with lymphatic blockages, we have to tonify the middle sanjiao. We have to tonify especially the spleen. For spleen tonifying, there are 2 very effective back shoe points. What are the shoe points on the inner bladder meridian that are very powerful for tonifying the spleen? Online people, what are the tonifying points for the spleen and the back? Anybody an idea what's the Chinese name for the spleen? P. So you just have to add the tonifying P shoe. Yeah. And the tonifying point for the stomach is Wei shu. So P shoe, Wei shu would be very good. Bladder 21, bladder 20, bladder 21. Very powerful. Then we mentioned about the meeting point of the 3 lower yin meridians, Yi, Sun, Jin, Jiao, the spleen 6 point. Of course, our stomach 36, Susan Li, tonifying the middle sanjiao, having good effect on the Wei Qi, on the defense Qi as well. And maybe my beloved Neg 1, pericardium 6 from the upper extremity as well. According to Professor Barr, there is one really miracle point in inflammatory situations. This is the spleen 6 point. Inner side of the foot. And Professor Barr described the spleen 4 point as the interferon point. From Western medicine, when we are frustrating, when we can't control a disease, we may give interferons. And the interferon point of the ear is on the tip of the tragus. Any body acupuncture point must have a correlation to an ear point. And once you get more familiar with this RAC testing, if I possibly get re-invited to come back again, we may have 2 days, 3 days to really learn more about this pulse testing. Then I will bring a cable, and we put a cable on the spleen 4 point and check on the ear, and I can assure you in those patients who have a chronic inflammation, who have post-COVID, long COVID, you will find a significant change in the pulse when you come to the so-called interferon point at the ear. By this combining body points and ear points, we can precisely find active ear acupuncture points. Online questions? Or questions from here? Good, okay. So we continue. Photobiomodulation, laser acupuncture in neuromuscular pain. There you see a man you may have seen before as well. You didn't find this picture on the internet. It was not in the presentation. No, I just was teasing them. I have to be very careful what I put on social media. You find everything in this nice introduction. You have from different sources pictures and photos from me. This is on the World meeting, World Association for Laser Therapy 2014 in Arlington, which is like a twin town to Washington, directly at the border of Washington. This is Roberta Chaw, and I'd like to share with you one of the most important photobiomodulation studies. Roberta Chaw is a therapist on her own, and she found out that the laser is extraordinarily powerful in acute shoulder and neck pain situations. So she said, I get the good results on this. Everything is gone. On discussion with colleagues, I got the feedback, laser is extraordinarily good working. I can continue, but for the online people, or for those who have difficulties with English, it's getting now difficult. Shall I just continue? Good. Let's hope that the slides turn up again. So, what is regarded nowadays as highest evidence in medicine? This is not the own observation. This is a so-called meta-analysis. You look into the literature, what has been published about a specific scientific topic. You make a systematic review and get a meta-analysis, and this of randomized placebo-controlled trials. Out of 20 studies, she collected 820 patients. They all complained of acute neck shoulder pain, and they all were observed by a visual analog scale. You may have seen these 10 emojis, from the emoji in tears in severe pain to the bright smile. By this, the patient has to rate himself. Oh, wow, it's grade 10. When I came to the clinic, after the treatment, it was 4, and it got better and better and better. The other in question is, when I do anything in medicine, for me, of course, I want to achieve a result. But at the same time, I don't want to get a good result by harming the patients on the other side. So for me, the most important finding, none of these 800 patients complained about any side effect. In Latin, we say nihil nocere. Never harm your patient. Stay away from a disease that might cure one symptom but leads to 10 other symptoms. So no side effects have been reported. And of course we want to achieve something. LLT reduced the pain immediately after completing 8 to 10 treatments, and it was not only a short-term effect. One of the studies ended after 22 weeks of follow-up, so the effect was lasting. So we have a powerful method in acute neuromuscular pain, myoglosis, only by photon therapy. She's a brilliant GP, Roberta Cho, but she has no ideas about Chinese medicine. Professor Dorscher from the Mayo Clinic in Florida is a motivated, good MD and at the same time a good acupuncturist. He did laser needle to metal acupuncture, a prospective crossover cohort pilot study, and he had 30 subjects, patients with age range 42 to 95. All of them were complaining not about acute but chronic pain due to shoulder or knee osteoarthritis, or chronic pain due to cervical or lumbar degenerative joint diseases. And the patients were either treated with the traditional Chinese method, with inserting needles, or by laser. The acupuncture points were selected by anatomic descriptions, not like Chinese with the thumb method, with the thumb, but by anatomic define. And not a tendency, P001, so this is not a significant, it's highly significant level. The laser was more effective in the pain reduction than the metal needle was. Metal needle was effective as well, but significantly more improvement was achieved by the use of the laser in these situations. Let's go back to the morning. Why do I believe in muscular, neuromuscular issues? The laser is often a combination between metal needle and laser. The laser is more effective than the metal needle on its own. We heard in the morning the heart muscle has the highest amount of mitochondria. But of course, our skeletal muscles do have a huge amount of mitochondria as well. And the more mitochondria in a cell, the more ATP production, and the better the target for the laser. Main target for the laser is the complex 4 of the respiratory chain, cytochrome oxidase. And when I irradiate a tissue with a laser, I enhance the ATP production. From point of physiology, what happens in a myoglosis? What happens, at least in acute contractures? What happens in these trigger points, in these tender points? The muscles are like my fist. And how to get again? What is the natural substance to release the construction of muscles? Physiology. In a muscle that get blocked, these two filaments, actin and myosin. Actin and myosin filaments usually slide like this. Relaxation, tension. Relaxation, tension. Which organ is responsible for tension, from perspective Chinese medicine, the gallbladder, and relaxation liver. So yin and yang in the wood element, tension and relaxation. From physiology, from Western physiology, it's actin and myosin, and then they get stuck. Why do they get stuck? Because ATP is missing. ATP is the software for the muscles. So this is the reason why laser is so powerful in neuromuscular diseases, in many forms of spasticity. This is from the last but one. It's actually still the most recent. Next week, the next edition will come up from the ZAA, the central paper of auricular medicine and acupuncture. There I had the title, Laser Meets Mitochondria, Yang Qi Energy, not only for the meridians. I talked about meridian massage, what you heard before, but focusing that the laser has these effects on the ATP production. It's fascinating for relaxation of muscles. Yeah, we heard about the study from Roberta Chaw from Lancet, so one of the most high-ranking journal in medicine. Situation what we see quite often in our clinics in Germany and in Portugal is the so-called frozen shoulder, adhesive capsulitis. So we have significant restrictions of movement, which is already inside the joint space, and it causes inflammatory processes in the glenohumeral joint, and either not possible anymore or only under pain motion is possible. Usually the motion is significantly restricted. And we once again just stick to this. We now just have to get from the back of our mind, from what we heard in the morning, well, there is an inflammation. What is the laser doing? It's anti-inflammatory. It reduces the release of pro-inflammatory substances, prostaglandins. It enhances the blood flow, so the inflammation is better attacked. It enhances leukotaxis, so the inflammation is better attacked. I have contractions, I have limited motion, I bring boosting the mitochondria, I bring boosting ATP, so I have a muscle relaxating effect. Degenerative changes in the shoulder region can originate from bones, from the tendons, from the ligaments, muscles, mucous bursae, so many parts can be degenerated, can be affected in the case of the frozen shoulder. A distinction is made between periarthritis, humeroscapularis, omarthrosis, cervicobronchial syndrome, and frozen shoulder. So frozen shoulder is only one of the topics in which we can work with acupuncture, in which we can work with the laser efficiently. Typical for all these is pain in the shoulder, which usually is not only fixed to the shoulder, but usually is irradiating into the neck region, plus minus the upper arm. Due to an inflammatory process, the mobility of the joint is restricted, is almost frozen. In more persistent cases, It can even come to atrophy of the upper arm muscles in the persisting of the disease. There is one very dangerous disease in where we have this reduction of muscle tissue in excess. This is the complex regional pain syndrome, or the former Sudeck syndrome. And in the Sudeck syndrome, which is the worst case of neuromuscular disorders, the laser has been shown to be effective in clinical studies and in our clinics as well. Here is a wide range of different acupuncture points that might be working in the frozen shoulder or other shoulder issues. So don't take it as a protocol. Dr. Weber said all these acupuncture points have to be treated in the frozen shoulder. I always, as you will see especially tomorrow and a little bit in the examples before, I always find about the active acupuncture points with this RAC, with this pulse control. I have a selection of acupuncture points in my mind. I test with Noge A points that give an increase of the amplitude in the pulse wave, will be treated, but not all the points will be treated. There is one point that shows up almost all of the time in shoulder issues. This is this painful blocked shoulder point. I think it's on the next slide, yeah. It's written on the bottom here, this extra point, Wai Lao Gong, which is located in the forehand between the second and the third finger. If you look in the Chinese textbooks, they say this Wai Lao Gong harmonizes the flow of blood, and the qi is like the fireprints on the blood. So when the blood is moved, the qi is moved as well. They say it ends, it stops pain, especially in the neck region. Good in neck pain, shoulder pain, and torticollis. You may do with the needle. I do it with the laser, and this is in neuromuscular situations a very effective method. I have issues in the right shoulder. I treat on the opposite side the Wai Lao Gong, and while I'm stimulating this point, I ask the patient, can you please 5 to 10 times move the arm from the right hip to the left shoulder. And quite often you see, first this goes like this, you continue, and with every movement it's getting better, and in the end he achieves this area. Frozen shoulder is not frozen shoulder, and there are overlapping with other muscular or joint issues. Always think about the Chinese anatomy. So when you have, here I stop, I can't bring my arm up here. This is the small intestine meridian. So for this, the small intestine 3, the Hoxie point, is an important distal point for the shoulder. And we do it likewise. We treat the point contralaterally and have the patient repeatedly doing this movement. And you see, likewise, more and more, he is able to move it back. When we have, oh, this is okay, I can do without any restrictions, but the abduction, it doesn't work. Any point that comes into your mind? It's opposite to the Neguan, the Weiguan point, the triple heated 5, which we stimulate and have the patient to do this movement. In February, I had in Portugal, they told me he's among the 10 richest people from Switzerland. He had 2 operations in the shoulder. Still, he couldn't play his beloved golf anymore. It took me 2 treatments. Yeah, I did treat 2 or 3 really hardly constricted trigger points, first with a needle, and then I worked with the laser. And after this 2 treatment, he went back to his beloved sport. So this is what I see very, very clear. 5 years ago, I would have said, I can treat any golfer's elbow, tennis elbow, with less, maximum 5 treatments. And then I got from the pharmacy in the same house where my clinic in Germany is, he told me, you have been telling so much about the laser, I have tennis elbow. I said, oh, no problem. First treatment, second treatment, third treatment, fourth treatment. I said, I don't see. Yeah, for an hour it's getting better, but then it's getting worse again. It took me 15 treatments to get rid of it. So be careful with predictions when you tell patients, I can treat within 5 treatments. But really, golfer tennis elbow should usually get better, significantly better with the first treatment, and normally doesn't take more than 5 treatments to totally or nearly totally resolve it. Yeah, the ear acupuncture points. Of course, there are these local points reflecting the affected joint, the shoulder point. Quite often it's associated with the area of the cervical spine. Once again, here would be a joint. Thymus point is an anti-inflammatory point. Sometimes they are, so the Shenmen point can be effective. Buridol is an emotional, stabilizing, harmonizing point. Interferon. What is the body point for interferon? Spleen 4, perfect, perfect. I don't have to come back, they know everything. Tip of the tragus, very powerful pain relieving point. The volume equivalent point, muscle relaxating. We have 3 omega points, omega 1, omega 2, omega 3, the omega main point, and the thalamus point, which equals our HERGU, our large intestine 4. When it's more an inflammatory process, then quite often the prostaglandin E1 point, there it is, on the rear side of the back is very powerful to relieve the pain. I cannot judge how effective they are in their treatment, but as you know, I just came back. I was half a week in Taiwan, and every day I had 3 to 4 lectures, and many of the lectures were in hospitals. And when I went to a lecturing theater, I went over the wards. And the Chinese are brilliant to keep 20 needles between their fingers. So the patient was sitting there, clack, 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 clack. So within, I would say, at the most 40 seconds, they put in 5 points in the ear. In one of the hospitals where I had 3 hours for lectures, I asked them, how do you find out the ear points? And Kiki, I know you don't work that much with ear points, you love the master tongue, but you may write in the comment, there are some clear defined ear points, like the allergy histamine, top of the ear point, top of the ear, which is easily detected. But for finding ear acupuncture points, maybe in the last slide there will be an ear chart. You have more than 100 ear points. You have to know the RAC, the Noger reflex, to get the precise location of the ear point. In the body point, the better you are. I always say it's somehow like throwing dart arrows. You get some effect if you get in the circle, but you get only the full effect when you go into the black with your dart arrow. And it's more important even for the ear acupuncture points. Did Kiki write anything in the comment? Frozen shoulder, resonance therapy. Give me some. I don't have in mind. I have to go to the computer what I did write as a suggestion. Give me some suggestions which resonance might be working for treatment of shoulder or maybe in general neuromuscular issues. Noger-C, yes, this would be, from what we mentioned today, definitely be the first resonance, perfect. It's what I called in the slide, in the overview, the orthopedic resonance, 1168 hertz. It is in this part of the ear, the zone dominant resonance, which most likely will be very effective in this situation. Yeah, B and C are the first. It could be some issues from the spleen to better nourish the muscles, but most likely, I agree 100%, it would be the Noger-C resonance. However, there are many other resonances. Let's see, what is the next? Pain frequencies. Barr described pain frequency. He had the pain thalamus resonance and he has the pain prostaglandin resonance. So different pain resonances might be working. He found for many joints specific resonances. There is one shoulder joint resonance. And as I just described, triple heater, small intestine, lung meridian. The meridians may be the organ frequencies according to the meridians might be another choice for the treatment. And what I said as well, we could here add self-heal like always, and we can add the bar 5 anti-oscillatory resonance. How often to treat? And once again, the Chinese have as much proverbs as they have inhabitants. There is another proverb. If you stand on the shoulder of giants, you can look into the future. So if you stand on the shoulder of Sun Tzu Miao, if you sit on the shoulder of Kiki, if you sit on the shoulder from Professor Barr, you have visions for the future. And the Chinese say, the more acute a disease is, the more frequently you treat. The more chronic a disease is, the more less frequent you treat. So in the acute situations, twice a week, until reduction, significant reduction, or even pain-free, total duration of treatment. In the really frozen shoulder, 8 to 10, maybe 15 treatments. Continue. Question?
Yes, question coming from Pak Kiki.
Yeah.
So he over Zoom. So Mas monggo.
So for the Teknik, it's always a task to switch over from one presentation mode into the other. Or you can you don't have it on the cell phone.
Oh, you want to?
If it's difficult to switch over,
Can you use phone?
I'm afraid when I come over here to read it, it will get. Wait a minute. Okay. Questions from the audience?
Thank you, Dr. Weber. I want to ask if we can use the resonance therapy for other method of point selection, if like tongue points or scalp points, but we choose the nosier or bar. And second, I want tips, because in Indonesia we have so many color of skin. If the person is very dark, should we prolong the therapy or not?
First part of the question, yes. Any acupuncture point, any system whether it's the system for I'm getting out of the whether I'm treating points, ear, hello. Whether I treat master tongue acupuncture points, whether I do Yamamoto acupuncture points, the resonance can be applied in any system. The second part of the question I forgot. Yes, important question. Dark skin. Yes, so perfect. So in the end, I tried all the microphones here. Next time probably I get the flexible. Yeah, tomorrow. The dark-skinned person definitely absorbs more photons superficially, gets much less penetration of photons down into the chi, where we want to move the chi. And there I have to enhance the duration of the treatment. I may, it's good, it's okay. Or I put it away and just raise my voice. I may just calculate and say, in a darker skin, I need about 15% and calculate this on top of the 4 joule. Or I always answer like this. Once I know how to use my thumb, this will give me the answer I treat. As long as I found the increase in the amplitude of the pulse, when this is going back to normal, then I know the point is sufficiently treated. Did you get the answer from Kiki? No, he doesn't need to answer. This was the reason why. Kiki, you see, you bring. He isn't even online now. Wow! But we can't hear you.
Ich spreche jetzt auf Indonesisch, das war meine Frage. Ja.
Gut.
Ich übersetze auf Deutsch. Saya ingin bertanya pada Michael, karena di sini banyak kawan-kawan yang melakukan Japanese Akupunktur, banyak kawan-kawan yang melakukan Master Tong Akupunktur, banyak kawan-kawan yang melakukan balance metode Akupunktur. Apakah dengan tadi dia cerita tentang RAC, apakah kita juga dapat menggunakan laser di dalam diagnostik, di dalam rangka hara diagnostik, di dalam menemukan poin-poin atau area-area yang sensitif, menemukan live point di dalam rangka balance metode. Saya terjemahkan dulu dalam bahasa Jerman. Michael, hier sitzen viele Therapeuten, die Japanese Akupunktur beherrschen. Die beherrschen Master Tone Akupunktur, die beherrschen Balance Methode Akupunktur nach Dr. Tan. Du hast über RAC gesprochen. Meine Frage, kann man mit Lasergerät entsprechende Diagnostik in den verschiedenen Systemen, die ich gerade erwähnt habe, auch benutzen? Und wenn ja, kannst du vielleicht etwas konkreter sagen, welche Frequenz und wie man das eventuell macht? Sicherlich interessieren die heute eigentlich sehr, wahrscheinlich trauen sie nicht zu fragen.
Ja. Wir werden das natürlich, jetzt sprechen wir auf Deutsch, excuse me, wir werden das natürlich morgen nochmal im Detail auch besprechen. Vielleicht kannst du, bevor ich gleich loslege, nochmal kurz sagen, ich hatte ja gesagt, so Ohrakupunkturpunkte kann ich meines Erachtens nur relativ genau festlegen, wenn ich auch den RAC kann. Ich meine, wir können uns morgen mal 10 Ohren angucken und werden sehen, wie unterschiedlich die aussehen. You can answer in Indonesisch.
Nee, du kannst auch Englisch erklären.
Okay.
Erklär mal direkt auf Englisch.
So you agree, du stimmst zu. Bei Ohrakupunkturpunkten macht es Sinn, den RAC zu können. Ja.
Kann man auch bei Diagnostik machen?
Yeah. So first of all, Kiki agrees for precise ear points, it's the best to know the RAC to find them. Next question is, how is it in other systems? For Master Tongue, I can tell you, yes, with the Nogier resonance, you do find active Master Tongue points as well. You do find the classical meridian points. You find extra points, like, for example, just the Bailao Gong point we mentioned. You even find issues in the root channel. You even find capsulitis points that are not in a typical acupuncture point. I know some areas of the Yamamoto scalp acupuncture, where the especially Nogier resonance is good working. For the treatment, it's not that easy as it is in the Nogier system, where you have just according to the ear zones already 7 good answers for body points. So once you find the shoulder point in the ear active, you can find the best resonance for treatment is the Nogier C. As you said, you can be sure it's the best resonance for the shoulder neck region as well. Once you find the stomach point active, the gallbladder point active, you can be sure that the according body points with the same resonance will be active. So for the Nogier resonances is very, very easy in most, with few exceptions, in most situations you find directly by observing the ear the best resonance for the bodies. Sometimes you get what we call parasital resonances that shouldn't be in this area, but in generally spoken, the resonance from the ear is the best resonance for the body point as well. In the other systems, it's quite often that you find the according organ resonance from the scalp, for example. You find the according resonance best working. So when you have cervical resonance area, the cervical spine resonance will be working the best. And I said yesterday evening when we were in the restaurant, but I want to focus on the Nogier resonance for fields of disturbances. When I've seen you treating patients, quite often you do not use the laser, you do not use a 3-volt hammer, not a gold-silver hammer, you just use your finger or the needle and go over the area and feel by this the feel of the pathological area, or 8813 master tongue point or something like this. It takes a while to come to Germany.
Pak Kiki, can you hear? Pak Kiki bisa dengar?
Oke, Michael, terima kasih Michael atas jawabannya.
So thank you, Michael. That's what Kiki said.
Yeah, I'm impressed. So many thanks to the technicians that they connect us. I don't know, 8,000 kilometers distance from here. Within 2-3 minutes, they make it possible to talk with each other. So applause. So, from the audience, more questions? I think there was one, yeah.
Thank you. In case of frozen shoulder that you have explained just now, I want to ask if we compare the method of laser therapy with other modalities, which one is better? I mean, whether there is research or publication to compare the result of the therapy, which one is better? Second question, if we combine the therapy of laser with other modalities, is it possible, and whether there is a publication or research about this? Thank you.
Yeah, thank you very much for the questions. The good thing about the laser is it can be combined of treatment. Combined coming for other contraindications from the morning. Yes, I can combine the laser even with chemotherapy. I can combine laser with radiation therapy. I can even, if there are burnings from gamma irradiation, I can treat the burnings, not with red, with infrared laser. What I took out this slide to don't overextend. In the end, I don't know how is the availability here about Chinese herbs. Is it easy to get Chinese herbs here? Yes. So I would say up to 80% of my patients get herbal therapy, sometimes European herbs. Time they get Chinese herbs in addition to the acupuncture, laser acupuncture treatment. I don't know whether it was 20 years ago, every child, newborn child, had the so-called KISS syndrome, the induced symmetry devariation of the head. So, depending how they were delivered, sometimes they have for the first few days a little bit deviation, but all of a sudden, all the children, up to 80% of the children had this KISS syndrome. And some of them really agreed they had. So the good physiotherapist, sometimes the osteopath, gets pretty good results, but after a few days, it goes in the same position again. So in this situation, for example, they do their manual therapy, and then going with the leg, which has with 1 or 2 treatments lasting. There are some fantastic combinations, different sorts of treatment. As I have many patients who come from far distance, what I often like to do, this pressing needles, this intracutaneous needles, this is you. I try again. For a short time it's running, and then it's running into issues again. So let's say gallbladder 21, lots of shoulder pain. Maybe I do some trigger point with a long metal needle, then use the laser. But then I would say I put a pressing needle on this intracutaneous needle and tell the patient twice a day, your wife is treating these points with some movements. So there are many different treatment options. Or in Europe, I would say 20% of the population is running with these tapes on the shoulder, on the knee. This is another form of good combination. Yeah.
I'm sorry, one more question. I am practicing Yamamoto, and I read in the book of Dr. Yamamoto that for children and some people who cannot be needled because of afraid, Yamamoto suggests to use laser. But this book is written in 1987, but currently already to 2025, in which maybe there is a technological gap between 1987 and 2025. My question is about the safety of the laser for application in Yamamoto acupuncture. Thank you.
Well, I have a limited number of acupuncture points, of zones that I use from Yamamoto. I did two days or 3 days courses on Yamamoto, so I'm not Yamamoto specialist. But yeah, I know that one of the teachers said, Yamamoto has been using the laser in limited number of indications, and of course, since 1987, the lasers had maximum output power of 20, maybe 40 milliwatt, and now we go to 200, 500 milliwatt output power of the device. And at that time, there was two producers who worked with these resonances. So I doubt that Yamamoto did work with resonances. But yeah, I have a specialist from Greece who is treating 60-70% of the patients with Yamamoto and has laser as well. I will discuss and let you know. Yeah, definitely. Yeah. There was somewhere another question, wasn't it? No. Good. Oh, you want to say something? No. Can you put to the presentation mode again? So, laser acupuncture in obesity. Well, I may say a few words before. Wherever I go in the world, obesity is requested as a topic for the lectures. I always don't like this topic too much, because in the end, of course, there are metabolic disorders, but in the end, we are what we eat. Everything what we eat becomes part of ourselves. And most often, it's the demand of the patient to persist with the obvious wrong diet and just get a pill, a laser treatment, an acupuncture treatment, herbs, by which the side effects of the poor eating, of the wrong eating, of the excess eating can be counteracted. So, most important in obesity is the change of mind and the change of diet. Having said so, yes, there are some acupuncture points that have been described to boost or to enhance metabolic processes. There are acupuncture combinations that are effective in excessive overeating, in psychological burdens. These are protocols that are connected with the ideas of the so-called North Atlantic Detoxification Organization protocols, of the NADA protocols. If it's really like smoking, like heroin, other drugs, if it's really a dependency, if it's a psychological disorder, there are some very powerful, especially ear acupuncture points that can be treated. Of course, with the laser, I bring chi energy in the body, and I can tonify the middle sanjiao, I can bring more energy, the patient gets more energetic and gets out of the vicious circle. But in the end, what I've seen in most of the patients, they come with this request because they want to find a way to stick to their poor habits and just get an excuse. Well, I did this, I did this, I did that, I didn't lose weight. So these are the general remarks, because I think the change of mind and the change of eating habits is the guiding things. Well, what is obesity? Describes a state of being considerably overweight through an excess buildup of body fat with multiple pathological effects. Accordingly to the definition by the WHO, obesity is defined as a BMI over 30 kilogram per square meter. And, well, I have to be careful to run this way. You are smiling. You are naughty. Obesity is a worldwide, increasing obesity is a worldwide problem. Unfortunately, in Europe, Deutschland, Germany is head of the obesity. My new home, Portugal, is in the mid-range, so significantly less overweight, obesity. So the dark arrows say it's overweight, and the light blue and these pink ones are those from real obesity. After ruling out metabolic disorders, a holistic training program is recommended, what I just tried to state out before. Dietary advice, and adjustments. Psychological treatment to strengthen the self-esteem, the trust in itself, and exercise. But if we calculate from the amount of calories to get a reduction of weight, usually patients are lacking the time to burn down what they have been eating before. The terrible thing is there is this vicious circle. It's not only the obesity. The obesity is the highest risk factor for developing the metabolic syndrome. The metabolic syndrome is the highest risk factor to develop diabetes. So we have hyperinsulinism, high insulin levels, obesity and increasing adipose tissue, downregulation of the insulin receptors, increasing hyperinsulinism, we need more insulin. Finally, the pancreatic gland, the beta cells, can't anymore. They are given by God, by nature, for a 75 kilogram man and not for a 120 kilogram man. This will lead in the end, at the worst, to manifestation of type 2 diabetes. Then we take the Peitsche, what's the English word for Peitsche? We press the beta cells anymore by giving them metformin to exhaust, and many times in the end we have the insulin-dependent type 2 diabetes. Well, obesity in Chinese medicine. In Europe, we usually say spleen, pancreatic gland meridian. So they are for sure closely connected with each other. In accordance with Chinese medicine, persistence eating of incorrect foods, and these are, I'm not that familiar right now with the Indonesian diet. In Europe, it's overeating of animal-based proteins, especially of dairy, of cow milk products, and overeating of free carbohydrates of sweets. This leads to weakness of the spleen. This leads to qi deficiency, the clearing function, the dirty stuff with the stomach qi down, the clear qi up to the lungs to meet the qi of the lung is not working anymore. And this is what we described in the early morning. This is the way the middle sanjiao is working, bringing down what has to be excreted by the bowels or by the urine, bringing up the positive energy, the clear qi up to the lungs. And once this getting like dampness, I first get qi stagnation, and when it's stagnated for a long time, it gets into the rebellion qi. So, moisture and mucus retention. The middle sanjiao produces the phlegm. Undurably, it doesn't want to do so. And the cup for the moisture is then the lung. This is from one of the ancient Chinese textbook where you find the spleen. You all know this. In the middle area of the tongue we have the spleen and the stomach. In the front we have tip of the tongue, the heart, afterwards the area of the lungs. So these are findings you might see in obesity. The tongue has a slim covering. When excess of phlegm is present, you see already the tongue is, I can't anymore. You see these impressions of the teeth around. This tongue has a white and grazy coating and lots of red dots. So it's already that the qi stagnation. What is when something is stagnated? It's difficult to move, and on the surface may heat turn up. So there are already some heat signs, not only in the tip of the tongue, reflecting probably an acute infection. What has been described in the literature are, once again, of course, points we mentioned earlier on. The Shu points, Pi Shu, Wei Shu, are points on the large intestine, GU probably not the typical point you would expect. The large intestine 11, the Kuchi point, is very powerful in tonifying the spleen, and at the same time has a good effect to release the liver. A very powerful point for tonifying the spleen, the distant point, the Sanjinjiao, and the master point for the phlegm. Well, it's not a typical master point, but the most important point to transform phlegm into fluidity again is the Feng Long point. Rank 12, Song Wan, which is the master point of the Fu organs, will be active in almost all patients with obesity as well. Now I'm back. Acupuncture is fantastic when I have qi blockages in the meridian. Laser acupuncture with blockages in in the meridians to move the qi with the laser is a bit more effective than the needle acupuncture, to my opinion, because I can do this meridian massage. Once I have chronic, and obesity is always a chronic situation, the dampness, which is the first stage, getting stagnated and becomes phlegm. And to relieve phlegm, of course we have points like the Feng Long point. And when I have acute sinusitis, it's good working. In the children, we have, even in the chronic situation, this extra point, Bai Lao Gong, very powerful in the children. The Feng Long is not that effective, but the Bai Lao Gong in the back. Once you have organized dampness, once you have phlegm, to my opinion, in addition to change of diet, you have to work with herbs. And the most important herbal remedy to transform phlegm, or the most simple one and effective one, is the so-called urchin tongue, the twice decoction. Then there are the two simple combinations as well. The one is the 4 gentlemen decoction, San Se, the 4 gentlemen, Se Yunsen Tang, or the 6 gentlemen decoction, 6 San Se Wu Liu 6, the Liu Yunsen Tang. The 4 gentlemen decoction is more tonifying, and the 6 gentlemen decoction has, like the urchin tongue, a combination to not only tonify but transform phlegm back into dampness. And once it's in dampness, I get it easier target with the acupuncture or the laser acupuncture. But obesity with phlegm, to my opinion, always requires the combination with herbal therapy. Possible acupuncture points you find in the literature, and we find active in our clinic, are the local points, rarely the mouse, which is in the area of tragus. We will quite always find active the stomach, point. Then we have the vegetative channel on the upper part of the ear. If it's lots of thrive to eat, the desire point is active. Many of these patients underwent a huge amount of different reducing techniques, then antidepressant point in the end of the sulcus is active. Occasionally it's even not only depression, but it's aggression, anti-aggression point in front of the intertracheal sulcus. There's a hunger point on the tragus, larynx point. We mentioned already several times before psychosomatic points, the Haldol equivalent and the Buridol point. And interesting, quite often, the so-called laterally control point. If we go probably in a follow-up seminar into more detailed ear acupuncture, the points on the right ear are not in the left ear. There are differences between both sides. Organs that are in the midline, like the stomach, they are always on the dominant side. So once you are right-handed, you will find the stomach point more active in the right point. You always find it on the left side as well, but more active on the right side. Once you have shoulder pain on the right side, you will find the shoulder area more active on the right side. Once you have knee issues, you will find the knee point more active on the right side. Do you know how to test for the laterality? Are you all sure whether you are left-handed or right-handed? Or is anybody insecure whether he is right or left-handed? Yes, you already show once of the things. If you just without thinking, clap your hands. So the right dominant person will clap like this. On the left hand, the left, clearly left-handed will do like this. And if you clap somehow like this, it may be educated, but most likely it can be a sign, oh, you are not clearly decided about one or the other side. Fritz, is this expensive or it's not looking? Is it expensive or can I just throw it into and wait whether they grab it with the right or with the left hand? The way how you catch will give you some information. The next possibility is, once again, without thinking. When you start to think, it's not working. Mr. Guinea Pig, you always volunteered. Now I will ask you again. Can you please come here again and look into into the audience, and then don't be surprised. Sorry. So what did he do? It was the right. So you always try to protect yourself with the dominant side. So most likely must be right-toed. Thank you. And for demonstration purposes, I just your left side. I didn't ask you whether you are left or right-handed. You could check, of course, under pulse control, where is the more prominent reaction, and by this you can get some information about the dominant side as well. Yeah, once again, my beloved Newton swing. I take one ball, plop, 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 let it go. So the last will swing in the same time. What would be resonances in obesity? If I say lots of these patients suffer from psychological, psychosomatic diseases, we recall our ear, F and G region. It is what I see more of the F and G than the nutritional resonance B, what we see. Bar 5, anti-oscillatory, universal resonance, always good. Self-feel, always good. And then there's interesting resonance. I must admit, sometimes I get it as a powerful resonance, but by far not always. You may try it, the appetite suppression resonance. Unfortunately, Reimers and Janssen, they always have Noget A to G. They always have bar 1 to 7. They always have self-heal. They always have bar pain thalamus. But sometimes they have the appetite resonance, sometimes not. For some reason, the program is different over the years. So if it's a big topic, any resonance can be set in this pen. In the box, in the physio laser, it's much easier to program resonances. Stomach, spleen, organ frequencies could be effective as well. How often? So you see, I always treat under the pulse control. Treatment interval once a week, maybe occasionally twice a week. Treatment duration 10 to 15 treatments, sometimes 20 treatments, and some patients get addicted. They never want to stop the treatments. Then let's, in the end, on this topic, come to some informations about the light on its own, on the laser at itself. Low-level laser therapy for fat layer reduction. Comprehensive review, once again with Michael Hamblin from Harvard Medical School in the team. The studies they reviewed as altogether suggest that LLT has a potential to be used in fat and cellulite reduction, as well as an improvement in blood lipid profile without significant side effects. There is some idea that one of the proposed mechanisms, modes of action, is the production of transient pores in the abdominal layers, in the adipocytes. By this, lipids may be leaking out. Another idea is that through activation of the so-called complement system, of the complement cascade, could induce the apoptosis, the programmed cell death of the fat cells of the adipocytes, with subsequent release of lipids into the bloodstream. And what you see, if you irradiate with a laser shower and measure half an hour afterwards, you have a temporary increase of triglycerides in the bloodstream, which is resolved afterwards. So there is some effect of photobiomodulation on the abdominal fatty layers on its own. But I wouldn't say it's a method of choice. A bit more effective, not topic for this, not acupuncture. If you insert interstitial needles, 4 on the right, 4 on the left side, the absorption maximum for fatty layers is not in the red, but in the infrared area, especially above 900. Then you get marked reductions in the abdominal circumference. But it's an invasive method and has nothing to do with Chinese medicine. Break?
Yes. 10 minutes breaks.
10. So 5 past 3.
Cek. Ya. Beri tepuk tangan yang meriah untuk Dr. Michael Weber. Ya, kita pantau sepertinya Bapak dan Ibu ada yang sudah oksigenasinya ke bagian kepala berkurang. Kita ice breaking dulu Bapak dan Ibu. Mohon untuk berdiri. Ya, monggo berdiri dulu untuk melancarkan oksigen kita supaya dari kepala turun ke kaki. Silakan Bapak Ibu nanti ikuti gerakan yang ada di layar monitor. Sekarang, ya. 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 Oke. Ya, gerakan memukul Bapak Ibu. Ya. Oke. Ya. Ya. Oke. Ya. Ya, oke. Sekarang gerakan seperti menari. Ya. Ya. Oke, bagus. Kita ganti gerakan sekarang. Seperti memutar, ya. Ya. Oke, bagus sekali. Yang terakhir, seperti memukul dengan 2 tangan. Wow. Oke, tepuk tangan untuk kita semua. Luar biasa. Sudah fresh Bapak Ibu? Ya. Oke. Silahkan untuk Bu Uli. Oh masih break ya? Oke, iya masih break. Jadi silakan Bapak Ibu bagi yang ingin ke toilet atau mungkin ingin minum-minum dulu silahkan. Ya, silahkan. Cek. Bapak Ibu, bagi yang kehilangan tab bisa ke sumber suara. Barangkali Bapak Ibu ada yang membawa tab. Kami menemukan sebuah tab di masjid. Mohon ke sumber suara. Nggih. Ya, ada nggih.
Selamat siang teman-teman semua, mari kita segera berkumpul kembali. Materinya masih banyak, jadi supaya cepat-cepat. Mas Rifki mana Mas Rifki? Mas Faik, pakai bumper satu kali ya. Bumper ya.
Yeah, we come to the last part of today, which is still about 2 hours left. First part, or first welcome to the online people as well, even to Germany. The last part, when I have it correct in mind, there it's already coming. Last but one, I have to say, laser acupuncture in pediatrics, allergy, speech delay, ADHD. When I have it correct in mind, tomorrow there will be a case with speech delay. So I would like to go into this tomorrow. How big is the topic of allergies here? Pretty big. Okay. Then I would like to demonstrate. Maybe we can't do it as a full thing, but as it's a pretty easy program. Who wants to volunteer to demonstrate for the demonstration? Actually, it would be good if it's a man. Any man who wants to volunteer for treatment allergies, but she's not a man. But she's suffering from allergies. No, we can do it. Let's ask you, what sort of allergy you're suffering from? Skin rashes? Is there any background ever tested? It's getting worse once you eat pepper, once you eat carrots or whatsoever. Is there anything known? Cold weather. Of course there is an approach as well, but this is not that one that I wanted to to describe. I wanted to describe food allergies, allergies due to house dust mite and things like this. Oh. Oh. So, if nobody else is volunteering, I would ask you again to come. You know, it's just tomorrow. What I'd really like to do a real treatment. What I need for the allergy treatment is the allergen. Now, to what are you allergic? Okay. Yeah. So, can you yourself, your husband, boyfriend, your parents ask this evening to take away the cupboard and get some house dust mite from your home? This is the best realized house dust mite treatment. So anybody from here who's maybe it's still working to get some house dust mite put it in an envelope, so then we will use it. Then we will use it tomorrow for the treatment. Yeah, so this I would need for the full treatment. But I would like to show you the maneuver, what we are doing with most of the time great, fantastic results. So at the best, but for demonstration, it works. It works even here. At the best, one performs the treatment when the patient is lying. Can we, for tomorrow, put some, yes, that people can lie on? Yeah. The whole idea. An American colleague, what's allergy? Our brain, especially the area of the hippocampus, tells us house dust mite is dangerous. Be careful, you have to overreact against this. Carrots are dangerous, pepper is dangerous. Of course it's not dangerous. So it's a misprogramming of the area of the hippocampus. And he found out by the irradiation of certain acupuncture points, while the allergen is located in the lower abdomen, somewhere in the area of conceptional vessel 6, the chi high point. And once it's located there, you treat with a laser the first 4 meridians: lung, large intestine, stomach, and spleen, the beginning and end points. While this is located there, depending if you have a child in which mother tells you, for the first time he reacted, then it's maybe good with 1 or 2 treatments. If a patient comes, for 8 years I'm reacting on bananas, then you may need 4, 5, 6 treatments. So you slice a fresh banana, put in the area of chi high, and then treat bilaterally lung, large intestine, stomach, spleen, beginning and ending points. And surprisingly, it's most of the time working. In diary allergies, I think the success rates are close to 95%. In house dust mite, it's still close to 90% from trees and plants. It's 80 to 85%. And of course, with the laser, it's pain-free. One of the most striking cases I had, 8 or 9-year-old child with cow milk allergy. She was admitted 3 times to intensive care unit because first of time they didn't know, second time they had already suppositorium with corticosteroids, and the third time they even had an adrenaline pen at home, and still she had to go to the intensive care unit. And I thought, well, it's a little bit dangerous. So when I put the cow milk, I diluted this tenfold. I put it on the skin, and she directly, and you can. So I treated first of all the tip of the ear. Tip of the ear reflects blood of 40 from the knee. So what I mentioned before, we put a cable here, electro cable, and put it here and feel the pulse, and you will get a change in the pulse. This is the histamine or anti-allergy point, tip of the ear. So I treated this, then I treated, I think, by Hui and another Shen relieving point, and then I put the milk in a glass cup with no contact, and still she had a little bit of itching or remaining itching, I'm not quite sure. We did it 4 times, and then she went to a birthday party. Everybody was drinking milk, she was drinking milk as well, and she only got diarrhea, no admission to the hospital, and after 2 treatments, it was gone. Yeah. So these are quite often the effects, what you see. So for the demonstration, it's pretty easy. I always this was good. I always start on one side, then go to the other side. So what would be the starting point of the lung meridian? Lung 1, which is under the clavicular, 1.5 thumb below it. So lung 1, lung 11, Shao Shang, then Shang Yang, large intestine 1, then the large intestine meridian, thank you, crosses, as you know, over to the other side, large intestine 20. This is why I love to know most of the Chinese acupuncture terms by name. Yin Xiang, getting the flavor, the smell again. Yeah. Then the next would be the stomach, with the same effectiveness, and once again, to be secure that nobody would sue against me, I replace the stomach 1 with the subai, with the stomach 2 point, which is direction I, straight forward in the line of the pupil, around the infraorbital foramen. Then what I have seen, it's okay, yeah, I'll do it like this. Yeah. Then we would go, not there, for stomach 44. You may go for stomach 45 as well. I found most of the time the nating, the stomach 44, more effective than the stomach 45. Then we go to spleen 1 and to spleen 21, and then we do the same on the opposite side again. Quite often, if there are severe allergies, on the first appointment, they will have some rash, sometimes a little bit itching. On the second time, usually it's already gone. Sometimes they get a little bit watery discharge from the eyes as well. But the worst thing, what I mentioned before, in the severe cow milk allergy, I've never encountered anything like this. What would you expect? What could be good resonances for this form of treatment? B, the nutritional resonance would be working well. Yeah. And of course, once again, our cell-field resonance would work perfectly. Yeah, I don't see any difference. Both resonance are perfect in this respect. So when you find in the textbooks, allergic rhinitis can't be cured, allergic conjunctivitis, hay fever can't be cured. Yes, we really can reset our brain, our hippocampus with these distal points. And students from all over the world have copied this method with fantastic results. Very easy, not painful, rapidly applied, and you'll get good results. You'll get good results, really good results with this. What you may do, if there is more than a little bit reddishness, you may use with nausea. If there is, it's still itching, then go point by point by point, or irradiate with little distance over this area. This will acute disharmony, this will reduce the itching, and will reduce the hives in the skin. And the principle behind it is what we mentioned in one of the first slides. Laser stabilizes the cell membranes, so there is no local release of histamines anymore. So very, very easy, very effective method. Thank you. Are you here tomorrow?
Yes, so
Good.
I'll be here.
I can't work with you tomorrow. You have acute allergic rhinitis? No. Right now, not. Okay. Then we can start with the slides. Yeah, attention deficit and attention deficit hyperactivity disorder, or attention deficit hyperactivity syndrome. The most common neurodevelopmental disorders of children, plus minus attention, plus minus the hyperactivity, incidence roughly 10%, in some countries up to 15%. It's far more common in boys than in girls. There are numerous comorbid conditions. There is no typical equivalent in the ancient Chinese literature to this. Well, poor parents, poor child, what are the symptoms? Reduced concentration, they are not focused, attention reduced, impulsiveness, motoric restlessness, poor social behavior, sometimes even aggressive behavior, and what worries the parents most of the time most, poor school performance. By definition, hyperactivity improves mostly with aging. The concentration disorder usually persists. 1/3 to about 50% will show even symptoms as adults. And there are these two basic types. The fragility type, Philip, who can't sit still at the table, and the other one is the Johnny Head in the Air. It's a 100-year-old German illustrated book. He will think about, oh, you don't know, and run into issues, and the other with the hyperactivity will go forward and sideways with his chair until everything is destroyed. Well, the Johnny Head in the Air is not much better. He's landing in the river or running against pillars on the street. Both of them will have their difficulties in life. What is the answer from Western medicine? Vitamin R. I think it's here the same in most countries I've lectured on. Ritalin is the name under which is sold in most countries. Concerta medicinate basically have the same. Methylphenidate, sometimes amphetamines are used, sometimes modern substances like atomoxetine, Strattera is in use. How is this substance working? It's working on the synaptic space. It has an effect on dopamine. The uptake of dopamine is altered by Ritalin. If you look into the official paper that comes with the Ritalin medication, it says it may induce hyperactivity, it may induce impulsive disorders. There is a good number of patients in which really the school performance significantly improves. However, there's a huge number of patients who get side effects. And you heard in the morning my love to the mitochondria. Ritalin over more than 2 years does have a mitotoxic effect. With long intake of Ritalin, you attack the powerhouse of our cells, you attack the mitochondria. I just wanted to show it's becoming more and more awareness, even in normal non-scientific papers, that one of the causes from Western medicine, one of the roots of disease, is intoxication by certain heavy metals. Mercury, plumbum, cigarettes can significantly increase the career of those children suffering from ADHS. And the most dangerous one is the shellfish and toonfish. Yeah, this is how puppies, how children should grow up at the best. They should have the chance to run and get their borders They have to experiment themselves as much as possible. Nowadays, you recall Sun Simiao, king of medicine. If children constantly are kept under their cell phone, if they constantly are kept under the curtains, they behave like grass under shady trees. Give the children the chance to reduce their yang qi. The Chinese say children are pure yang. They are full of energy, and they have to reduce their yang excess by exercise. And what happens with all these computer games? They increase their sympathetic tonus. They increase their yang qi to a pathological level, and this of course causes long-lasting disbalances. Unfortunately, I still want to rename this presentation. There is a book, it's not available in English. Come, you can do it, is the title of the book. One of the things we all know. So when you are clapping, I'm getting happy. Praise is encouraging. Well done, perfect, very good, miraculous, fantastic, superb. So, especially the child needs, and from nobody more than from the parents, the praise that they tell them, yes, you are doing good. And this is mind-blowing. You have seen the fidelity Philip, who is emptying the whole table, and you are all sitting on the chair. And I'd like to ask all of you to first sit like this. You can do whatever you want. But when you do this chair edge sitting, at the very edge, probably move forward. Then you have to rest in your spine. Then you have to rest in yourself. If I were to do this, I have to put my hand. So it's very, very difficult to sit at the edge of the chair and still get full movement into the extremities. So this is a very simple maneuver that grounds the people. So if you are like this, you are not grounded. If you sit like this, you have to have almost the feet flat on the ground. It's very difficult, very limited, your range of motion when you are sitting at the edge of the chair. So there's one treatment option that doesn't require Chinese medicine, that doesn't request the laser. Sorry for to say to you, dear Fritz. Let's look into some TCM basic patterns, one of these many proverbs of Chinese medicine. Before you treat the mother, you have to treat the child. Mother and child are a unity. If the child is not feeling well, the mother is feeling bad. If the mother has a disease, the child won't get the attention, the child will feel not well. Very obvious, it's during the pregnancy. They are directly connected to each other by the placenta and by the umbilical cord. We know that severe infections, feverish infections in the mother bring heat into the baby, and this can lead to hyperactivity in the child. In reproductive medicine, we know the syndrome of the hyperactive fetus to stimulate the ovulation, the growth of oocytes, the mother to get in artificial reproductive techniques high doses of hormones. And this leads to heat in the mother, and that can lead to heat in the child and can lead to hyperactivity. And even if we go to the basic ideas of Chinese medicine, we see this mother-child rule. You all knew the Wuxing, the 5 phases of change. So constantly transformed like yin to yang. The wood element is nourishing the fire element. If I have an excess in the wood element, I will primarily get fire, heat in the heart, in the small intestine, in the fire element, and this will lead to hyperactivity. And if it's a huge excess, there is an attacking of the wood element to the earth element, to stomach and spleen. So this mother-child rule is not only applicable in the real mother-child relation, but is applicable in the Wuxing as well. On the other hand, mother and child are a unity. There is fantastic, nothing to do with ADHS, fantastic research, interesting for all the mothers, for the fathers as well. It's not only one way. During the pregnancy, it's not only that the mother is nourishing the child, but for up to 10 years, it's possible to find stem cells from the baby that are reverse given to the mother. So the baby is full of stem cells, full of active stem cells, and part of the stem cells of the baby are given to the mother by the placenta and induce repair mechanisms in the mother. Child gets all the energy from his parents, especially from the mother. Obviously, the baby doesn't have to digest himself by the umbilical cord, gets everything from the mother. If the mother is ill, the child is likely to be sick. They are a unit. Well, all what we know from Chinese medicine in the adult, the pulse diagnosis, the tongue diagnosis, only gives us a little information in the small child. In the small child, the tongue diagnosis is not really helpful. The pulse diagnosis, Chunguanchi, the 3 pulse positions, are in a baby not palpable. You may get one position, one information about the pulse, but not in general. There are specific techniques like looking on the digital finger when there are elevated veins. This gives us important information about the health of the baby. ADHS has many comorbidities. It's not one single entirety. There are many different things behind it. This was ADHS together with atopic eczema, inner heat, and in the elder children we quite often see ADHS together with heat in the lungs. So this is, I think, 14-year-old girl with long-lasting asthma and hyperactivity disorder. I learned most of my Chinese knowledge by Chinese teachers. However, another teacher of mine was Julian Scott, who lived in Beijing for 7 years, translated a lot of the ancient Chinese texts, and he says there is no typical pattern in the ancient textbook. However, what you find, heat, more the hyperactive type. Heat and phlegm, more the hyperactivity type. Pathogenic factor, lingering pathogenic factor, more likely to be attention deficit without this hyperactivity. These are the children in which you find over months, years, enlarged heart lymph nodes. They had a disease, got early antibiotics that were not necessary because it was a virus infection, weakened the digestive system and lead to the upcoming of chronic organized phlegm, this lingering pathogenic factor. Then of course we have the weakness of the middle Sanjiao, more likely the ADS system. We have kidney deficiency in the ADS children. And what I see more and more often is the Sieu deficiency, which of course is more ADS type as well. 80–90% of the children can be treated very effectively with Chinese medicine, herbs plus minus laser, or sometimes laser only. And there is a remaining 10% where at least I don't get a good answer. 5, 6, 7, 8% have gluten sensitivity. Just by reducing gluten from their diet, you may get good effects as well. Yeah, this I mentioned before. In the children, the yin is often weak. The children are very young in comparison to adults, extreme young. They are lively, they are always active, always moving. The yin weakness favors heat heat. Yin deficiency goes ahead with Wei Qi deficiency. So outer heat pathogens enter more easily, and the excess of thermic warm diet, such as chips, junk food, has quite often leads to an accumulation of food and to ADHS symptoms. Yeah, what are the phoenix, the symbol for the fire element? What are the heat patterns in the history? They are always in motion. They are impulsive, they have their temper tensions, they are easy irritable, and they have typically highly disturbed night sleep. Rumblessness in bed during night, restless, awake early, and they are directly on the point. Let's go up, let's do this. Heat burns our yin, so the stool becomes hard, firm, and often the defecation, the bowel movements are reported to be painful. Mother diet, child diet, inflammations in the pregnancy, taking of antibiotics in the pregnancy, high fever, mother who got early labor and got paroxetine to reduce the premature labor can lead to heat patterns in the child. What are the typical heat patterns? The tongue is not that helpful, but red face, red lips are the typical signs. Not existing coating of the tongue. And of course, the pulse is significantly accelerated. So what do you do when you have heat? You have to cool down the heat. You have to dispel the heat. You have to bring the fire element down. Dispel heat and calm the Shen. It's never only applying the laser on certain points, it always general advice about the lifestyle. It's advice about the diet, avoid dairy products, avoid heat, avoid hot, avoid spicy diet. Herbs can help to dispel the heat. Tuina can help. Cupping, which is not easy to apply in children, and acupuncture. And of course, the laser is better than the needle acupuncture. Points that are almost always active in these children is the heart 7, the Shenmine point, most often the liver 2 point and not the liver 3 point. Liver 2 calms down the Shen, disperses heat, and reduces mania-like behaviors. Stomach 44, Nei Ting, a very powerful distal point, disperses stomach heat, has a fantastic effect in acute sinusitis. Liver 4, Gu, disperses heat, and Bai Hui, the governor vessel 20, is fantastic to calm down the Shen. With the needle, very intensive, dispersing, sedating, needling technique, counterclockwise to get rid of the heat. After exertion of the needle, don't put anything on the insertion needle that the heat can better evaporate. From the resonance, initially the first treatments quite often it's the Noger, the resonance of imbalance and disorganization, and in the follow-up treatments by pulse testing you will find most of the time the Noger G, the frequency of psychosomatic disorders, as the most effective, the most working one. This is what you have seen in another slide before. A, comes up, yeah. A, disharmony, disturbances, and G, the personality disorders. Yeah, this is a very, very, very powerful thing you can do at your own, even without the laser. It's not only in the hyperactivity, it's a fantastic tool when children have feverish diseases to open up the water in the heavenly stream, to clear the heavenly stream. So you go from pericardium 7, from Darling, in the direction of pericardium 3, Cursey, and not to ask, am I allowed to touch you? So, probably for the filming, this is better. This is more likely to be the hard side, pericardium 3 to pericardium 7. If you don't have a laser, you can do it with a laser, but it's no need. You massage about 20, minimum up to 50 times from pericardium 3 to pericardium 7, and my dear co-moderator, what do you see?
Redness?
Yes, it's almost, I don't know, can you get this with the camera? It's
kelihatan nggak? Ada garis merah kayak gitu, kelihatan nggak?
You can see it. It's almost as if you can see the pericardium meridian. You see, I massage a huge area, and one would be lung 5. It even goes into the direction of the pericardium 7 point. 3-7. Yeah. 3, yeah. So you
kelihatan kayak ada garis merah nggak di areal perikardium ya? Kelihatan?
Then you even feel it's getting warm in this area. Less than I did of water onto the tip of your fingers, and then you do 15-20 times with the water, and it's already evaporating, and you may use your hand or blow it, and when you want to cool something down, when the water evaporates, it gets coolness. And now you may, you feel when you go over warm, cold?
Yes.
Here we are much more sensitive to temperature changes than from the palm region. In Europe, parents to do cold wraps on the lower limb. Usually high feverish children, more than 40 degrees, have cold lower limb already, so it doesn't help. Here it takes much longer. In the end, when children get 41.5 degrees of fever, they get cold forearms as well, but much later than here. And what's the pericardium? The pericardium is the protection for our heart. So we cool down the protection for our heart, so it's a fantastic method to bring down slowly the heat from the heart. And it's better than paracetamol, ibuprofen, or anything like this, because you really go to the root. You cool down the protecting part of the heart and bring by this the heat from the heart, and by this the heat out of the blood. I think every parent should know this. It's good. It's when the child is really a day with many impulsive situations. It's good. It's not solving, but it really breaks down the temper tensions. Yeah. Thank you. Clear the heavenly stream. Yeah, there I'm doing the same. First, you open up the pericardium meridian, and then you cool it down with the fingers, and then either wait until it evaporates or blow over it, and you get an effective cooling of this. Positive ear points, of course, would be the heart 55 or the Shenmen point you all know. Here in this region would be, we discussed before, the Haldol point, maybe the Valium point, maybe the, when I'm getting too close to the ear, the anti-aggression point is here, antidepressive point. Anti-aggression point from body acupuncture points we already mentioned some. Bai Hui, very powerful, depending what we are targeting for. Maybe it's the liver 2, maybe it's a Tai Hong, the liver 3 point that gets the most prominent change of the VAS, and according to this, we would treat. This next slide, I think, is what I said here, opening the heavenly channel. The next slide is, to my opinion, good to keep in mind for any parents, but especially it's good for those who have children with impulsive disorders, with hyperactivity. I'm just treating in Portugal a lady who had 4 attempts of artificial reproductive techniques, and when she first came to the clinic, she told me, I'm always a bit clumsy. And on the last appointment, when she got by the hormonal stimulation such a red tongue and didn't get any rest, I told her, listen, it's much more. You are not clumsy, there's much more behind. And she started to scream and said, I was diagnosed as an early child as hyperactivity disorder, and I still have the signs of hyperactivity. I know, but you're a fantastic person. You have so many ideas. When we talk, we can't stop talking because you have so many ideas. So we have to change, and I think this is always important. We have to change perspectives. We have to change perspectives once in a while. Don't see your child as I'm afraid it's the German version. Don't see your child as hyperactive. See it as an energetic person. Don't see your child as impulsive, compulsory disorder. I think your child is very spontaneous. Don't think your child is not focused. It's creative. Don't think your child is a daydreamer. Your child is full of ideas and fantasies. Don't think your child is unfocused. Your child is open for new impressions and new ideas and new suggestions. Don't tell me your child is not calculable in his reactions. Your child is very flexible. Don't tell me your child is always searching for getting into trouble, into fights with others. Your child is independent. Don't tell me your child is like an elephant or a monkey. He's engaged. Don't tell me your child is easily exploding. Your child is very sensible. Don't tell me your child is aggressive. Tell the child he's self-confident. Don't tell me your child can't concentrate. Tell your child you are unique. And once parents understand this change of the view, they are already 90% on their way. I think this is a very important slide, despite the fact that it has nothing to do with acupuncture or laser acupuncture. We always think these children are a burden for their parents, for their grandparents, for their sisters, brothers, for the teachers, but the children don't feel well themselves. A fantastic method to come to the child's psychology is the so-called miracle family. So you tell the child, if you would be an animal, what would you be? What are the rest of the family? Here, the 7-year-old Dennis shows himself as a shark, even the white shark. He is attacking everybody in the family. The mother is the snake, the father is still a smaller fish, and the sister a very small fish. And after the therapy, half a year later, they all became almost the same. The father is the head of the family. The mother, him and the sister. Another, which is probably even more explaining the situation, the miracle family. How would you draw your family if you are all animals? This is the child with the hyperactivity. He's not connected with the family. He is flying all over this. He has no relationship to all these on the ground. The youngest brother is a small animal with needle-like shape. He is just almost like rubbish. And after the treatment, they all are grounded, they all are sitting on or at the same tree. They become united, they become a real family again. Yes, it is possible without drugs to achieve these situations. Yeah, we are coming to a slide we already had. I put here because it's for starting out with the treatment. When you all make Fritz happy and you all buy a laser pen, then you have to know in 2 days how to start. Ear points superficial, 0.5 up to 1, maybe 1.2 joule per point. The adults, 4 joule per point. In the children, preschool children, 1.5 to 3 joule. Toddlers, 1 to 2 joule. Newborn babies, 1 to 1.5 joule per acupuncture point. So the less pigments we have, the less thickness of the skin layers we have, the more superficial the chi flows, the less energy density we need to treat a point. And energy density physically is described, output power of the device in milliwatt by the treatment time over the spot size over the acupuncture point. So big gap. Outlook, what is the future of photomedicine? I think before we have time, if you have questions to the pediatric part, otherwise I will proceed to the end and then we will discuss questions about pediatrics. No questions. Everybody, not pediatric. No, then we make it in the end. Yeah, one of the things I hope I have all the slides that I wanted to present now. Yeah, must be. I always mention, look, I'm close to the speaker, I always mention I love to combine acupuncture, Chinese medicine, mitochondrial medicine if necessary, and this is a very bright view into the future. Any aging process, any inflammation, any chronic disease is associated with oxidative stress. And laser, we heard, can alter oxidative stress. Management of oxidative stress for cell therapy through combination approaches of stem cells, antioxidants, and photobiomodulation plus exosome therapy. Laser has the main target on the mitochondria. Stem cells are full of mitochondria. The mitochondria in the stem cell decide whether a stem cell can survive and replicate and replicate and replicate, or goes in the programmed cells or even into the necrosis. Photobiomodulation and antioxidant therapy leads to healthy, powerful mitochondria and leads to enhancement of the mitochondrial membrane potential, enhancement of ATP production. So in any inflammation, the combination of laser is very beneficial, and that brings back to your question. Yes, laser can even be combined with these modern techniques of regenerative medicine. What is the source of self-healing? What is the source of regeneration? It's our stem cells. Every organ in our body has stem cells, not that young and with the capability to become every organ. So a stem cell in the heart can only be a myocyte. A stem cell in the liver can only get to be a stem cell in the liver. But there are some more premature stem cells we find, for example, in the bone marrow. My dear friend Yuri Uron, I still hope that he will get the Nobel Prize for Physiology and Medicine. Irradiated with 10 joule per square centimeter the tibia bone, the tip of the tibia bone, the tuberositas of the tibia bone, and measured before and after the number of circulating stem cells. He measured the so-called CD34 plus stem cells. So what do you think? How big was the increase of stem cells measured in the bloodstream? 5%, 10%, 20%, whatever. First, this row, have a guess. What was the increase? This is follow-up study with different results. Otherwise, I wouldn't have asked. So you say 20%. This row, just irradiating this part of the bone with a laser, 10 joule per square centimeter. What was the increase of number of stem cells? He said 20%. Have a guess. I understood 82. I said, wow. Just have a guess. Maybe 50. So, next line. One guess from this side. How much increase in stem cells did he achieve? No, this follow-up study. I should put this slide away. Jakarta lady. Have a guess. 30. 40? Fritz left. He heard the lectures already several times. He should know. In these initial studies, he achieved an increase of circulating stem cells by 700%. The studies that we conducted with a more powerful device and not using like urea on a CW, but with a cell field, we achieved and published increase of 2000%. One single treatment. In this study, he focused on the effect, and he could show that it was not only a short-term effect, but the effect lasted for 4 days. So it's not temporary, it's the release of stem cells was increasing and increasing and increasing. In the initial studies, after 2 hours, in the animal model, to be fair, he did show increase by 700%, and this is human study, and this is only the increase in one of the patients. Yeah, this is our very easy to read, our publication. We used a specific laser device published in Springer, where we demonstrate an increase by 700, by up to 2000% with a cell field resonance. Well, it's nice to increase the stem cells, but the stem cells have to go to the place where they are needed. So in a further up study, he put artificial myocardial infarction in the animal model. You can't do in humans, of course. And half of the group was treated with the laser, and half of the group was non-treated with the laser. You see, in the control group without the laser, if the animals survived at all, there was all in the backside of the heart, fatty tissue, fibrous tissue, not existing movements of the heart muscle anymore. In the laser-treated group, it became little scarring, almost functioning group. Here in the slides, in the thin slides, only scarring tissue, almost normal tissue, very limited scarring in the tissue. And this is probably for me the most impressive slide on this topic from Yuri Uron. Only fatty, necrotic, fibrotic tissue, and in the laser-treated normal acting heart muscles, these animals were still able to run through the tumbling wheel, whereas the others hardly could walk to their foot to get their diet. And very personally, after one of my lecture travelings, when I came home after landing, I switched on my cell phone, and 24 missed calls from my mother. So I thought, wow, something serious happens. So I phoned her, and she said, very bad news. Yesterday evening, your father was brought to an intensive care unit. And I phoned the colleagues, the oncologist, the cardiologist, and the head of the ICU. And they said, to be honest, the next 2 to 4 days will decide whether your father will survive. He has a huge myocardial infarction. If he survives, he, like these animals, will only be able with guiding aids to go to the toilet. He can't walk longer distance anymore. And I told them, listen, I guess you never have heard about urea and about low-level laser therapy, and lucky me or lucky my father, they agreed and said, okay, if you agree me, it's a safe method, and if you sign, you take all the risk, then you can come. So I gave him one of my beloved mitoceuticals. I gave him by the nasogastral tube 2,400 milligram of coenzyme Q10, CoQ10, complex 3 of the respiratory chain, and did laser irradiation all over the tibia bone, not only the tuberositas, all the tibia bone. And then I irradiated the heart. And 2 days later, the cardiologist phoned me. I'm doing this now for almost 30 years. I've never seen this, such thing before. All parts of the heart start to pump again. Half a year later, they bought a mobile camper and went to Iceland and to Tunisia and Morocco and Israel and Jordania. They went to Greenland and to St. Petersburg, to Russia. So he really achieved a full recovery. According to the World Association for Light Therapy, these are randomized controlled trials in which the laser proved to be efficient. It's starting, I have to do it myself, with hair growth, traumatic brain injury, stroke, Parkinson, Alzheimer's disease, hearing loss and tinnitus, skin regeneration, beautiness. We heard about Roberta Shaw, shoulder neck pain, reduction of heart attack. I gave you the personal example. We talked about adipositas and laser lipolysis. All joints that get into arthritis, osteoarthritis of the hip, of the knee, of the Ritz arthrosis of the thumb, wound healing disorders we have seen. We discussed all the day that laser acupuncture can be applied. Achillotendinitis, fantastic indication. Muscle fatigue with all the mitochondria, fantastic. Carpal tunnel syndrome was the first medical improvement, FDA improvement in the United States. Lateral and medial epicondylitis, so golfers and tennis elbow. Non-union fractures. Mucositis, we heard it's even fantastic working in chemotherapy and radiation therapy. Induced mucositis. Density, pain, temporomandibular joint disorder. And then we come back to pain, stroke, TBI, and Parkinson's disease. And this was one of the questions early morning already. 20 years ago, maybe already 25 years ago, when I had my first laser pen, 40 milliwatt, yeah, it was the best on the market. It was great for many situations, for treating children, patients with needle phobia, some effect on small joints. And a few years later, Harvard medical school Michael Hamlin said, laser penetrates through the skull bone. Laser has an effect in recovery after traumatic brain injury. Wow. There is scientific evidence that when you irradiate with a laser, especially non-visible near-infrared, 808, 9 or 10 nanometers, you enhance what we have seen, circulation, lymphatic drainage. Of course, once you get the photons there, I can imagine that it will have an effect by enhancing microcirculation, lymphatic drainage, to reduce edema after traumatic brain injury. But what was striking for me as the studies from Yuri Uron, that he could demonstrate, irradiate with a laser towards the hippocampus, which is one of the most ancient part of our brain. We induce the new building of CNS cells. Well, you are most of all far younger than me. If I look on the dear colleague here, we learned in our medical education, once a CNS cell is gone, it's gone forever. Laser leads to new production of CNS cells. Laser leads to release of growth factors in our brain, the so-called BDNF, brain-derived neurotrophic factor. By laser irradiation, we can create new stem cells in our brain. This is my clinic in Portugal, and when you turn around, we have the fantastic view to the Atlantic Ocean. I think we have to get to targeted medicine. Whatever we do in medicine, we have to get to targeted medicine. And a conference in Taipei, evidence-based medicine, acupuncture. I think this is losing the treasures of Chinese medicine. In the so-called evidence-based medicine, we easily run into the risk that we put patients in a cupboard that we summarize. We always should find the root of the disease, whether we go with Western medicine or we go with Chinese medicine or Ayurveda medicine. If we have a patient with arterial hypertension, we have to see, is there a disbalance of minerals? Is he depleted of magnesium? Is he overloaded with potassium? Has he vitamin D deficiency and parathormone excess? We should find precision medicine, individualized treatment protocols. We should get the precise Chinese diagnosis. My approach, my personal approach, I love orthomolecular medicine in combination with Chinese medicine. We do specific tumor therapies, huge topic on its own. Sometimes we work these days with exosomes and stem cells. And in the end, if you want to leave a mark on this earth, then don't follow into the footsteps of others, but go your own way. So in this respect, I wish you great journeys in the fantastic field of Chinese medicine, the fantastic field of medicine. My wife always says, you are intoxicated by medicine, Chinese medicine. You can't even go to the toilet without a scientific paper in your hand. So, thank you very much for the attention, and the stage is open for you for questions. Thank you.
Question and answer?
Question and answer.
Okay, but first coming from Pak Willy.
Yeah, thank you, Dr. Weber. Very wonderful. Yeah, amazing,
Namaste.
amazing. Yeah. But I have several questions. I'm from Jakarta. The laser puncture you use for bilateral or unilateral? Because for the shoulder, frozen shoulder, you only use one side. Yeah. Is it can only use you can be used unilateral or bilateral?
Stop.
And then
Stop. Let's answer this first. Yeah, I may answer. I have heard as many approaches to Chinese medicine as I had teacher in Chinese medicine. So some people, and acknowledged people still say in the lady, they are dominant on the right side, you treat on the right side. The men are more left dominant, you treat on the left side. I think the basic idea of Chinese medicine is balancing. So I think quite often it's good whether you do metal needle or laser acupuncture, to do left and right side, to do distal and local ashi points, to do probably on the lower and upper extremity even. So I think balancing is very, very, very important. So usually I do treat on both sides. What I definitely recommend, don't go directly into the local points, into the ashi points, but treat first of all the distant points. And especially in the acute situation, I think it's very important to start with distant points before treating the most painful, the ashi points.
And the next question, because patients usually use essential oil or other, after that, can we use the laser acupuncture, laser acupuncture on the site? Already use ointment, or we have to.
There is some amount of additional absorption by essential oils. So I always recommend the patients, when you come in the morning, don't put it, you do afterwards. So it's not a game changer, but it does have some effect to avoid any pre-treatment of the skin.
And
so no oils.
Okay, thank you. And the third one is because in rubbing the meridian, can you use angulation so that for tonification we upward, directed upward, and then for downward, or have to be perpendicular?
Yes, the direction, angulation of the laser doesn't seem to have an additional effect like we know from the needling. Yes. So the best flow of photons is perpendicular. In any angulation, you will lose 1/3 or even more of the photons before you come into close to the meridian in the superficial skin layers.
Yeah, the last one is, can the laser puncture branch into two? Because only one, because electric acupuncture we have many leads. Yeah. Can it 2 leads at least, so we can directly wear it. Thank you.
At the best, you buy 2 laser pens, and if you have both sended, you can treat 2 points at the same time. No, there is at the booth similar a 12 channel by which you can treat up to 12 points at the same time. And again, one of my teachers is doing in and out technique. In no situation the needle stays longer than 10 seconds. He says most important, what you just said, is the injection technique, and he is convinced that our mind has a huge effect. He says, in addition to the technique, how you insert a needle, it's your mindset. So you bring part of your energy, of your mind. I want to disperse, I want to tonify. Yeah. No?
Excuse me, there is another question coming from Zoom. It's from Dr. Sutrisno. So he might talk directly with you through Zoom. So Pak Jul, silakan. Okay.
Can I make a question?
Thank you, thank you.
Dr. Weber's very, very excellent lecture.
Namaste.
Can you notice? I'm very sorry because in this science in sector, I am actually lazy. So I very sorry limitation of my understanding. But actually, in daily life, I perform research in basic science and biomedical, especially my research in endometriosis, fertility, and adenomyosis. But I saw in your lecture, every you mention something, you based on the foundation of the biomedical science, based on data, based on the molecular level. But I want to ask you, do you ever make research that use looks like randomized control trial? You perform with your methodology and compare with this standard therapy. But I am very sorry. Usually randomized control trial, we use the orientation of Western medicine. So that is new modalities. So we compare the gold standard, and then what happened then? The next, what happened in the with the new modalities, with the gold standard? Maybe, I'm very sorry. Next time, maybe we compare, for example, endometriosis. What the gold standard endometriosis? The standard therapy of endometriosis is gonadotropin releasing hormone to suppress the estrogen, endogenic estrogen in the body. Maybe you have compare your acupuncture modalities, compare with general organism, what happened. Something that is very, very interesting. This is from my point of view, I'm sorry about that. And secondly, I very frustrated. There is a disease that I mentioned as adenomyosis. This is ancient disease, but actually, doctor with frustration. Patient also very frustration. Every therapy that we choose always disappointed. Then we call it an adenomyosis. Maybe next time I want to try this methodology, this laser, this acupuncture into adenomyosis situation. I have many patients with adenomyosis. They are very suffer and very difficult to be cured, and in the end will come to hysterectomy, being operated, totally remove of the uterus. That's why I'm very interested with your data related with the heart, related with the obesity, related with orthosis. This is actually very important point of view. So next time, maybe we can try the adenomyosis protect. Thank you. I'm sorry about this, my comment. Thank you very much.
No, thank you very much. First of all, I agree 100%. It's nice to have randomized controlled trials against placebo, but of course, next step, if you have a good working gold standard, you have to compare against the gold standard, for sure, 100%. But when we look, for example, last thing, traumatic brain injury, I'm an old guy, so I was involved, I don't know, 38 years ago in the studies on traumatic brain injury, where we gave high dose of corticosteroids, and in the end, they eased it off. It's not part of treatment protocols anymore. It didn't give any good results. So there is difficult to have a comparison for this. The other things, uterus myomatosis, I would say I only get good results with laser only in maybe 20-25% of patients. So I wouldn't think this is the tool for the laser, but in combination with certain herbal remedies, we quite often get, I would say, up to 50-60% operation can be cancelled. Yeah.
Okay, thank you.
Thank you.
Thank you. So carry on. Is there any question?
Thank you, Dr. Weber, for the lecture. I want you about the dominant side for the organ. You said before the stomach is in the middle, on the middle of our, and the knee is on the both side. So I need another more explanation about that. Second one is about the low laser therapy for stroke treatment. Is it you have any experience in CVA stroke with a consciousness problem? Usually we don't do the operation. Do you have any experience using low laser therapy for this kind of patient? And number three is
stop. They are so different topics. We answer one after the other. So, coming, for example, of osteoarthritis, most of the time both knees are affected, right more than left or the opposite side. If the right is more effective, I would treat the ear point on the right side. If left side is more affected, I would treat the ear point on the left side. Or if both are severe affected, I would treat both points. But with the ear acupuncture, to my opinion, we very effectively can reduce the pain, which is a patient that comes, I have difficulties to walk, he mainly wants to get rid of the pain. It's already fantastic to reduce the pain. But my aim is to go further, to enhance healing processes. So, of course, stomach 35, the outer eye of the knee and the extra point on the same level. Stomach 36, maybe gallbladder 34, Yang Lin Kuang are fantastic with the metal needle, but with the laser, especially with the stomach points, I irradiate directly into knee joint. I enhance the production of hyaluronic acid. I enhance the regrowth of cartilage in the joint space. I enhance the chondroblast. So I have directly effect with the local laser irradiation. So in acute pain situation, ear acupuncture perfect. But if you have damaged tissues, I would always irradiate, in addition to the ear points, the local area. Does this answer your question?
Yes, thank you.
Yeah. And the second question, in Taiwan I had 3 hours and it was just summarized on treatment ideas, strategies on traumatic brain injury, and covering the stroke topic a little bit as well. Laser has been used in all forms, in the primer thrombosis, in the embolic, and in the bleeding stroke. So it can be even used after the acute bleeding situations. It goes very deep into transcranial photobiomodulation. It goes far ahead than only applying acupuncture. The initial studies were conducted from the team around Michael Hamlin in Harvard Medical School. He got a grant from $100 million US for studies, because for the US Army, soldiers suffering from traumatic brain injury are one of the highest financial burdens for the US Army. And he started with a small animal model, screwed the animals in a fixer, and with 10 kilopoint induced traumatic brain injury, most of the time even ruptures of the bone, fractures of the skull bone, and without laser by day 10, almost 80% were dead. With the laser, more than 90% were still alive. And then he looked which resonance is the best, and he found out that 10 hertz is the best resonance. He investigated for the best wavelengths, and he found out 808, 810 is the best. I contradict him. It was fantastic in the mice. In our studies, the 910 was far better than the 808. What is still, it's the leading studies in this field. He has no ideas about resonance therapy, about acupuncture, so he just irradiate by random. Continuous wave, 10 hertz, 100 hertz, and 1000 hertz, and high significant, the best outcome was with the 10 hertz. Why the 10 hertz? There are only hypotheses. Most likely it's because 10 hertz is the meditation mode of our brain, is when we do progressive muscle relaxation, Jakobsen, when we do autogenous training, our brain goes in the 10 hertz, in the alpha rhythm, the gate of consciousness, the whole metabolism of the brain is reduced. So most likely this is the pathology or the effect behind it. It does have 10 hertz influence on the ion pumps, the sodium potassium pumps as well. Maybe this is even more important than bringing the brain into a more resting stage. What we demonstrated in our study in healthy students, we irradiated gallbladder 13 in the prefrontal cortex with the 910 nanometers, and this had the much more rapid, much more pronounced effect in EEG recordings than the 810, and we could show within 10 minutes the whole front part of the brain went into 10 hertz, and within 20 to 25 minutes down to the occiput, all the brain went into this relaxation mode. Of course, in a quiet room, if you would put the students on the cell phone, you would ruin everything again. So they left in a quiet room for half an hour, and then we conducted before and after concentration tests. They had to fill 4 sheets, B, 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 D, B, 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 B. They had to uncross all the Ds, and significantly they were better after the transcranial laser irradiation. But there is, even on cellular level, there are differences between 808 and 910. They have both target on complex 4, but have different effects. Complex 4 is not complex 4. It's in our body in the oxidized and reduced form, but this is really maybe in 2 years after having been here for 4 times, we can discuss the details, or we make a special course on transcranial laser irradiation. Okay?
Okay.
Third question.
The third one is, when you cure patient, nowadays there's a lot of household devices that they have frequencies, like a smartwatch, cleaning household.
Now, Iskan, I think I know what you want to ask. What do you think about this home care devices?
Yes.
First of all, 9 out of 10 are not laser, are LEDs. These light emitting diodes in the laser, I think it was not in this presentation, laser light has almost only one single wavelength, whereas the LED, for our eye, it looks similar. But the LED has bell-shaped wavelengths. So it's not only 8 to 8, but is from 860 to 950, 920, the irradiation range. And moreover, it's non-coherent light, so you don't have, even if it starts to blink, the resonance effect is, I wouldn't say not existing, but it's very limited, very limited. So with an LED, you can't do real resonance therapy. One other trick of many devices is they have a laser like this, like the pointer, 2 milliwatt, and 500 milliwatt LEDs, and it's a laser. Yeah, it's a laser, but the irradiation comes by the LEDs and not by the laser. One last thing, in Kuala Lumpur, there was a colleague from Egypt. He said, I brought from China a laser pen for 200 euros. I said, impossible. Impossible, even if the company would produce without benefit only the laser diode with anything of 200, 400, 500 milliwatt. Only this diode costs 200 euros. It's impossible to create a device for this. But yes, I forced RJ, Reimers and Janssen to produce for me 20 milliwatt laser pen for home care. So when I'm traveling so much of the world, I do have some staff who can perform the work, but many patients come from Australia, New Zealand to Portugal, so they get this 20 milliwatt device, and according to their disease, asthma, COPD, they come with a cell phone. We make a film about the acupuncture points, and this is, I have to be finished with the treatment in 50 minutes. If for them it takes 40 minutes to treat, still they can sit in the nature, drink their tea while they are treated. So it's working, yes, with those low power devices as well.
Thank you, Dr. Weber.
You're welcome.
Thank you. Okay, so now let's say hello to those in the Zoom. And these are the questions. Some of those are coming from here as well. Boleh di point out mana yang mau di ini nggak? Mungkin di.
Can the RAC technique be used directly on the acupuncture points, not on the ear points? Of course, any given point on the body, not even acupuncture points, other points of disturbance on the body can be detected by the RAC under the use of the laser. May I ask, Doctor, in the concept of acupuncture, there are stimulation techniques, especially in the biomolecular approach. Is the principle of laser acupuncture the same as the acupuncture needle stimulation technique? Is this biomolecular? There is a primary stimulation system, cell signal phase, and activase phase, which ultimately stimulates the organ. There are, for at least 2 decades, I'm lecturing and attending so many conferences. I would say I've heard as much explanations about acupuncture, how it works on the point. We know very well how it affects the central nervous system, as I have attended conferences. I think nobody can claim, I know how acupuncture on the point works. One of my first invitations to Taipei was 15 years ago, and in the afternoon or in the evening, I was invited with all these highly decorated professors in Rose Garden. I still have in mind Rose Garden restaurant, and they introduced me. This is the world authority for pediatrics. Nobody in China, not all the world, has so much experience. And I said, Dr. Weber, I got a copy from your book. I attended all your lectures, fantastic lecture. But what you are doing has nothing to do with acupuncture. And as I told you initially, I don't claim to have the truth. I'm open for discussion. So I said, maybe I get fantastic results. What is your concept? How does acupuncture work? And I personally believe, I can't imagine, I don't think it's true. He said it's a pressure effect. By inserting a needle, I have a pressure effect on an acupuncture point. I somehow doubt to have distal point and pressure effect for this field, but who am I? Maybe it's true, I don't think so. I told him, listen, I may give you one example. The day before I departed, I got a transferal from Kiki. You sent me, I think 12 or 14-year-old guy diagnosed for autism. He came all the way up from Cologne, not far away from the place where Kiki is living. And it took the three times to bring the young, the adolescents is the term, the adolescents to my clinic. And when he came, he had Tolstoy under the arm. So he had tested IQ, I think, of 156, reading Tolstoy in Russian, the most difficult author, and then in Russian as a German guy. And he, the online people can see me. He was sitting like this. Earplugs, coat, cap. I couldn't touch him. So I told him, listen, I won't touch you. I will ask your mother to take off the shoes and take off the socks. I think definitely it's liver stagnation or gallbladder excess. So I went to the Taichung, the liver 3-point, and while I was treating the point, I was afraid about the expensive laser pen. I saw that the mother started to scream. While treating, he totally relaxed. The hands were white for stress, not even blue, purple, white. He totally relaxed. Mother asked me, how long do you have to come? It's 2.5 hours to drive to your clinic. I said, listen, what I always say, Chinese say the treatment of a medicine, of a disease, takes as long as the disease existed. How can we do so often? You have to come. Well, if you possible, first appointment once a week, not longer than every other week. I prescribed herbs, and after 6 treatments, she sent me an email. It's still on my computer. You cannot imagine, for the first times since 3 years, he left the house on his own, without earplugs. And when I've been out. But I don't need these earplugs anymore. And after, I don't know, a bit more than half a year, he was willing to go to regular. Long before Corona, he got the permission to get home online teaching, long before Corona, when it became popular. And the professor said, yes, you're right. This is touching the chi. I'm convinced laser is touching the chi. To answer this question, it's totally different than the metal needle. If I would answer with the ideas of Fritz Albert Popp, I mentioned several times already today. He claims the working principle of inserting the needle is, by inserting the needle, I kill thousands, maybe 10,000 of cells, and the dying cell or the injured cells releases a laser-like impulse, and this is conducted to the meridians. I don't know, maybe it's the case, but he has some evidence that the meridians are like highways for the distance cell-to-cell communications, like photon highways, light highways. Could very well be. Yeah, from what I've learned in the DAA, the biggest association for medical acupuncturists, for MDs, the idea of Professor Barr is we have gold and silver points. In points with deficiency, I use a gold needle. In point with excess, I use a silver needle. So he claims that gold and silver have an important effect on each acupuncture point. So there are many concepts, and I think you cannot compare one by one. They have different targets. So every comparison is not perfect, but I may answer in that way. If you want to go from here to Jakarta, you may do it with a bicycle, you may do it with a motor roller, you may do it with a car, or you may do it with a plane, and of course the laser is the plane. What is the difference if we give photon or laser in acupuncture point and non-acupuncture point? Any area that I irradiate have mitochondria. Any area that we irradiate absorb the photons. In any area I will have biomodulation, biostimulating effects. In the laser acupuncture point, as I just explained, or my concept, in the laser acupuncture point, the photons get probably deeper, and the photons are rapidly conducted into distant areas. So if there is tomorrow anybody who has acute nasal obstruction, treating these 3 points within 15 minutes, 10 minutes, most likely it will open up. So to answer, I think in the acupuncture points, the photons are transducted into other areas much more rapidly. Some points have 2 directions or therapeutic effects, namely tonification and sedation, for example. Liver, large intestine 1, Hagu, can regulate the direction of energy upwards or downwards. For example, stomach 30-25 in the area of the navel. How do you set the acupuncture laser pen specifically at this point? Have 2 directions of therapeutic effects. Well, I would answer there are 2 things. The one is the resonance with Noge A. I have a more dispersing effect. With the Noge B, I have a more tonifying effect. And the other answer is, if I want to bring the stomach chi downwards, I would use the laser with the stroke from cranial to caudal, following the flow of the meridian. When I want to tonify, I would more go, as I said before, maybe first of all treat Pishu Weishu and then check, is there any blockage all around? And then I may do meridian massage from Ganshu down to Pishu, or wherever I find a change in the pulse wave. Can laser acupuncture be performed on the Dumai meridian from the top of the head to the bottom, especially for those suffering for pinched nerves at L2 and sacral 2? Is it safe? I'm not quite sure why you want to do so. The flow in the Dumai meridian is from the sacral region up to Dumai 20 and meeting the conceptual vessel in the area of the tongue. So in this situation, I would always do the opposite, do the meridian massage from distal is the long point, from caudal to cranial. And yes, I have many patients with pinched nerves in any region, tethered cords, where I get some good results, sometimes fully recovery with the laser. Yes, it's definitely safe. Talking about class 3B laser. For class 4 laser, the head points, the points irradiating the brain, are a no-go. Small children have the characteristic physiology of a body that is pure, exactly, yes. If the organs are still young, the chi is pure and easily leaves its path. The digestive system is not perfect yet. Yes, of course, the mother nourishing the baby during all pregnancy, the spleen didn't have to act until the baby does the first cry and drinks the first mother milk. This is the first point that the spleen really has to work. The pathology characteristic of changes occur quickly, yes. And the characteristic of the therapy, a small dose can already cause changes. Yes. How to adjust the dose of laser acupuncture for hydrocephalus children who have a stent installed and are already and are experiencing 5 slowdowns. This is an interesting, huge new topic. Definitely the patient with hydrocephalus can be treated. So the stent, which goes either into the heart or into the abdomen, these drained hydrocephalus children can be treated with the laser. The possible adjustment of the dose, once again, if you are capable to do so, should be performed with your thumb under the RAC control. Okay. Can laser acupuncture be used every day to maximize therapy in severe stroke cases? Is it safe? They are not interested about acupuncture anymore. They are going deep into photomedicine.
That's great.
All questions, fantastic questions, and I'm more than happy that all these questions rise up. I was thinking just this second about our discussion in the morning. I told her what I've found in many Asian peoples, especially in those in Thailand, they are a little bit shy. They don't easily ask questions. So what I did 20 years ago, every student got a pile of cards where they could write the questions. And When I asked Eniko, no. But when they had this in the break, I got a pile like this of questions. And she said, we give them the chance either from the audience or online to ask the questions. I said, wow, this is the modern answer. I'm getting old. I still would have dispelled these cards. Okay, yes. Fantastic. This is one of the questions again from Michael Hamblin. We didn't do a group photo. Now many people are already left.
Exactly. We actually already running out of time.
Yeah, I know.
So, yeah.
Yeah. I told you, if you give me a microphone, I will never stop. You have to tell now. Time is over.
Yes.
To answer at least this question.
And one more from Pak Kiki. One more from Pak Kiki. So after this one.
Okay, whatever you
right.
think. They induced this traumatic brain injury. Treat within, I think it was 1 hour after the induced traumatic brain injury. Wow, highly significant increase of survival rate, regain of motor function, cognitive function. So they treated a second day. Wow, even better. So that is 3 days, treated better. Treated 10 days, it almost went back to baseline. So, acute situation, treat for a few days every day, perfect, but photons can get stored to a certain amount in the microtubuli, and if you dose, over the time, over the days, there might be an overdosing. Yes? Don't treat most of the disease every day for 2, 3, 4 days, fine, but then don't treat further every day.
Yes, Pak Kiki, silakan.
Saya nanti didiskusikan baik-baik saja sama Pak Sutrisno supaya yang lain kalau pada kesempatan. Halo?
Iya, Pak Kiki.
We can hear you.
Saya diskusikan nanti sendiri saja sama Pak Sutrisno supaya yang lain pada kesempatan.
Oh, baik. Baik, Pak Kiki. Jadi tidak ada pertanyaan ya? Okay. Later, Mr. Weber, he'll discuss this one with Dr. Sutrisno, the guy who asked you.
Ik wil graag met Ibu Ate noemen, dus dat is zo speciaal discussiëren.
Good. Danke.
Okay, terima kasih Pak Kiki.
Ja, vielen Dank für das Dabeisein von the beginning to the end.
Okay, so another more question, or you wanted to resume and say goodbye to the participants?
You are the boss.
Okay,
I'm only invited speaker.
Tomorrow is still a long day, so I think it's time to close the day. Okay, you want to say something? For those who will have only this session.
Yeah, where to start? First of all, as I said in the beginning, no, he's gone. Thank you very much for Kiki. You are the power behind it, why I came to Indonesia. Without you, I would probably, I wouldn't say never, but for a long time wouldn't have found the way to Indonesia. Secondary to your dear friends who did all the organization, who brought me safe from the airport in Jakarta to Solo. And yeah, I think the most important take-home message is stay open-minded. One of my teachers in Chinese medicine, I went on his nerves talking about the laser. He said, I told you gentle needle technique. I treat children, they don't scream when I insert a needle. And 15 years later he said, Michael, I will visit you in Germany, I have to learn laser acupuncture. I said, no, I will come and visit you, you are my master. I said, no, this time it's the opposite. You are my master. I want to learn laser acupuncture from you. And he was needling for more than 35 years and changed, not in every situation, in many situations, to the use of the laser. And I think if we have 30, 40 years of experience and then go into open-minded, into a new field, this is showing flexibility. This is transcranial laser therapy showing neuroplasticity. Laser induces new CNS cells. Never, ever we would have thought this 40 years ago. Once you get a new idea, you have to share ideas. Good ideas that you keep on your own and don't share with others will resolve and patients won't benefit. And of course, I love to share ideas with you, but in the end, why I come is the patient. And I hope that this fascination for the patient, whether using the laser or twinner or cupping or metal needle, I hope it will always persist for you. Then you can persist to be a good doctor. So let the mitochondria of your patients shine to the benefit. Bring light to your patients. Thank you for coming.
Thank you very much, Dr. Weber. Silakan Ibu Imro.
Ya, luar biasa Bapak dan Ibu. Sekali lagi berikan tepuk tangan yang meriah untuk Dr. Michael Weber. Baik, Bapak Ibu, tidak terasa waktu sudah menunjukkan pukul 17:10. Agak panjang sedikit tetapi luar biasa. Ternyata belum selesai pertanyaan-pertanyaan yang masuk, belum selesai dijawab, tetapi ini menandakan bahwa kita selalu semangat ya dalam belajar terkait ilmu akupunktur, laser akupunktur. Nah, untuk hari kedua besok seperti terjadwal yaitu praktik dan demonstrasi, silahkan Bapak dan Ibu datang seperti waktu yang sudah terjadwal. Tetap semangat, belajar, dan sampai jumpa di sesi berikutnya. Kita akhiri billahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih Ibu Bapak. Hati-hati perjalanan pulang. Jangan lupa yang besok untuk
mau dikasih pengumuman Bu Uli.
Untuk yang peserta besok hari kedua jam 8 pagi mulainya ya. Yang sudah mau kembali ke rumahnya untuk peserta hari pertama, terima kasih banyak. Hati-hati di jalan.